coming down the mountain.
We on? We're live? All right, here we are. Talk to me, Johnnie live. We are coming to you from Power Athlete Headquarters. I'm here today with my good friend, Dr. Thomas Incledon, and this is the next installment of Talk to me, Johnnie live. Welcome. So, Doc, here to the internet audience, thank you for coming into Newport Beach and sitting here and so bright and early, but it's been unusually hot here and it's kind of hot in our office, so we decided to come early and just have some fun. So, what's up? So you drove in from Arizona, everything, you had a bit of a harrowing experience?
Yeah, it's about a 6-hour drive, and out of those 6 hours, we had another 3 hours sitting in traffic. It was a major car accident. So 9 hours altogether, with a 9-year-old in the car who every 5 minutes is going, when are we there?
You know, oddly enough, I recently saw you over in Scottsdale, and I picked up my kids and my wife and the baby, and we actually drove. And surprisingly, I've been having pretty good luck. I can make it actually from my house to your office in under 5 hours, maybe a little over 5 hours. But I also, anybody that's ever driven with me, my whole driving persona and really my mindset when I drive is, those of you guys have seen Pulp Fiction, the wolf. The wolf is my model and everything. Be like, oh, it'll take 50, it's 30 minutes away, I'll be there in 10. And so, whoa, and we just roll. And but I have a little more expectation because knowing my kids, we have TVs in the truck that like fold down so the kids back there. But oddly enough, every 20 minutes, are we there yet? Are we there yet? And like, it's almost like a movie. And you're like, holy shit, like I've seen this on movies, and you're like, ready to smack the kids to the point where you're like, So you guys come in, you're going, not only you came in for Talk to Me Johnnie live, but you roped them and sent them to Disneyland today.
Yes, I did. I wanted it, in my mind, the mind of the male. It's like, hey,
That's the small reptilian mind.
Yeah, I got to surprise my family and do this wonderful gesture and send them to Disneyland. I didn't realize that was like going to be the equivalent of like a bomb of chaos, things blowing up.
Last Christmas, my brother and my sister-in-law and the kids, they all wanted to go to Disneyland. So there's a deal where if you stay at one of the Disneyland hotels, they will let you into the park an hour early. And so you can like hit all the rides and do everything. So I take my kids and my wife and we go over, and it's like right before Christmas. So we stay at the hotel, we have this like a nice dinner, and all of a sudden we're gonna get up and we're gonna get early park entrance. We wake up, and those of you guys who are from Southern California know it rains here like once every 20 years. We get up and it's literally pouring rain. And so like we don't have any rain clothes, so we're out there like basically like trying to like steal trash can liners to make, but we end up finding like ponchos. And we go out and it's, we're on the train 6:30, all of a sudden we're standing outside, pouring rain, 7 a.m. We go in and open the park. We went on every single ride from 7 to about 8:30. And all of a sudden, 8:30, we started seeing people come in, and we started hitting more rides and doing everything. By probably 9 or 10 o'clock, all of a sudden it was like, 3-hour lines everywhere. But we had gone and seen the entire park. So if nobody's at the park for that extra hour and you stay at the hotel, it makes all the difference.
Oh yeah. Something to keep in mind. I did something similar. I had a lecture at a pharmacy conference for pharmacists in Orlando. And there's, I guess, Universal Studios or something, and there's like Superhero Island. So it's got like the Doctor Doom ride and Spider-Man, all this other stuff, and Hulk. And so one of my buddies, he's a videographer, so we're both in our 40s, right? 2 adults. I'm like, dude, there's Superhero Island over here. So we could get up early, we could do this, and we angle this deal. And we were literally, the instant opened up, we're there. We hit every ride at least once, figured out what we really like, and then when the crowd comes in, you have those speed passes that you use afterwards. We use a speed pass, now we're hitting some of these rides a second time around, and then we realize, like, you could literally just like walk in backwards on the exit, and you're back on the ride without a speed pass. Like, it's like there's not really a very effective security system here. We cracked it.
So you guys effectively hacked the system on how to go?
Yeah, we hacked the system.
You guys didn't fight any alligators or anything, did you?
No. I tell you that story though about me and one of my buddies driving we had no money, we were poor college kids, and we were driving to see if we could wrestle a small gorilla for money. And this is an old spring break story.
Okay, so you and your buddy are on the lam trying to wrestle gorillas for
Well,
money.
okay, so it was a spontaneous journey again.
You're a spontaneous guy.
Yeah, I am. So basically, all my buddies at Penn State go away for spring break. I was going to go with one group, but they're going to pile 15 guys into one car. I'm like, man, I don't want to be sitting in the car with 5 or 6 guys on top of me while we're driving.
All eating high protein diets.
Of course, driving from Pennsylvania to Florida. So now I'm on campus, and it's a ghost town. It is so dead. I'm like, this is just too quiet for me. I'm a social person, you know. So I call my one buddy, go, Phil, man, let's just head down to Florida. 'Cause his brother has a house there. We'll do some spring break. He's like, man, I can't do it. I got to work. So I said, all right, you know. So I literally, and this was back when they had, you know, regular phones with landlines and the cords and all that, and the little circular dial. So I hang up the phone.
Rotary phone.
Rotary phone. That's how old this story is. So I hang up the phone, and as my hand is coming off of it, it's ringing. Like, what else calling me? There's nobody in campus. I pick it up. It's my buddy Phil, and he's like, hey, I called in sick for the next 2 weeks. Let's go to spring break. And I'm like, Phil, there's no way you hung up with me, called your boss, told him you're sick, and called me back. Yes, there's just no way.
He's like, I use mental telepathy.
So, now, Phil and I are in the car. We're driving down. Again, spontaneous now. No money, no food, no gas. So we get fairly far, get to North Carolina, no money, no food, and we're like, man, we got to know somebody in North Carolina that can help us out. So we remembered a coach that used to coach us years ago. So if you can imagine, 3 o'clock in the morning, we're knocking on doors, find our coach's house, so without an address or anything. I said, Coach, we got no money. We need some money to get all the way to Florida, get some bucks. We go down. We're eating fried pork rinds and stuff, you know, at the fast food gas station.
Which is really the breakfast of champions.
Yeah. So I'm going to get there, and also we see the sign, Wrestle Gorilla, win $500. I'm like, Phil, between me and you, we could kick this gorilla's ass. We could do it. So we get in, and it's like, you follow like this, these signs, and you're kind of like, it's like going into like a hidden swamp area, you know? You're like in the woods and everything. So it's starting to get like a little bit like, this is getting eerie. We get there, and there's like this, I don't know what you would call it, like animal cage. There's people around, there's some guy, kind of like a circus tent act type guy, talking real loud and everything. And it's a small gorilla. I want to say maybe the gorilla is 240, 250 pounds. It's not a big gorilla. And it's sitting there, it's got a muzzle, and they said something about, I don't know if they declawed it or whatever they did, they cut its fingernails, just sitting there. And the guy starts saying something, and this big jack dude, like a bodybuilder on steroids type of guy, says, he goes in first, and he starts pounding this gorilla in the head. Boom, boom. And the gorilla just sits there, doesn't do anything. I didn't even think it was alive at first, because I didn't even see it like have a facial reaction. All of a sudden, the trainer blows this whistle. The gorilla gets up, takes this guy and tosses him. The guy's screaming like a girl, get me out, get me out. Look over at Phil and go, just say go to work, man. And so we get back in the car and keep driving. So that was our gorilla story.
Oh, nice.
Yeah.
Anybody that's ever driven from actually Pennsylvania to Florida knows you take 95 and you see nothing but south of the border signs.
Oh yeah, right.
So because I used to live in Tampa, and then I would drive back when I played for the Eagles, and so I'd cut over and then go up, and I drove up 95, and I remember like at one time I was like, I'm only going to stop at Waffle Houses, so which meant I was fasting, because after one stop at Waffle House, you're like, oh, I'm so sick. But I would always stop at south of the border, and because of the signs that you're like lured in, and you're like, I got to buy something from this shithole, and I'd always end up buying like fireworks and some weird keychain. But south of the border was always the spot. The surprisingly though, what always kind of tripped me out in that story recently, where that poor kid got snatched up by the alligator. I lived in Florida, you lived in Florida, and I remember driving across Alligator Alley and seeing these 18-foot, alligators literally on the side of the road, and you're driving and you're like, holy shit. But then, you live in Florida. I mean, I remember there was a van in my neighborhood that drove around, and it was their whole business was getting alligators out of pools. If you have a body of water and you don't have it fenced in, you're gonna have an alligator. I mean, there was an estuary behind my house. They told me don't let your dog run. There's like these monster alligators down there. So I mean, if you're in Florida and you don't go to open water, like it's just poor planning by that dad.
Yeah, we had I had friends, that were typical musclehead guys. that would get raw chicken and put it on a string and throw it out and pull it through the water, see if they could bring some creatures up. And I was like, dude, what happens when it does come up and it pulls your ass in?
Yeah, dude, it's a scary deal. So, what do you want to talk about today?
Well, you mentioned stem cells, mentioned cartilage.
Okay.
Start there.
Well, let me. Well, one, I'll give the audience a little history on you and I, and then I want you to kind of give your CV and talk a little bit about it. But I met Tom early in my NFL career through another individual that was a good buddy of ours recommended, and I actually met Tom outside of the Comedy and Magic Club in Hollywood. I'm sure that you guys have read somewhere, I talked a little bit about it, was when I went from Philadelphia to Kansas City, they had me staying in this hotel. And from the day I walked into the hotel till the day I left, I was like violently sick. And I couldn't figure out what was wrong with me, so I went to the doctors, the team doctors, couldn't tell me what was wrong with me. At one point they suggested I might have leukemia. They didn't know what was wrong. And so I called a good friend of mine, and I was like, dude, I think I got leukemia. These doctors don't know what's wrong. Like my whole body's breaking down. I can't run. I have all this ache. I can't sleep. I mean, my whole body's falling to pieces. And so he's like, I know this doctor who works with cancer patients. And so he recommended Tom. So I called Tom, and he's like, I'm happy to be in LA, and I was in my parents' place. So I drove up to Hollywood and met Tom outside the Comedy Magic Club. And he's like, you don't have leukemia, but come out to my house, come out to my clinic is what he said, and I will take a bunch of blood and we'll figure out what's wrong with you. So a couple days later, I jump in the car, drive to Arizona, get this address, and I'm thinking clinic, and I pull up and it's Tom's house. And he was working out of his home at this point. So we go in, and like, this is probably one of my favorite moments of Tom. I walk in the house and there's cat pictures. like family portraits, right? But of cats. And I'm like, this is fucking like the crazy cat lady guy. And so Tom and his wife at the time had a couple cats and them kids. And so they had like different family photos of their cats. So which I thought was odd. And then I walk in.
Dude, I've always been odd though.
I know. That's part of the course. But here's the best part. I walk in and there's your kitchen, and Tom has this huge fucking island, this big kitchen, and I could not see any counter space.
It's all tubes.
Because there was nothing but supplements there.
Oh, supplements.
There was literally hundreds of supplement bottles packed. I mean, it looked like GNC vomited in Tom's kitchen. And like I come in and Tom's like, do you want supplements? So of course I'm like over there just like mixing and matching this protein. And so we sit down at his kitchen table and he proceeds to take 40 vials of blood off of me. I mean, it was to the point where I was like, is this guy a vampire or is he just fucking up?
Yeah.
And so he takes all these vials of blood, processes them all, and we talk for a few minutes and he goes, I'll hit you up when I get all the information back. And so I take off, and calls me about a week later and he goes, hey, I got all the prelims in. And he goes, you don't have leukemia, was the good thing. The bad thing is that for every type of mold that you tested, I had toxic levels of every type of mold.
To this day, you still had the highest, let's say, positive antibody counts to molds of any person ever tested. But I have drawn more than 40 tubes of blood from other people, so you're not number one.
Dude. So I have this high mold, and you prescribed a bunch of antivirals. We did a bunch of IVs. We did everything, and like in a matter of like about a week, I instantly felt better. And at that point, we started doing the supplement packs and the blood testing, and I realized as an NFL player, the team wasn't going to look out for me. So you almost need somebody like a Dr. Tom in your corner, because I would show up twice a year at the end of the year and before every year to get blood work done. You put your supplement packs together and like really looking for how to mitigate performance, because, and I think people don't really give a lot of faith in terms of like micronutrients.
Yeah, because it's, when I learned this actually, I was doing some business with a major, let's say a supplement store retailer.
Sure.
Well, actually, technically we're in negotiation. No transaction actually happened. One of the things that came out of that is, people are always looking for the next greatest thing or the new shiny object. So if you were to take something like ginseng, which is an herb that's been around for like forever, you could buy garbage that's like $2 a kilo, and you can buy ginseng that has active constituents capable of fighting different types of cancer cells, and that's 1,200 kilo. This is at the manufacturing level. So by the time that goes out and goes forward, and now you've got a product to retail, there could be a huge discrepancy in the price But for the average consumer, they're going to look at the label and it's going to say ginseng. They're not going to know the details about standardization for ginsenicides and things like that. So what the retailer had said to me is, well, we've seen these names before and we're not going to be able to sell this stuff. I'm like, but what you sold before was garbage. And no one tested or evaluated it. And what I learned from that is, a lot of stuff that could be effective or effectively utilized just isn't, because everyone's looking for something new.
Sure.
Instead of learning how to use what's already available, in a better way or something. Yeah.
Well, the supplement industry, we can rap about that all day long. I mean, that's really been like your forte, and I was pretty uneducated consumer before I met you. I mean, you go in and like when I was in college, we were so broke. I lived like below the poverty line that we were convinced that we could go get food stamps. So, as you know, being a poor college student, so we never took any supplements. I remember the day that the strength coach bought creatine. And they were giving us creatine, and like it was awesome. You got a box of power bars and a bottle of creatine, and I had taken creatine from Zangus's place at Marathon, so I knew about it. And that was the only supplement we took. And like so today when people ask me about supplements, I'm like, dude, you got to remember, like Kazmaier and those dudes weren't really taking. I mean, they were taking other supplements, but at the end of the day, it's about food and training and all that. But I didn't really know much about the supplement deal until I started talking with you and like understanding that like not all supplements are created equal. This supplement might say it has this, and there's a good chance. I mean, how much testing have you done over the years on supplements that that says you have one thing in it and has nothing of what they say is in it?
Yeah, we've probably tested thousands of products, literally just walking into the store, buying them at retail. Because we learned early on, if I test something at the manufacturing site, that may not be what the consumer is actually getting. So you got to literally go to where the consumer is buying a product, buy it yourself. So you're paying way more than you probably could, right? And then testing that, and there's a lot of variability, And one of the questions I would get asked is there a brand you recommend? And I'd love to be able to say, hey, I recommend company X or whatever. But what would happen is, as we would test something, they would have one product that was perfectly to spec, have another product we would test, and it failed. It didn't meet label claims, or it had contaminants or some other heavy metal residue or something. So it became real difficult. So early on in my career, when I would lecture about our testing of supplements, people would say, what should I get? And I would say, don't take anything, because I couldn't find one single thing that brand-wise. And we didn't sell supplements at all back then. We didn't do any supplementation with any clients because it's considered like a conflict of interest. So if I'm doing the research and I'm selling you the supplement, or if we have medical doctors are testing you and they're recommending the supplement, it's kind of like I'm trying to make up what you need to sell it to you type of thing. So
well, I mean, isn't that what people do now? Being like, I've done all this research and here's my supplement.
Yeah. Well, what's happened now is like the pendulum has swung the other way. Now everybody wants to justify why you got to take stuff, and they twist the heck out of it. So a common thing, we mentioned creatine. So there's maybe a few number of companies have actually done research on creatine monohydrate supplementation. And from those few companies, all the other companies take their studies that were published and say, hey, creatine works, even though they may have 1 gram when the study used 20 grams or something like that. So we call that extrapolation, right?
Sure.
You're just taking something and applying it in a way it probably wasn't meant to be.
Well, and also they fucked up the creatine market by offering like 400 different types of creatine because they're always trying to make it more expensive. When people ask me, I'm like, just take the basic creatine monohydrate, find a fairly good reputable company. I mean, I know when you would send me my supplement packs, you would pull, and you still do, pull from every company out there, and like, I like this, and that, I think that's what's really nice whenever people ask me about, what supplements you take, and I'm like, honestly,
everything.
Well, I mean, it's kind of a mixed bag because I'm like, hey, the only person that I trust when it comes to like supplementation and really this type of stuff is Tom. And everything that we do is based off of micronutrient blood testing. So we get our blood work done, we see where we're deficient, we put supplements together, we take them, and then we retest them, and we see if it made changes. And if there is a change or there's not a change, then we have to go back and reevaluate. And I was like, that's the only way you can effectively do this, opposed from what I call the shotgun method. Hey, I'm taking this supplement, you should take it too. Well, how much? I don't know. And it's like, and we've talked about this. I mean, the recommended dose is sometimes not enough of an available dose to even make a difference.
Yeah. Well, that's the, one of the things that I constantly see people struggling with is, like if you use automobiles as an analogy, we know the cars need fuel, they need oil, they need certain things. But if you put oil in your car because your oil was low, I don't run out and throw oil in my car. Everybody put oil in your car right now. That makes sense because your car may not need it. But when it comes to supplementation, you see guys taking it, everybody else starts taking it, and they have no clue if they even need it or not. So that's where they waste a lot of money on taking something, and then instead of saying, well, I'm going to invest in myself and test my values to see what I need, they look at the testing as expensive, when if you were to factor in the cost of taking stuff for all these years that doesn't even help you, versus just doing a test and know what you need and then taking specifically that, it's less money in the end, but most people don't factor it out that long, so they make poor financial decisions on what they're putting in their body.
Well, the other one too is, we've talked about this over the years. I mean, if you get to the point where you have a major problem, like all of a sudden you go to the doctor. I mean, we recently lost, I recently lost a family member from stomach cancer. And, it was a matter of inside of a month from the day she was diagnosed, walked in until she passed away. And I always think, like, what's the value of everything up until that point? Like you run into people and be like, getting all my blood work done is expensive. And I'm like, what's expensive is all of a sudden finding out you're having a problem and realizing that I probably could have done something earlier to mitigate or more avoid some of these pitfalls.
Yeah, well, expense comes in a lot of forms. You have the dollars and cents aspect, but you have the suffering, the pain, the lost relationships. I mean, the missing time. There's a good example in Arizona. There was the Gabby Gifford case. I don't know if you remember the name or anything. Mm-hmm. Basically, a woman is shot and she's damaged. And,
I do remember this.
So she's basically in a hospital, and I'm kind of summarizing a pretty long story. But basically, in a hospital, she's hooked up to life support equipment, and essentially, they're ready to give up on her. And I think it was the husband. I could be wrong. It was either husband or the parents, but somebody close to her said, "No, we're not giving up." And they figure out how to create a team. And now we fast forward, so at a cost of $2 million, maybe a little bit more, and let's say roughly 2 years. Now the woman's walking and talking. And once in a while, her foot may, slip a little bit, or she might slow a word. But for all practical purposes, she's, there's nothing wrong with her. And you know how many times someone has been in that same situation and told nothing could be done, when the fact is, if you were to harness the collective intelligence of the bright doctors around and say, solve the problem, don't come up with excuses, you'd have home runs all the time. And it would be expensive initially, but as you start getting more of this, and we figure out how to centralize the data collection,
sure.
And then, okay, now I learn from you, and this guy learns from me, and we start pulling all this data together. Now that 2 million becomes 1 million, and 500,000, 250,000.
And then they just become the protocol so you can run into.
And then everybody, right. So then we'd say, here's how we quickly figure out what's going on, and here's how we quickly implement a strategy to solve this. But what happens now is the way everything is so isolated and segregated, you got bright guys on their own, and you got other bright guys that don't even talk to these bright guys. So the information isn't pooled together in a way to be utilized very effectively. But we've had people in wheelchairs that are now walking, and you can't really advertise or publish that stuff because then you're ridiculed, oh, you're a quack. There's no way a guy in a wheelchair can walk again. And logically, you would say, well, have you tried? If you didn't try, how do you know it can't happen then? It's almost like saying I can't get stronger, and then you go, well, did you ever lift weights? No, I never lift weights.
That stuff doesn't work.
So, guys, there's a chance that people don't know who Dr. Tom is. And that's. Yeah. So, Dr. Tom, I guess, talk to these guys about who you are and everything.
CB and like a little bit of background on, because actually that's probably an entire podcast. So give me like the elevator version. The very brief version.
Let's see. I got 23 years of college education, 5 degrees in mostly health-related fields. I do have a business degree as well. I've been really fortunate that I studied at Penn State Center for Sports Medicine at the time. there's really bright guys there. Two of mine.
Was that like Zaskorsky's lab and all that?
Yep. So I had Bill Kramer.
Yep.
I had Dr. Howard Kanukin. I had Dr. Carl Stadefalk. I had Dr. Larry Kenny. So Dr. Stadefalk and Dr. Kenny were both editors of the American College of Sports Medicine Guidelines, Exercise Testing and Prescription. So when you're an editor of ACSM guidelines book, you're pretty high level dude, right?
Sure.
So not many people could say I've had, all these different highly accomplished people as mentors and professors and stuff like that. We had, from our lab, we had individuals that were some of the first people to test the different forms of growth hormone, bioreactive versus immunoreactive. We had from the same lab, one of the first guys to test force transduction through the Achilles tendon. So prior to that, all the data was coming from cadavers. And then one of the guys, he's an MD PhD now, he decided, well, let's look at live people.
Wow,
so he surgically, he put a force transducer in his own Achilles tendon, which was, at the time, you're a quack, you're crazy. And then he published the data and everybody's like, oh, you're a genius. so it's like, it's always, if it works.
Isn't it like, isn't there a quote about intelligence will always meet violent opposition from lesser minds?
Oh, for sure.
Yeah, I forgot how that came.
Yeah, well, medicine is notorious. I once, I'll come back to that story. So anyway, from Penn State, went to University of Northern Colorado, then went to University of Miami. At University of Miami, I got involved in some really cool stuff. I was involved with the Miami Project Cure Paralysis. I got involved with the muscle lab there, where basically I worked with cells, animals, and people. So I got a pretty good background at the cellular level, actually at the molecular level, all the way up to like intact human body, and got to see things in all kinds of ways. So like with creatine, we talked about earlier, I actually studied creatine on people first. So we saw them physically get stronger. Then we saw what happened. We did muscle biopsies on those same people to see how their muscle fibers change. And then years later, I isolated muscle fibers from rats, and I tested creatine on the individual muscle fibers to see how it affect what they call force-generating myosin cross bridges. So like the actin and myosin proteins inside. So kind of like a lot of details, they are understanding how supplements could affect muscle force. So academically, I've been fortunate to be exposed to some really bright minds. After that, I wound up doing some work with Athletes Performance, API. This was back around 2002. I was recruited to be the director of biomedical research. I didn't really see that as a sound business model. I thought there was a lot of flaws in the way to approach and training athletes, and I didn't see how they were utilizing data effectively. And then I went out on my own, and basically ever since then, it started with a virtual company. So at the time I met you, I was traveling around the United States like a newspaper boy, but basically doctor center to doctor center. And basically doctors would bring me in, and they would line up their toughest cases, and I would walk in cold, and I had an hour, sometimes 2 hours, to ask questions, look at medical histories, figure out what tests needed to be run, and I would basically write the recommendations like, you need these tests. Then that local doctor would order everything, and I would come back like in a month, next route, and then review everything. And so I was getting hit with stuff left and right all the time, with things I never learned about. And then at a certain point, after about 5 years of that, this would have been now 2005. It's like I can't keep traveling. It's killing my own health.
Sure.
Because I was on the road like 6-7 days a week. And I then I rented a space in Tempe, Arizona. I had a clinic that people started flying into. And in 2010, we just realized we needed more space.
I remember the place upstairs.
Yeah.
That's right.
And so 2010, now we got basically a gym with about 30 medical offices. And essentially, it's just like a giant playground. People come in, and we got technologies from all over the world. And I look at it as, one of the ways I want to try to, reduce healthcare expenses is try to come up with a fixed cost. So an example would be if you went in and you said, okay, there's like 100 modalities. I want to try them all and figure out which one is best for yourself. You're going to pay, X dollars for this one. And at the end of the day, it's going to be thousands of dollars. Well, I already got all the equipment. I already paid for all the equipment. So basically the equipment's paid for. There's not like a true cost per se. So we came up with a flat fee of about $1,400. And it wind up, that's about 80% cheaper than what most people would wind up paying trying to do this stuff on their own. And now we get to figure out put the pressure on me to figure out the tool for you. And then like I did today, I brought a bunch of gadgets, but essentially what I would do is I would say, all right, John, here's this stimulus, this vibration machine. You could buy this on Amazon for $100, and here's something that's a professional model that's $3,000. So now you're going to try both, and you say, man, that $100 one worked just as well.
Sure.
So now you can go and buy a $100 unit and look at how, and now you got your own sort of own way to help yourself without having to be dependent on a healthcare professional going somewhere. So now over your lifetime, saved you countless dollars because you don't have to keep calling someone up for help and things like that.
Well, the other big one too is, and I think what's really underrepresented, especially when I talk to you, is people hit me all the time on blood work. What should I get done for my blood work? I get that question at least, I mean, I shit you not, like 4 to 7 times a month.
Yeah.
At least every other day I get somebody emailing, talk to me, Johnny, Raven deal, and being like, what should I get for my blood work? And what I recommended to them is, like if you go to the doctor and you ask for blood work, they're just going to run a basic panel. Yeah. And I'm like, how do you, what are you going to know? They're probably going to test, A1C. They're probably going to do this. I mean, you're going to ask for, a hormone test. So you're going to want to see what, your testosterone, free testosterone, all these different things. I'm like, they might not test any of that stuff. They might just tell you your total test, which isn't necessarily of much value. So, I mean, we kind of go through all this, and when people ask me about blood testing, I'm like, honestly, I just kick them to you, and I'm like, talk to Dr. Tom, because here's what most people don't realize is we can do all the testing and we can get those numbers, but to be able to evaluate those numbers in a meaningful way and manipulate them is really the science and the art of this. And for you, I mean, think about how many professional athletes, I mean, just in terms of professional athletes over the years, how many professional athletes have you done blood work and actually done blood work, done supplementation, retest, and actually seen how things manipulate? Because I know whenever I talk to you about anything, you were like, oh yeah, I know this. And I'm like, well, how do you know that? You're like, well, I probably have 10,000 tests telling me this.
Yeah, so we've, I think collectively, we probably run well over 40,000 tests. Some of those are on the same person over time, maybe over 10 years or something. Because of the way we had originally designed everything, every individual was kept separate. So I couldn't pull all the data in an automated way. I would have to physically print it out and manually enter it.
No, I've seen you sit there and go through your 7 monitors, and if you go to Tom's office, he has all these monitors with all these different databases of all these people, and he's clicking kind of like Minority Report, like this. Yeah. But I mean, and also, you're fairly smart, so you actually remember everything. I mean, we have conversations, and you were like, "Didn't we test you for that 10 years ago?" Yeah. And you'll pull it up, and I mean,
I got a funny story for you. So, I go to work one day, and there's a message, and I'm not gonna say the individual's name, but it was a retired NFL quarterback. But he just gave his short name, it's like you might say
I think he told me the story, but
so the guy tells it was a newly hired front desk person, tell him so and so called, and so she comes in, she goes, I think I misspelled the name because I really wasn't sure what he was saying, and I said, let me see, I said, I think I know what it is. So I call the guy back. He's like, Doc, what's up? Now I hadn't talked to him, I want to say maybe 3 years. But he wanted me to tell him his blood type, and I did that test 11 years ago, right? So he's like, do you remember my blood type from 11 years ago? I was like, I don't, but check this out. And I'm like, dude, and let's say 30 seconds to a minute, I pull up his blood type, and I'm telling him. And so he goes, I knew you would know. And I say, you know what? I don't know if I should be happy or upset, because in my mind, I'm taking it like you thought, who's the geekiest guy I know that would actually remember my blood type? No, it's got to be Tom. So you call me up. He's like, no, man, I just remember how thorough you are, But it was a really funny story because, most of the guys I've worked with, one, I care about people. 2, I want people to feel they can depend and rely on me, and that they matter. And that's one of the missing elements. I'm involved with a lot of technology with all these different companies. I'm interfacing laboratories from around the world. And it's just really complicated APIs and systems for all these different laboratories to communicate. But what's lost in all this stuff is that, well, this is a human being. This is not a number. There's a real person that lives and breathes and bleeds and all this stuff. And part of one of the things I'm working on right now is, how do we maintain the relationship with the person while we're trying to, at the same time, incorporate all this new, human genome data, the microbiome data, all this other stuff that's rapidly exploding. Which reminds me, we definitely got to talk about some of the lactobacillus rhamnosus GG
Sure.
data on a gene expression and stuff like that.
Yeah, we'll get to that one after. But what I really wanted to, or what I figured would be a really interesting deal, because people hit me on this a lot too, is stem cells and cartilage.
Sure. Yeah.
So I had when I played in, and you know this, and I'll tell the audience, when I played in Philadelphia, I had a pretty severe knee injury, and they basically scoped it, and I played about a week and a half later. And, they proceeded to play on that knee, and then I had to go back and get more, and they basically just started shaving out more and more of my meniscus, and I started getting, not only meniscus, but arterial, the bone surface started to degenerate, and I started getting some arthritis, and, was really starting to worry about the health of my knee. So I called Tom, and I remember you called me on the phone, and I can remember this like a photograph. I was in Kansas City. It was night. I was outside. I was filling up my truck. And I remember I was putting in gas in, I see it, and I'm like, Inky, what's up? And he's like, I found there's this new technology.
Oh, yeah, the ACS?
Yeah. No, this was PRP.
Oh, yeah.
Right? So,
Yeah.
so how long ago?
It's an old story.
This is old. So this is like 2003, 2004. He calls me, he goes, man, there's this new technology coming out. I'm going to get it. And what we do is we extract blood, we spin it down, and then it mixes, or it like promotes healing and growth factors, and we inject it back in. It's called PRP. And PRP stands for plasma-rich platelet.
What's a platelet-rich plasma?
Yeah, platelet-rich plasma. So as soon as the season gets done, I fly to Arizona, and so they take a bunch of blood, he spins it down, he injects it back into me. And the gal that he had working for him as the doctor who did the injection, Dr.
Doan.
Yeah, who we actually know her brother. Yeah. So she injects me, and I don't know if she hit a nerve or what she did, but the injection felt as if somebody ripped the soul out of my body.
Yeah.
And I literally laid on the table in like the most severe pain I've ever had for like 2 or 3 minutes, to the point where like she got nervous and was like, do you want me to call 911? I'm like, I'll be fine. And I sat there and suffered on this table. So inject my knees, I like leave, I come back, and I remember people would like talk about PRP, and I'd be like, like putting up a cross to like block it, and come to find out that actually she either nicked a bone, or she hit a nerve, or she just did something that was a one-off. But that was really the first thing we started talking about, and then at which point I think you were having some problems with your hip. And so every time I would talk to Tom, and for those of you guys who don't know, Tom and I have a funny relationship in that like we talk pretty often, but for like 3 weeks I don't talk to him. He'll call me and everything will have changed. Oh my God. Like I learned so much in the last 3 weeks, and we get on the phone, and like 2 hours later I'm like, God damn it, I didn't even get my laundry done in the last couple of weeks. But then it really started this whole deal where we looked at like not only PRP, but then it went to the ACS.
ACS, stem cells.
Fetal stem cells, and then being able to culture the stem cells out of like bone marrow, with the, that's another funny story. When I got staked by the...
Dr. Parita.
Yeah, by Dr. Parita. Yeah. Fucking asshole. Get you. And like not only looking at that, and then looking at it like, okay, hey, can we inject something back, or is it micronutrient, macronutrient? Is it health? How do you unload the joint? We looked at what was it? Bionic care. Then that other deal with like the wraps. Yeah. We've looked at and then things like PowerDot, where we're using EMS to not only get the muscles to fire, but also like the KATSU systems in terms of how to create. So really, I think what people look at is they just look at one thing.
Yeah.
Like if your cartilage is deteriorating, it's we're going to do this, but that's not how you work. You look at it like, how do I attack this problem in a 360 kind of model with everything I can throw it at? Is it systemic? Is it putting something into the joint? Is it unloading the joint? Is it muscular? Is it neurological? Everything. And I think that's where, at least with you and I, where I connect, and why, we've continued to work together, is because there is like just, because and what kind of frustrates me with most people is everybody's a one-trick pony. This is all I do. All I do is I inject the joint. And you're like, well, what if that doesn't work for that person? Well, then it doesn't work for that person. Whereas that's never been your approach.
Yeah. Maybe to kind of give people a framework about the stem cell stuff and things like that is, one, I'll say in about roughly 30 years I've been involved with doing this kind of stuff, I've never found a single tool that works for everyone, right? I literally could have brothers come in or sisters and they have similar damage because they would compete in the same sports or something, and you do one treatment on one and it's a home run, and you do the same treatment on the other one and they don't really feel or see much of an improvement. And the reason is there's a lot of other variables that come into play that impact how we respond to some of these things. So to create a healthy framework, one of the first things I would do is on the biochemistry side is, micronutrient testing, people that are missing, essential nutrients like vitamins, minerals, amino acids, fatty acids, that impacts the framework for healing. And there's been excellent data, presented at the American College of Sports Medicine annual meeting in 2011, where they took people that had hip replacement surgery and they gave them basically a lot of the same supplements that have been published for like increasing strength and muscle protein synthesis.
Was this with like the branched chain aminos, where they were giving them like high level branched chain aminos?
So imagine
you sent me this.
these people are eating. They're eating like 3 to 5 times a day real meals, and on top of that, they give an extra 45 grams of amino acids and vitamins and minerals and stuff. Basically, in terms of a normal medical model, this is way outside the box thinking.
Sure.
And they started seeing that these patients, after hip replacement surgery, they were getting stronger, like by a factor of 8 in some cases. So imagine you're going from surgery to next thing you know, you're stronger than you had ever been before the surgery. So the results were real impressive. Now you would expect after that, every orthopedic surgeon involved in hip replacement or maybe knee replacement would have all their patients doing all this stuff. And when we interviewed doctors, none of them we found were doing any of these things. And part of that is they didn't create a model that they could quickly change. So what I started doing is I got involved as a scientific advisor, I'll say roughly about 30 stem cell centers around the world. And what I would hear from the physicians doing the procedures, it works really well, it's a home run. And I would say, well, where's your data? Where's the sort of what we call like a injury surveillance data or outcome data? And no one really had that. And
was it like observational? Like I feel better, so therefore it works?
It was kind of like this. So imagine you come in and you get a procedure and you never come back. And you're like, oh, it worked. But you never told me anything,
Sure.
right? So you didn't say, dude, it sucked, or dude, it worked. So I don't really have an answer from you. And what I started seeing in my own experience is that when people feel better, they go on with their life. So it's hard to get an MRI on them, or like if your knees feel great, you want to squat and lift and do whatever you want to do. You don't want to stop and say, well, let me get that MRI to see what's going on, because there's a chance it may show no improvement, and that could mess up with your head, right? So it was really hard to get the post-treatment data. And I found that in my own clinic, and I started talking with the guys, same thing. So we started to then evaluate like the really successful outcomes that we did have data on. And one of the things that came up with on the stem cell side is you need to have special equipment like a culture counter or something, or a flow cytometer that could look at the types of stem cells and what their genetic predisposition to becoming. So an example would be if you were to take some stem cells out of your body fat, so it'd be adipocyte-derived stem cells, or if you take stem cells out of bone marrow, or if you were to use some type of stem cells from like fetal embryonic stem cells or something like that, or placental-derived.
Sure.
Regardless of the source of the stem cells, so they're outside your body or from your own body, you want to know the type, because you want to make sure they have like a chondrogenic potential, they can become cartilage, so when you put those cells in your joint, but because it's a numbers game. So if I put like 5 cells, I'm not fixing anything.
But if
I
you
put
put
5 billion,
or 5 trillion.
Yeah, 5 trillion. Oh yeah, you're going to fix a lot. But the next layer then is how do we get the cells? Imagine if like the surface here has got all these holes in it.
So you're talking about like scaffolding.
Yeah, right. So you got to get the stem cells in there and have the scaffolding to keep them there. And
which is a funny story.
Well, then I just sent you right. I sent you that link recently, the doctor from Italy.
Yeah.
So.
I was laughing thinking about when Parita tried to build the scaffolding by taking body fat.
Oh yeah.
And he was sitting there jacking it, and he couldn't get any body fat.
Yeah.
And I'm like, what the fuck? And then he staked me like a vampire.
Yeah. But so in that procedure, they're basically taking body fat is one of the richest source of stem cells in terms of counts and stuff. And I went through the same procedure you went through first, and I remember that I talked with Dr. Purita ahead of time. And by the way, I think he's a great guy. I mean, I would consider him like a mentor in a lot of ways. He I talked with him. He's like, well, you know, we need you to be a little bit fatter, right? So I'm eating like a pig. I try to get body fat and everything. And so I go in, and I want to say at the time, I was probably one of the fattest I'd ever been, like maybe 22, 23% body fat. And so he's trying to get fat out of like my obliques, love handles, and stuff like that. He's like, you're too lean. I'm like, dude, what are you talking about, too lean? How do you get fat off of some of like the wide receivers and like these leaner athletes I've sent you? He's like, oh, we can't do it. They're just, it's like tissue paper skin. But when he injected the fat-derived stem cells, I had them in my hip and my knee and my shoulder. Dude, I was like on fire.
Yeah.
I didn't realize how caustic the fat would be. And so it's definitely inflammatory. And what I learned from that, though, is, you know, you need almost like a surgical intervention. So you really need an orthopedic surgeon that could clean out the joint, right? So basically make it look pretty, right, biomechanically speaking. Then you need to be able to kind of spackle in the stem cells and then put the scaffolding over it. And right now, there isn't anyone in the United States that's doing it at that level. There's probably a few docs in Colorado here and there, but they're, what my experience has been, most of the guys just want to inject the cells.
Sure.
Without doing any of like this, the more mechanical surgical stuff.
Well, it seems like, you know, like to use the car analogy, if you were to go paint a car without actually doing the prep work,
right.
you know, the paint's going to look like dog shit. I mean, you know, if there's rust and if there's, you know, holes in it, I mean, you can basically paint it. It's just going to look like, you know, shit. So, you know, the thing, and recently that article you sent me, and I think I as soon as I read it, I hit you back immediately. And it was like, so these guys are at the point where they can actually remodel the joint. Yeah. And, you know, like whether it be, I'm pretty sure they do with lasers that they like, you know, go through and they probably look, you know, kind of symmetry, but also biomechanical and anthropometrical, and you kind of go through it and they can remodel the joint, clean it all up so they get rid of all the, you know, what is it? The
osteophytes.
Yeah, the osteophytes,
like
but also the shitty bone that lays down. What is it?
Subchondral bone.
Subchondral bone. Yeah. So all that bone, they basically clean the joint, make it, like you said, pretty nice and round and this, and then they can go in and they can spackle and they can create, which is super exciting because I mean that might be something where, you know, now you're looking at actually doing biological joint replacements.
Yeah. Well, or just I would say replacement. I want to almost say like a biological joint enhancement. Because so there's a group out of Israel. The company website is Histogenics. They have a procedure called Carousel, and it's like super advanced computer-aided design with your joint. And they recently developed a licensing agreement with I think a Harvard Medical Group in Boston. So my understanding right now is you would go out, and I don't know if this has been rolled out commercially so people could do it or for just more of a research, but essentially you go there. They look at the joint, they take cartilage biopsies off the non-weight bearing areas, right? So it's like area where you're not going to be using it anyway. Sure. And they send it over to Israel and they grow out the sections. It works great when there's like a big hole, and they're going to basically grow out a big plug, if you will. Then the surgeon here puts it in you, and they basically use your own stem cells like a glue. And when it's done, you cannot see a seam or a suture line or any, like, you can't see the new unit old you. It's perfectly sealed. And I've seen one case so far. Actually, a guy went skiing and, you know, came down, landed, and somehow landed the wrong way. And he basically gored out a big hole. So an osteochondral defect in his, I guess, tibia. So they did this procedure. Takes about a year to go through it. There's nothing wrong that we can see now.
But is there a difference between something being acute, like this guy obviously had a fresh knee, he does the injury, he comes in, they fix it, opposed from people like you and I that have this like chronic over like, you know, like, I mean, because you think about it, I mean, we started I started playing football and training when I was, you know, 14 years old, and I've pretty much done that, you know, 4 to 6 days a week, multiple times a day for the last, I mean, geez, we're coming up on, you know, 25, 26 years. You know, so you look at like the body of work opposed from people that are like, oh, I fell on my knee and now I have this osteochondral this defect. So now we're in a situation like, I think that's an easier fix than, you know, hey Tom, I'm gonna like, you have 30 years of abuse of this hip, so now I'm gonna resurface this hip and like I mean, that to me is.
So you're right on the money there. Like, an acute injury is a totally different environment than a chronic injury. in the case, like generally speaking now, right, there's always probably outlier situations, but in the case of acute injury, the rest of the body has not had a chance to remodel based on the pathology of the damaged joint. When you get to a case like, say, my left hip, the internal compartment is so badly damaged, and then the knee and ankle remodel to compensate. So even if we were to magically fix the hip right this instant, you still have the deformity in the knee and the deformities in the ankle that have to be addressed.
The body's interesting. I mean, it's like water. You know, like water will always find its level. It was always find downhill. Same thing. If all of a sudden you damage your hip, now your body's going to find the most efficient movement pattern, you know, whether it be good or bad, more mainly bad for you to do it, you know, whether you swing and now the knee and the ankle and all the joints up above start having more and more problems.
So let me share with
So what we need to do is couple that with some form of neurological reprogramming. What was the joke we were saying? You're like, I just need new software. Let's get new hardware. But I mean, that's kind of the the thought is that, like, and I think that's part of some of the stuff we've been looking at with not only like Katsu and also EMS, like the power dot and those things, is using different technologies to not only help train the muscles but also reprogram things. Luke, you're
Yeah. So before we get going, I'm going to throw in a question that is kind of pertinent here because we're talking about a bunch of jiggy shit, but it's all overseas. You know, Dr. Tom, you've been like, you know, if you look out in Israel, and so let me jump into this real quick. And so here's kind of the narrative. You know, we've made a lot of advancements from a lot of the specialists in the medical community, i.e., endocrinology specialists, and almost to our own detriment, with doctors unable to see the bigger picture. We have people outside the MD community that have very helpful holistic insights. So how do you see the medical community domestically putting the body back, or continuing advancement to put the body back together again?
Well, so I think the medical model has to change right now.
Yeah, it's broken.
Because, well, it's just... we have all this technology now, and what's happening is we don't, like, our damage isn't specific to a system. Like, what we're learned is, like, if I have something going on with bacteria in my digestive tract, those bacteria could affect genes that affect my cartilage and also affects my brain function. So would I go to a neurologist, a gastroenterologist, or an orthopedist, right? So you can't say all of them because they won't know, they don't have the communication parameters to figure this stuff out.
Well, and also they probably don't have, if you're a gastrologist, you probably don't have the, like that's your specialty. And we talked about this when, I lost my family member recently, that the pain receptors in the brain and the gut are the same.
Yeah.
You know, so now you have a situation where you have something going on here and the pain is so intense. You know, now, like, it's almost as if, like, the doctor has to be more than just a master of one thing.
Yeah. So maybe let me connect some of this stuff with, in terms of, like, a model for helping people, let's say, to have any type of, let's say specifically for, like, cartilage, bone issues, maybe ligament and tendon. On the one hand, you want vitamin mineral testing and essential amino acids and fatty acids, because you want to make sure you're not low on something that you need to make the material to fix what's damaged in you. Then on the other hand, you need someone that can look at how you move and then figure out the reason for the impairment. The components will be neurological, so like what's going on with my nervous system controlling my gait or whatever, movement of the knee or something, and then what's going on biomechanical, structurally, and ideally then you would figure out how to address those things. You don't need any stem cells at that point, you don't even need any joint injections. So that's stuff that pretty much anyone can pull off right now. Now the next step would be, after you figure that out, and the reason why you want to do that is because you could get rid of pain very rapidly, you could improve movement very rapidly, and at a fairly lower price point, like be a lot less expensive. Now once you get rid of some pain, that pain might simply be due to, you moving poorly or some other reason. Now whatever's left over, might say that might be more the focus of what's going on. And the things we've learned, so since like some of the first times we injected your knees till now, one of the things I never read or knew or was told by any doctor is just the pressure think about some of the substances. It's like injecting honey, right? So the pressure the doctor has to exert on that syringe as it's injecting stuff into you. I once had my hip injected by Dr. Aldrin.
Well, I mean, but that was when you were actually pushing him through those filters.
Yeah, right.
And the amount of pressure coming through those filters.
So we would use these filters. Let's say, so you'd have like a liquid you're going to inject, you have a filter, and then you have the needle. And the idea was to push the liquid through the filter because it would remove a virus, it would remove a bacteria or a fungus. In other words, the final liquid in the body was basically, you could almost say sterilized, even though it's not technically accurate. But the idea is we want to minimize the chance we're going to cause an infection in someone's joint.
Sure.
So it's kind of like the smartest thing you could do at the time. But what we didn't count on was the pressure to go through that filter. So I tested on myself and I had my hip injected. And when you have an arthritic hip, one of the signs that's pretty badly damaged is when you put pressure on the hip, you feel it at the knee. So I literally felt like I had a baby coming out of my knee, even though no one was touching my knee. But there's all kinds of...
And your knee wasn't pregnant.
Yeah, my knee wasn't pregnant, that's right. So the point I was trying to make is that there's communications around the body.
Sure.
So even though you're injecting the hip, and you could feel the stimulus, or you could feel the pain somewhere else. What that taught me then is that, how do we process pain, right? If I could feel something in my knee, even though we're not touching it, how is that mediated? And that's when I started looking at how the brain and how the rest of the nervous system processes pain.
Well, I mean, and pain's emotional.
There's definitely a very high emotional component.
I always think years ago there was a naturopath I went and saw that did some joint injections, and I remember he put the needle in, and he was kind of doing like a mix of like acupuncture, but he was using some B vitamins in terms of doing prolo. And I remember he injected, and he made a point. He's like, "Is that a familiar pain?" And I asked him. I was like, "Yeah, actually, I can remember exactly, where I got hurt, how that whole thing." And I realized that pain is like a snapshot, like a photo album. Like you take a picture of pain, and your body actually stores it in your brain as a memory. And it was strange. Like he hit me, and it like took me back to an instant place. And at that point, and I know we've talked about this over the years, that like pain is 100% processed in the brain, and people remember it. And I always think because you run into people all the time that have these emotional things that happen to them, and their pain actually the pain manifests physically. And you're like, wait a minute, how is this pain manifesting physically from something that happened to you emotionally? And and that's the problem too, is that we've wanted to cut the brain and the body out, where it's just this systemic organism where everything kind of puts in. I mean, I remember I ruptured my patellar tendon in my first NFL game, and they cut off my pants. I'm laying there on the table, and they're like, "How do you feel?" And I'm like, "My knee feels real hot." I didn't really feel the pain. And when I looked down, I saw that my kneecap was sitting like 4 inches too high and 2 inches to the right. So I mean, here's my left knee, and my patellar tendon had ruptured, and it was like I could see where my kneecap was, but it was in the wrong place. And the doctor's like, you ruptured your patellar tendon. How do you feel? I'm okay. And then I looked at my dad, and my dad's eyes got big, and I saw a tear go down his face. And instantly the pain hit me. And it was like I could see the pain in his eyes, and instantly I was in pain.
Yeah.
And I went from being okay to not being okay, to where they brought me in and actually put me on a morphine drip. And to this day, it's so vivid. I just felt hot and I didn't notice it, and then I saw the look on my dad's face and I knew I was fucked. And then the doctor, of course, tells me, "You'll never play football again. You'll probably never walk well. You'll probably never get your muscle to fire." And at that moment, as I was in there, I was like, "I'm going to prove this motherfucker wrong." And I ended up coming back and starting 16 games the next year, and going on and playing another 8-9 years in the NFL. And to me, that was one of the most interesting things that and at that point I realized that pain is so emotional in so many ways. I mean, so many of my NFL friends are highly addicted and had massive problems with painkillers. And I always wonder if the painkillers that I never really took them. I mean, actually, I didn't really ever take any painkillers, just on a few times. But I think that a lot of guys were masking something. Maybe it was something emotional, or maybe a bigger problem. So it's just kind of something I've been thinking a lot about.
Yeah, one of the things you just mentioned here made me think about if I look at the most complicated medical cases I've ever was involved in, whenever there was a successful outcome, the common, let's say, trait was that the individual was determined to get better, right? So what I kind of got out of that is, one, the strength of, will type of thing, but two, they're also open to possibilities, right? Imagine if you're going to help me and I go, nothing works, right?
Yeah.
How much better could I get? And I think one of the dangers sometimes, or maybe not danger, but maybe one of the ways that we're limited by medical or healthcare professionals is if they don't know an answer, instead of simply saying, you know what, I've never, I don't know what to do in this case, I don't know how to help you, they kind of put a harder line and say nothing could be done, instead of saying, I don't know what else to do for you. There may be other options, I just don't know of them, and that way gives people the freedom to explore. They'll sometimes say nothing could be done, and then you'd say, well, how do you know if you've never tried all these other things? How do you know nothing could be done? So,
well, I mean, that actually goes back to an interaction that you and I had, a while back. I mean, it seems more recent than it was, but I was going through my workman's comp thing for the NFL, and I went to go see a guy about a knee, and the only thing he recommended for me was knee replacement. And then I go see the guy about my shoulder, and he recommends a shoulder replacement. And when I told the guy, I'm like, well, my knee doesn't really hurt me that bad, and my shoulder doesn't hurt me that bad. And the guy's like, well, then why are you here? I'm like, well, I'm here for the workman's comp. And he goes, your joints are damaged, we would just replace them. Mm-hmm. And then when I told the guy, I'm like, well, I'm still able to train and do these things. He's like, well, why are you here? I'm like, well, aren't you a doctor to fix things? And the guy's like, we treat pain.
Yeah.
If you have pain, we'll fix it. If you don't have pain, go back and come back when you have pain.
Yeah.
And I think when I called you that day, I was kind of a little surprised, but also the one thing I had kind of run my gamut with conventional medicine in a lot of ways, and I'm like, Tom, they're not helping me. Like, I still feel like I have something in me. Yeah. And I remember you being like, we'll figure this out. Yeah. And I think that's when we went up and saw Dr. Bueller. Yeah. And you're like, we're going to go see this guy, Craig Bueller, and he does some really interesting things. Mm-hmm. So instead of going down this road, we met a dead end. Let's find a new road. Yeah. And that's the one thing which I'll forever be grateful, and I always consider you like my lifeline. And the analogy whenever people ask me about like how would you describe Tom Incledon, and Luke asked me this other way, I was like those old westerns where like the bad guys come to town and they're shooting everybody, and the town gets together and they have a big town hall meeting, and they're like, what do we need? And they're like, we have to find a gunfighter because the county sheriff sucks. Mm-hmm. He always gets killed first, and they go out and they get the gunfighter who comes in, and he's slick and like comes in and he guns everybody down, and they have to hire him to bring him in. And I'm like, Tom's my gunfighter. When the county sheriff gets killed, I got to call on Tom, because one, he's going to do whatever he can to get rid of the bad guys, and he's not going to take no for an answer. And if it's this testing or this or this or this, how many times do you look at something and you're like, I got to call John on this? And you usually hit me up and you're like, dude, I found this great information. And you're like, do you know how many people I can help with this? Because really, at the end of the day, that's what you're about. You're like, there's all this great information and technology that you've been, and you think about it. I've been exposed to too, that you want to help people with. But the thing that I've realized is a lot of people aren't open to it. Yeah. And to me, that's the most frustrating thing. Like, I sent a friend of ours recently to see Tom, and he brought his dad, and made some phenomenal things, but I just don't think that they were open to everything. Yeah, and, well, it's that's frustrating to me. Yeah, it's
I actually saw a presentation done by this was an in vitro is a specialist. We do surgical procedures, and he has the highest success rate for helping couples conceive. He's got, I guess they have to report their outcomes because it's monitored and stuff. And one of the things he gave, so he was in, I think, New York City. It was in Washington, D.C. So he got this huge screen, he's lecturing in front of thousands of people. And he showed the history of medicine. And there'd be like a major advancement. So let's say that the one or two people that have going to share this idea with the world, everybody's criticizing. The people die. And after the death, everybody celebrates how intelligent they were. Yeah, and then,
it's like great artists.
It's just over and over again, And what you see is that what I've come to realize is where I see a lot of resistance is if, let's say right now I'm injecting, PRP in your joints, and let's just say that now a better substance comes along, not PRP, let's say ACS or stem cells, doesn't matter. I'm going to quickly say, let's stop. Hey John, let's stop the PRP. Let's do this better thing. because I always want to be able to provide the best solution to someone. A lot of professionals, the way they process things, if they're doing, let's say, a certain procedure, they don't want to have to admit they were wrong all the years before. So they're kind of focusing on a negative aspect. They're backward thinking instead of forward thinking, saying, well, maybe that wasn't the best fit, but it was the best I knew at the time.
Sure.
And now going forward, I'm going to make sure every patient I see gets the best that we know today. And the reason why it's important is it frees up your mind to think and be open and aware. You don't always know what's going to happen in advance, right? You know, one person come in, like we've done ozone in treatments, and I've never seen, I've seen ozone treatments for, let's say, elderly women that were never very active. It's a home run. Like, you get these women that come in, they can't move and they're in so much pain. You do one treatment and it's very inexpensive, relatively speaking, and they swear you healed them for life, and years later they're still fine. Yeah. And I got some theories in terms of antioxidant gene expression, why it maybe works better in that population, but I've never seen that type of outcome in any athlete I've ever worked with.
Sure.
And I think part of the athletes have already upregulated some of those antioxidant genes that fight inflammation.
Well, I mean,
it needs something more than just ozone.
Isn't ozone? I mean, it's extremely, like causes massive healing. I mean, isn't it like
yeah? So it's inflammatory,
like very oxidative.
So yeah. So what it is so in a context of so the correct like phrase would be what's it called? Medical oxygen ozone therapy.
Sure.
And the idea is because the doctors that originally developed it, they wanted to kind of make a distinction between, like, you know how you hear ozone in the atmosphere, and it's bad and this and that, or as it breaks down kind of thing. And then there's, if you were to breathe in pure ozone, it could damage your lungs. So they kind of wanted to make sure this was distinct from this stuff. Basically, you get regular, like medical oxygen, runs through a machine, and it converts to O2 to O3. So the O3 then could be injected directly as a gas. It could be put into a liquid like blood, and then either the gas or the liquid could be injected into actual tissue, or on the outside of a bone, or inside a joint. There's like different places you could put it.
Yeah, don't they mix it with blood, inject it back in? I know they do some surgical, like dental treatments,
Yeah.
where they inject it in and like we're able to like fix cavities and do some things.
Yeah, because it's so ozone is it's an excellent antimicrobial agent. Mm-hmm. So it's really interesting because it kills off this bacteria and fungi and all these other bad guys. It doesn't kill our own cells. And that's kind of a cool thing about nature, you know. So it's great in dentistry because, like, something, you know, you want to minimize the risk of a bacterial infection, you know, underneath the root canal or something like that. So you can inject the ozone in there, and then you won't get an infection.
Didn't you also tell me years ago that that there's a direct correlation between like dental work and like infections in the mouth and neurological problems?
Yeah, they found. I mean, so infections in let's say hidden infections in the body. Typically, it's you'll see some of the data as like an abscess or like some type of infection in the mouth has been shown to be correlated to all kinds of depression, erectile dysfunction, like a lot of other parts of the body that you wouldn't say there's a direct connection to. And some of that is because of production of inflammatory substances that interfere with function, and some of that's through the nervous system. We're expanding our views of how the body is connected on almost a daily basis. So I could literally tell you, hey, John, this is what we know right now. And then like in 2 days, I could say, dude, it's wrong. Here's now.
Well, you've done that.
Yeah.
You've called me and been like, everything I do was wrong. I learned everything new. I'm like, Tom, I just talked to you last week. You're like, I know, it was a big week for me. You know, but it seems like the road this stuff is going, and I think where people are really pushing it is they, I think, have the technology. I mean, I feel like we're like watching the $6 Million Man, Steve Rogers. We have the technology to rebuild him, you know, and I feel like we're headed down that road, and it just happens that I think the people that are really doing probably the best stuff is out of the country. Because,
so here's the thing, though. For someone right now, okay, in terms of stimulating like a therapeutic healing environment for your body, so like let's say like if you had an MRI of your knee and you could see the damage, okay, there's damage, right? But other parts of your body that you don't have pain in, there could still be damage there.
Sure.
It just hasn't registered, right, within your computer network or your nervous system. So how do you fix not only what you know, but also fix what you don't know, because you want to prevent injury or getting more damage in the future around, let's say the
So
whole
is there a
body.
way to do it like more like spot treatments that you do like something like IA, like an articular versus like a systemic, where like is there a way to like, is there going to be a day where you're like, I have these huge IV bags full of this like magical stuff, and then it puts it in, and instantly I'll just be like,
So so first on the stem cell side, we're going to go get some training on ways to turn on stem cells in your blood and then activate them. And then those little stem cells, you can almost think of them as like nanobots. They're going to go and fix all kinds of stuff around you. Chances are.
so we're getting into G.I. Joe level.
Yeah, it's definitely, there's some, I mean, that's right now in the US, right?
Sure.
Then in terms of though, the limitation to that is it'll probably fix stuff first that you didn't even know was wrong, right? So it's kind of like, hey, I fixed your elbow. You're like, there's nothing wrong with my elbow. Well, it just means that you won't have a problem in the future, but it doesn't have a lot of value to you right now because it wasn't holding you back. You might be more worried about a shoulder or a knee. For those guys, we probably then want to supplement that with something intra-articular, and that's where I send you that stuff about the doctor from Italy that's got an office in San Diego. I'm going to go through 2 different procedures, and the thing about it, it takes 3 to 6 months to kind of really see, hey, did it work or not? So it's not one of those things where instantly. But along the way, in terms of healing the body all over.
So the first one's going to be like obviously to like fix the joint, and the other one's going to be for your other deal where you secretly have always wanted to live as a woman. That's part of the Caitlyn Jenner. Or are we putting that one?
Hey, I don't judge anyone. I don't judge anyone. Hey.
Or did that one change? All of a sudden you're like, no, that was 2 weeks ago. I totally am over that right now.
I like everybody, That's why I get along with the world. So. What I would do first, though, is the systemic IV stuff. Well, I shouldn't say IV, like systemic. Let's say turn on stem cells systemically. Only because I like the idea of fixing stuff I don't even know about. Because it kind of, it's like preventing an obstacle before it can affect you.
Sure.
Then, in terms of like stuff, so in my case, man, right elbow, left shoulder, left hip, right hip. And there's nothing
pretty much whole
wrong with
body.
Yeah, you could probably say whole body.
Yeah, whole body.
But that would have to be intra-articular whole body, right?
Well, I mean, you're up for it. Like Tom's like so basically it's going to be like Wolverine style. They're just going to like put you in a pool of water.
Dude, I would so be into that. Put some adamantium
I'm
all
in.
over me.
Well, I
Because I'd be training harder and heavier than ever before.
you're like, I just squatted 9,000 pounds. Don't worry about it. Well, I just want the Wolverine where I can just heal myself.
Yeah.
Which is actually of everything I've read, the high dose probiotic that we so
that's a whole nother story.
Oh yeah, I mean we're gonna get there. So I have 2 goals. I want to just talk about the stem cell. I want to talk about how to become Wolverine through creating a healthy gut bacteria, gut biota, and then also the big question, which I think you know more than anybody on the planet, is how do you put on muscle fastest? Because I mean people like. I've Googled this, how to put on muscle, and there's like 8 trillion things, and not a single fucking person knows what they're talking about. So
we could definitely
do that. So I'm just giving the audience a little
So
bit.
Luke, keep track.
Yeah, keep track so we don't go off and like next thing you know, Tom's over there talking about space travel, time travel, and slingshotting around the moon with Bruce Willis while listening to Aerosmith songs.
I was gonna say someone here has to know what they're doing. Okay, Luke, that's you.
Luke, we got any Tom? You got to use the bathroom or anything?
Yeah, probably should.
Yeah. So
going back, John, I guess to what you guys were talking about a while ago, like who is Tom? When we went out to get our blood work done, I told you like I haven't got my blood work done in maybe a decade, and I was thinking like, what if it fucking comes back that something's fucked? And I think it's like, dude, we're going to the right place. Like when you're talking about like he's the guy, I even think if my family or friends get really sick, I'm like, dude, do you trust me? Like go to Dr. Tom.
I've had 2 things happen recently. One was with my dad. My dad had those TIAs, and they thought my dad had a stroke. And he goes to doctors, they can't tell him what's wrong. 3 months to the day, he has another one of these episodes, and the doctor's like, we don't know what's wrong. Eventually, this is just going to happen and kill him. There's nothing we can do. And so what do? I go pick my dad up at 4 a.m. we literally drive to Arizona, and I dropped him off at Dr. Tom's and got all of his blood work done and got everything, and figured out that he was having some blood sugar issues that were missing, and doctor prescribed him medication that was wrong. I mean, just like some interactions, and literally just from that little thing, now my dad is he's fine, everything's going great, and and here's the deal where if I don't have the resource of Dr. Tom, my lifeline, basically calling my gunfighter, my dad wouldn't be with us.
And over something so simple too. I mean, relatively speaking, simple, right?
What the problem is that, everybody looks at everything as one-to-one. Like, I'm going to take this supplement, it's going to do this, and you're like, well, how do you, like nothing's one-to-one in the human body. You affect one thing, it's here, it's this. I mean, it's like, we've been discussing, Tom is super knowledgeable about, diets, and has written, articles on everything from training to diet over the course, and looked at everything. We were talking about ketogenic diets the other day, and the fact that now all of a sudden you get to this point where producing ketones is great, but by removing all carbohydrate sources, what is that doing to your to the bacteria in the gut, and what does that look like in terms of systemically? There's certain bacteria that feed off of sugar, and how does it all know? And it's like you start removing one thing. And, is it beneficial? Is it not? Or if all of a sudden you eat a ketogenic diet, is it turning off things and turning on things? And the problem is we don't really know. And what might work for me might not work for you, but all that stuff's individual. I mean, how we process carbohydrate, how you process fat. I mean, we're not all the same. And even though we joke that we're all the same decaying matter, we're all very, very different in how things approach us.
Yeah, I've been really fortunate. There's a really cool story. So, picture two poor college kids. We're both master's students at the time. I'm at Penn State, and I'm going to a conference in California. And the goal was, I was with this kid, Jeff Volek, at the time. Jeff today is world-renowned PhD. He's written a book on ketogenic diets with some other bright guys. And
what was his name?
Jeff Volek.
Volek?
Yeah, L-E-K.
Maybe we should try to get him on the podcast. Luke, write that name down, Jeff Volek, and we'll name drop Inky in there and be like, Dr. Incledon.
Yeah,
that fucking hack.
Yeah, he'll go, don't call me again. Hang up.
Yeah. Be like, that piece of shit owes me $20.
That's right. Yeah, he never paid for that hamburger. So Jeff and I go to this conference, and it was a pretty. It was a professional conference.
Was this one where you tried to fight Barry Sears?
No.
We'll tell that story.
That's another story as well. So we went to meet this guy, Dr. Stephen Finney, who was, I think, was an MD PhD at University, California, San Diego. And keep in mind, this is like maybe 20 years. This story. That's how old this is. So we go and we have no money, and you have to pay like a $2,000 registration fee and all this stuff. So we have no money, and we go, and there's this woman at the front, and we're like. So Jeff's like, how are we going to get in? We don't got the money. This and that. I was like, let's just ask her. So I go to the woman. I go, look, we're two poor college kids. We just came here to meet Dr. Finney. If we're real quiet and we sit in the back, would you please let us in? And Jeff's like, there's no way this is going to work. No one just lets you in for free. They got all these people they charge. And everyone's like, okay, honey. And she lets us in and we get inside.
Nice.
And Jeff's like, I can't believe you pull it off. I go, dude.
I'm a people person.
Well, I just it was the truth. I got no money. You can't get money from me. I don't have it. So we go in there, and it was mass packed. There literally was, I don't know, it looked like thousands of people, but obviously I didn't count everyone, but it's a huge auditorium filled with all these people. And Jeff's like, how are we going to find Dr. Finney? Like, keep in mind, we have no picture. We have no idea what he looks like. This is way before cell phones and stuff.
Yeah, this is pre-internet days.
Yeah, so we get in there. I go, just start asking. So I literally go to the first person. I go, excuse me, do you happen to know who Dr. Stephen Finney is? And then the guy goes, yes, actually, I know him quite well. I go, oh, who's that? He goes, I am Dr. Stephen Finney, the first person. And if you ask Jeff, he should remember that one. Dr. Finney and Jeff have written a book on ketogenic diets, by the way. So that story translated to two professionals working together. But anyway, he did a lot of the classic research on ketogenic diets and exercise performance. And at shortly after that, I was working with ketogenic diets with a bunch of people in Florida. Most of the people there I was working with were Cuban. And I just mention that because I definitely see there's some there's genetic patterns that you
Like-
can
like-
trace
like
to ethnicity.
like ethnic diversity, being
Yeah.
able to play anymore.
So what I found, even within the Cuban population, that I could have, let's say, multiple men. Let's say they're all about 200 pounds, and their BMIs are well over 33. So they're all obese. These are not like athletes. These are regular people, and there's no pathology per se, but they're definitely unhealthy. And one guy on a ketogenic diet loses weight rapidly, like fat weight rapidly, and he looks really good visually. Like you could see he's getting abs and everything. However, his cholesterol is over 400 in his blood, his oxidized LDL is skyrocketing, there's a lot of inflammation. So if you just went by visual aesthetics, you'd say, oh, this is a home run, right? But if you now have the blood work and you look at all these inflammatory markers through different cardiovascular panels, this is not healthy. This is setting a stage. He's going to have an adverse event, at some point in the future. Then another guy loses weight and there's no impact on his, inflammatory markers in his blood at all. And a third person, nothing happens, even though they're under carefully controlled. And so what I saw with that is there's quite a bit of variable response, right, to the same diet, quote unquote. My take on ketogenic stuff is it could be an effective tool short term in the right situation, but there's so many other tools that are also available, and I don't think for most people that's maybe the single most effective tool. If it's just like a weight loss thing, or any way to lower glucose rapidly in the blood, could sort of flick the switch so you're going to lose weight quickly.
So, John, maybe because we got a question about like the power athlete keto protocol. So maybe bring Dr. Tom up to speed on what we do, and get some feedback on what's appropriate and shit like that.
Power athlete ketogenic protocol, a ketogenic diet. It's really not. It's just a form of carb cycling.
Okay.
Very similar to what I did with Dr. Di Pasquale years ago, and Tom's well versed in this type of stuff. Anabolic diet. Which to me, when I first got in the NFL, and Mauro gave me my first supplement deal, he did all my original diet stuff.
Yep.
And the progress not only in lean body mass, strength, size, and performance that I saw from the anabolic diet was nothing short of phenomenal.
Yeah.
So
I did the same stuff in Wall.
Yeah. So all of a sudden, I started about 300 pounds. We started on the anabolic diet. Mauro has me 2 a.m. waking up doing these shakes. All of a sudden at the end of the off season, I'm like 335 pounds, and I put on literally probably 30 pounds of muscle. And dude, I was so fucking strong. I think I did 465 for an easy set of 8 on the bench. Dude, I was a monster. And I remember I called Mauro, and I've told the joke that I went out there and I'm so fucking I'm so jacked up, and I get in my stance and I go to set, and I'm like, ooh, and this little defensive end just orbits around me.
Just couldn't change position fast enough.
Yeah, it was too big.
Yeah.
And so I called Mauro hysterical. I was like, Mauro, fuck, I'm gonna get cut. I'm too big. He's like, no problem. Let's adjust the diet. This is what I want you to do. We're going to take it from this. And he started making adjustments. We cut calories. He's like, I want you to, all of a sudden do the carb refeed every 3 days, but this time I don't want you to eat for you're like a, a starving kid in Ethiopia.
Yeah.
We're going to monitor your calories. I want you to do this. I want you to drop the protein. And he totally skimmed the diet for me. All of a sudden, 6-8 weeks later, I had ended up shedding probably 25, 30 pounds of the fat, and basically came into training camp and was 308 at rated 10% body fat and hit it perfect. And my performance, everything just went through the roof. And I talked to Mauro, I'm like, I don't think I can realistically survive on a ketogenic diet during football season. He goes, well, I would never expect you to.
Yeah.
So he goes, what I want you to do is I want you to start partitioning your carbs pre and post workout. And he kind of skinned it, and it really taught me how to cycle diets, but work through and realize that they all have different pieces. This is what we're going to do to bulk, this is what we're going to do to lean, and now it's time for performance.
Sure.
So what we did with different diet protocols that we do with different people, realizing that one size fits all doesn't work for everybody. People that wanted to do some sort of ketogenic diet, I give them a version of Mauro's, which I think is actually the only way you can do it for performance as a pure ketogenic diet. Oh, more coffee? Yeah, fuck yeah.
Let me grab some water here.
Yeah. So we started skinning it with doing carb refeeds. Allowing people to kind of get in ketosis, and then doing carb refeeds periodically. And really, I found that, that's a big coffee, that was very, very beneficial for us, because the problem I ran into was when I did a pure ketogenic diet, and I have done those, I didn't get stronger. And, while I leaned out, it wasn't something that was sustainable for me in terms of a performance deal. So when we skinned, the ketogenic diet, I just added carb refeeds into it, periodically. So that's what we're doing.
Yeah,
And you've seen, but the version that I put out is the version that actually I worked on with Mauro, which was extremely beneficial, which you've done as well. And it works for what we intended to do.
So in a context I was talking about earlier, it was no carbs at all, basically, or at least I don't know if you could truly create that type of diet unless you're. But it's very low carbs, and you're in constant ketosis, and no cyclical nature to it. The aspect, when Mauro first started coming out with a lot of that stuff, then compared to now, now we know there's so many other factors like. The cyclical nature of the diet, how's it affecting the microbiome, right, in your gut? How's it affecting, is there, we tend to think that doing something that works, kind of stick with it because it'll work forever, but that's probably not true, right? And it's not true because we're a dynamic organism in a dynamic environment. And even when we don't think things are changing, they still are changing.
Sure.
And what I would say, when I was doing the anabolic diet, I just literally went right into it cold turkey. So I went from a high carb, dietary pattern, because I was at Penn State at the time. That's when they're pushing a lot of high complex carbs as a deal. And so I went no carbs. I remember the first, about the second or third day, I thought I was hallucinating and getting vertigo. And I told my training partner, who was Jeff Volek back then, Jeff, man, this is, I feel like the world is spinning around me, because I was basically in ketosis and training hardcore.
Sure.
We were doing 2-3 hour workouts and stuff, and nonstop movement, just lifting weights, no running or stuff like that.
No, it's extremely hard to do anything very glycolytic if you're in a ketogenic state.
But we when we would do the carb, so we did a Friday night to Sunday afternoon sort of carb refeed period, and I remember by Monday, I literally, if you would have put a sword in my hand, I would have went out and defended the entire country. I was I had this aggressive thing, and I can remember us going into the gym, and we were, it started with we might do 2-leg exercises, and as time was going on, we're we have to do every piece of leg machinery in the gym, stack it out, 50 reps, what are we gonna do? And I can remember on this hack squat machine, in every workout, we would put 50 pounds more from one week to the next, and we're still doing sets of 10 reps. And now we're over 500 pounds in this hack squat machine, which was a lot for that piece. And people what drugs you taking? No, we're just doing this anabolic diet. It was no way. There's no way you're getting strong. And I was dating this girl, gorgeous Italian girl, and her family comes over Friday night during a carb refeed. And so I wind up eating everything in the house, and the mom is witnessing this, and she pulls her daughter aside and says, you got to get rid of this guy because it will cost you more to feed him than to buy clothes for him. And shortly after that, she broke up with me. So I've always had something against Mauro because of Eddie Dad.
No, I remember when he put me on the anabolic diet, that first deal. He's like, hey, I want you to, I think it was a 9 or even, I think it was 2 days, 0 carb. And I remember it was the off season, so it was fine. And he had he came up with this god awful, this fat shake. It was I think it was
MCT oil or something.
No, it was ice cream, and he created this hey, I want you to take whole milk, and I would put whatever it was. I think it was peanut butter and protein powder and everything. And
cream.
It was cream, and I would have it, and I would blend it up, and I'd put it by my bed, and then my alarm would go off at 2:30, and I would get up and I would pound this thing and go back to sleep.
Yeah.
The other thing was I want you to sleep as much as possible. So he's if you're getting 8 to 10 hours, I want you to be able to try to get 2-hour naps. So all I was doing in the off season was I was eating, sleeping, and lifting weights, and I was training twice a day. And all of a sudden, I remember I was in the I was in the shower at the facility, and one of the dudes was hey, I turned around and looked at me. I figured I was what? And he's He's like, did you get bigger? I was like, well, that's kind of an uncomfortable question. You're asking another guy to be naked. But I mean, that's like literally, I felt like I was growing by the day.
Yeah.
And I also think like nothing exists in a vacuum. And I come from being a poor college student, and all of a sudden I go from like not being able to take out more than $20 out of the ATM at a time to all of a sudden handing me $1 million check, and all of a sudden I realize I walk in the store, I'm like, I can buy all of this meat and all this cheese, I can buy everything.
That's right, yeah.
And then like no longer am I shopping in the bargain basement aisle like looking for the day olds. I go over, I'm like, you have anything more expensive than that filet? Is there something in the back that's more, like that type of mentality? And so for the first time in my life, I mean, I was, hey, I want you to eat 5 pounds of beef a day. I'm like, what kind of beef? Tell me, like fillets, I mean, we'll go anywhere. So, I mean, I think like that played into it. I didn't have school, so all I had to do was lift weights. I had a really good training facility. I had a gym down the street that I would go to at night. And I was getting paid to get as big and strong as I could. So, I mean, it was like a perfect environment for me.
Yeah.
So, I mean, it worked. But I remember I had about 2 weeks, and all of a sudden I kind of hit the first carb refeed, and, I was kind of like a little apprehensive about it. And then he was like, I was like, oh, I'm not feeling all right. He's like, next time you go do it, he goes, I want you to go, like, you're in Philly, I want you to go find some pizza, I want you to go to an Italian restaurant, I only want you to eat carb. And so I go down to this really nice Italian spot, and I remember they bring over this like a real thin crust pizza for like an appetizer and this, and I'm sitting there and like they bring over this big like lasagna, and like, dude, I must have eaten 8,000 calories of just pure carbohydrate and this like Italian meal. And I remember I'm sitting there, and I remember my stomach just distending and my whole body filling. And I literally went home, went to sleep immediately because I was probably the blood sugar went so high. I mean, like it put me in like a coma. I woke up and like instantly I was so hungry. Like it was like all of the food got burned off, and I woke up and I had been like sweating all night, and like it was just like the craziest thing happened. And I actually got up that morning and I was probably the leanest I'd been. And I was like, huh. And so I went out and ate another meal, and I went back and checked, and I was still pretty lean, and I started timing it up. And then I remember after like the second day I ate another monster meal, and all of a sudden I could see like less ab, and I was like, oh, okay. So I stopped eating, and I went back on it, and like that was how I kind of played it out. Like I would continue to eat the carb as long as I stayed pretty lean, and the minute I started to bloat out, I was done with the carb. And I ended up being able to kind of time it like that, but it took a while to get there, and it worked really well. So whenever people ask me like, hey, I want to do something like a ketogenic diet, I'm like, are we doing it for health? Or are we doing it for performance? Or what are you doing it for? And if they're like, oh, I'm just training, I just want to try it, then I usually give them that. If somebody runs into us that like, I'm doing it to mitigate cancer because I'm in chemotherapy, I'm like, well, then we got a different form of keto. So the one that we're doing is a little bit more inspired by Morrow stuff, opposed from what you look as a traditional ketogenic diet.
So John, can you talk about, so let's say you have like really 3 groups that are, our sheet kind of splits up the parameters, like who are you, what's your training look like, what are your goals? And we kind of use it as a weight management, gain, maintain, lose. I train heavy, I train medium, I train light, yada, yada, yada. But for the average Joe, what can they expect when they get into this? Like, what is the, what are they going to feel like,
Like Tom made a great point. He said, he goes on the keto, and he'd been eating obviously a pretty high carb diet, and kind of going through that sugar carb withdrawal people lose their minds. Yeah. I mean, I've had people that, I can't do it. I mean, it's pretty interesting, like to hear people like their addiction on things. I mean, so.
Yeah, well, maybe, Luke, to maybe insert a couple of things. One, I think training is far more important than nutrition, coming from a nutrition major.
Well, no,
right?
I mean,
so,
you told us this years ago, and I think we asked, given the opportunity to either sleep more, eat better, or train more, of all the 3 that you've looked at, I mean, obviously you want to do all 3,
yeah, for sure.
but the one that you've said makes the biggest difference is the training.
Yeah. Well, because, and here's why. You could think of it from just a skill perspective. Sleep the best you can, eat the best you can, right? And let's just assume it's 100% verifiable that's best for you. You don't go out and become a world champion tennis player or golf or football player, right? So just from skill alone, you have to do what you're going to compete in if you're an athlete. But what we know about now, forget about skill now just look at the impact of, let's say, the body responding to stimuli or stimulus or something. Exercise turns on all these genes that benefit our health, and that's been proven. The nutrition and sleep, yeah, there's definitely, I mean, it's important. I'm not saying it's not important, but relatively speaking, there's lots of data on in the military about sleep depriving soldiers and, feeding them almost nothing for rations, it's a very low calorie diet, and still they're marching, miles with rucksacks or backpacks, whatever you want to call it, and they're able to survive. Now, part of that's like a little bit of a natural selection process,
I was gonna say.
But my point though is that is something that if it's done right and you do the rest right, you could literally take an average guy, and most people will swear he's on steroids just because he's dialed things in. Most people don't take the time on a training side to figure out what's appropriate for them. So they're kind of already starting at a disadvantage.
Sure.
And then they're going to try to compensate with that disadvantage by other things. Take supplements, even though it may not be dialed in. So from a hierarchy, I would first say, okay, one, make sure you're getting enough sleep and your lifestyle is organized so that you could train effectively and do the other things you need to be healthy effectively. Then once you have enough sleep, make sure your training is dialed in so it's appropriate for your current level of fitness and let's just say health, And then I would look at the nutrition around that. And so that's kind of like a framework or a context. And I wouldn't stick any diet that works now. I know that maybe 6 months, 9 months, it's not going to work, right? Your body adapts and you got to figure out what to do next. And I like the idea of varying things. And I think it was Tudor Bampa years ago was the first guy I heard talk about the concept of periodized nutrition.
Which is
is
what we do. We periodize it.
Yeah.
But but one thing, and I was actually another thing just personally I wanted to ask you about is so you're obviously very familiar with different diets.
Yeah.
And probably have tested everything, looked at everything, and the one that we've always talked about is something like the Zone, where hey, this magical balance of macronutrient ratios will protect you with everything, and that the if you can hit these macronutrient ratios, it doesn't really matter what the food quality is. Like you can still stay in the zone with spray butter and like this, and you can zone and get performance out of beer and potato chips and this opposed from these. So there's this big thing right now too in the deal where it's called if it fits your macros, where people figure out hey, this is the macronutrient ratio I want to eat. As long as I hit these macros and I eat the total, this amount of caloric, I guess, daily load. Like if I'm gonna eat 2,000 calories and I gotta eat it 40, 30, 30, it doesn't matter how I fit or the food that's in there, as long as I hit my 40, 30, 30 and I hit my 2,000 calories.
Yeah, so long term, no, that wouldn't be sound, right? Because micronutrients matter, and if you're only looking at macronutrients, you're not taking into account the vitamins, minerals that we've identified that are important for health. But maybe more importantly, recently there's things like tangeratin from tangerines. There's tomatidine from green tomatoes, not tomatoes that are not ripe, but the actual green color. And there's all kinds of chemicals like C3Gs. These are all phytonutrients. So these are very powerful, let's say, substances in fruits and vegetables that could totally impact someone's health. So you could take people that have trouble with blood sugar, and you could put them on a lower carbohydrate diet, right? But then it doesn't address why they're having trouble processing glucose, right? Like ideally, you want a body that can handle anything you throw at it.
Sure.
And essentially, the way I kind of look at it is, I want to be able to do whatever I want without a penalty. In any form, whether it's biochemically, structurally, neurologically, however it is.
Well, this kind of goes back to your Caitlyn Jenner dream.
Dude, I don't know why you got to go there. I'd like to keep some things to myself. That's what I'm trying to say.
Well, as soon as I see you getting because all of a sudden as soon as I feel you trying to slip on the lab coat, I gotta zing you to try to bring Doctor. I'm bring Inky back. Yeah. But no, I mean it's
a stun gun.
Yeah, I'm stop it. But the that's the hard part I have is You'll never convince me that a diet of trying to figure out and like count calories and look at macros on the back of a box of fucking Cheez-Its is going to be as beneficial as eating things like we talked about, like I think years ago, we talked about after we did all my allergy testing on foods, when we went through it, and you made a great point to me once. You're like, here's the green foods, here's the yellow foods, here's the red foods. I want you to eat all the green foods. And I was like, well, these are all, and I remember the one thing you said is they're all one ingredient. He's like, if you just eat one ingredient and you eat a diet of basic whole foods, you will be dramatically healthier than somebody that does not eat this diet. And you're like, all the research in the world that I've done talks about if you eat a basic, a whole food diet of diversity, and Roy G. Biv, eat for color. He's like, you are going to be dramatically healthier than the people that eat out of a vending machine.
Yeah. One thing I'll want to say to that point is that, regardless of, let's say if you're doing some sort of cyclical ketogenic diet, even when you're in a ketogenic portion, so like the lower carb, there's still plenty of, if you look at that, rainbow diet chart we created, at the first column, the glycemic load is so low, you could eat all those foods every day and still be ketogenic, right? And this is where, years ago, United States Department of Agriculture created these ranges for macronutrients. And if you looked at what they actually put out there, you basically could be high carb all the way to low carb. You could be a ketogenic or no ketogenic stuff at all. In other words, you had all kinds of extremes. The ranges were broad enough because they understood that there could be different diets that would work better for different people. So the message was not everybody should do the same thing, but unfortunately, the message that came out was low fat everything.
Sure.
So even though that's never what they said, it's kind of what got translated, and so they got heavily criticized. Oh, you just want low fat, and then all the cardiologists jumped on low fat, primarily because they were seeing all these fats in the blood go up, and they didn't know other ways to address it, so they just said low fat.
That's a one-to-one. There's fat here, let's remove fat out of the diet. But we know that's not the case.
Yeah, it's definitely not. But the thing is that there's lots of ways people can achieve things in a healthy way, like still get all the micronutrients while they're achieving the macronutrient ratios they're looking for. So the way I kind of look at it, it's kind of like getting the best of everything in a way. Like if your goal is to lose, lower blood sugar to facilitate fat loss, I will say in general, fastest way to lose, let's say, fat weight in general is a lower carb diet, generally speaking. That's not looking at drugs and other tools that could be used simultaneously. But another way of looking at it, like you have different perspectives on solving a problem. I personally, I prefer to train more or train harder, however, to, let's say, get the body composition change I'm looking for. Because one of the things I found is that if I were to, let's say, cut back to maybe 3,000 calories, or God forbid, 2,500 calories, or at a
Per meal?
Yeah, per day.
Oh, I was gonna. Well, you forget I've eaten with you, you son of a bitch.
That was the old time, though, right?
Oh, what are you talking about? That was like 2 weeks ago. We go to dinner with Tom, and he's like, oh yeah, like he whispers to the waitress, and literally they come out with this like seafood tower, like they put it in the center of the table. I can't even see Tom and his Dr. Christie, and like Luke looks at me, and I kind of like shrug my shoulders, and we go to work, and like I thought that was the meal.
Where was that at?
That Ocean Club. No, Ocean Club, Mastros. So they bring this seafood tower, and we like crush it, and I'm like. And they're like, "Are you ready to order dinner?" And Tom's like, "I'll have, And I'm like, "Look at the lady."
I'm like, "Add some muscle." That's all.
I was like, "What's the smallest steak you got?" I'm like,
yeah, and Christy's like, should we get some caviar? And Tom's like, yeah, get 5 of them. Just get five big old bowls of it.
I'm like, oh god, and I'm like, dude. And then of course, Tom doesn't order off of the at certain nice restaurants. There's 2 wine menus. There's the wine list. They bring you one wine list, and they have a reserve list, or what I like to call, the Incledon list. So they come over and they're like, "Oh, Dr. Incledon, here you go." And like, he has to blow the dust off it. So no, okay. So, you know, you and I have come to the same conclusion, and probably I've stolen this from you, and just, you know, too many hits to the head makes me forget to give you credit. But I'm the same way in that I rather increase the training load than start pulling calories.
Yeah.
Because the problem that I've seen when I start pulling calories out of people is they're okay for a couple of days, and then they binge.
Yeah.
And it's almost like the body is like, we're in deficit, and they like do something. And like, you know, having done, you know, worked, you know, and I really prefer to work on the training side, but unfortunately I get stuck on the diet side with people and helping them, you know, kind of meet this deal. And the one thing that I won't do for people is, right, you know, like, I mean, we have people that do that, Tyler and Leia, and the guys do a great job for us doing that. But the problem that I ran into is I'm not going to spoon feed you. Kind of like, you know, when you and I talk, you're like, hey, this is the principles I want you to follow. If I have to tell you at this meal you need a Triscuit, a rice cake, and a, you know, like I don't have fucking time to do that bullshit. And you know what? And like, but that's what I think people need is like this specific. Is what people want is they want a blueprint. If I do this training, I eat this diet, will I get this result? Sure. And it's I think people are trying to really mitigate, you know, any type of like, you know, anything outside of what they want to have happen. But the problem is we know that doesn't work like that. But the one thing that I'm fairly convinced of in all of my work, and not only on my side but working with different people, is the people that ate what I would call the you know, that kind of one ingredient, more basic type foods, always perform better than people that didn't. And you know, and they just always ended up with body composition better. And even the bodybuilders that I used to train with, as soon as they started getting ready for their shows, the one thing they did is they dropped all the liquids and they dropped all the bullshit food. And they figured, and they knew that real food, real meals, being able to chew, digestion starts in the mouth, all that were key components to not only being lean, but also putting on muscle and being able to step on stage.
Sure. Well, so do we want to talk about the adding the muscle mass? Because there was one other thing I wanted to talk about, the cartilage.
So yeah, let's finish talking about cartilage, and then let's talk about cartilage, and then let's wrap about muscle mass, and then anything else you want to talk about. And then if you want to get into your bag of tricks there,
yeah,
Dr. Jellyfinger.
Yeah, in terms of creating a systemic environment to facilitate tissue repair, that's where I think some of the application of restrictive blood flow therapy training.
Yeah.
And the reason why I mention that is it'll kind of dovetail into training for muscle hypertrophy as well. But ideally, what you could do is you could even take things like knee wraps, right? So a guy could take something like something he may already have. You don't have to buy for new.
We're actually been over for the last year, been using the blood flow restricted training in our training cycles, not only Jack Street, but we're even going to throw it in some Field Strong in some of our training programs. And then recently, through you and also one of the docs, Dr. David, that we know, who's an orthopedist down in San Diego, we got hooked up with the Katsu guys as well, and so they dropped off some units, and we've been testing the Katsu, which is super cool, but not really cost effective for the average consumer.
Yeah, most guys. So the thing, let's say the slightly different thing, in this context, I would have, let's say, like a wrap applied around the top of the thigh.
Do you need a demo girl?
No,
I don't think so for this one.
Okay.
But basically, the idea was you want to do some type of exercise protocol for about 20 minutes. And the idea is you want occlusion, but not, let's say, a high intensity. Like in the cats, you could probably go up to like 400 units on there.
Well, that's actually the only one we ever use is the 400.
Yeah, but so you don't necessarily, well, I guess if I was just starting someone out, I could just crank these bands and have them. They could be pedaling, you know, a recombinant cyclotometer. They could be walking. Could do
Is
things.
it better to use the BFR post workout, or is it like because where, you know, we've always used it like as kind of an ancillary item. We're like, hey, we're going to bang heavy weights, and then we're going to do all of our kind of little finishers. You know, kind of do some, you know, smaller muscle groups and hit it, and do some high volume type stuff to kind of use the BFR. Yeah. But the guys that I met with Ketsu made a great point about doing it as a warm up.
Yeah.
And like, hey, like, you know, put the bands on and ride the bike, do some sled drags, move for, you know, 10, 20 minutes and see how you feel, and then go into your workouts.
So if you look at the research that was coming out of Japan, that's sort of the basis for a lot of the Katsu stuff, they basically use lower levels of compression than, let's say, some of the stuff we've done. And
what were some of the levels of compression?
So they have, like on that Katsu device, the protocol is they do this thing like priming the system.
Sure.
So it'll kind of like, imagine you have the band around you, let's say the arm or the leg, doesn't matter.
So they're doing capillary refeeds.
Yeah, exactly. So it's just kind of pulsing on and off, and then you're basically getting the body ready for some of the blood flow restriction stuff. But in terms of, if you look at data from other groups, if you try to generate high lactate levels and you keep that sustained for time, that dramatically enhances growth hormone and IGF production throughout the whole body, which impacts tissue repair around the whole body.
Well, we call that lactic bathing, which I don't even know if I should say those words. Which is an inside joke. Years ago, not to go off on a tangent, but I think you and I discussed this. I was at a seminar and somebody asked me about CrossFitters and steroids. Mm-hmm. And they were like, these guys are so muscular, these girls are so muscular. And I kind of scoffed a little at the guy and I was like, dude, you realize I played in the NFL? The guy's like, what do you mean? I'm like, have you ever seen NFL guys in the locker room with their shirts off or anything? And the guy was like, I don't, not really. I was like, you think CrossFitters are in good shape? I'm like, I played with guys that, let's say CrossFitters, 5'10", 180 pounds. I played with guys that were 6'4", 260 pounds that carried more muscle mass and made the average CrossFit guy look like he never touched a weight. Mm-hmm. And I was like, I come, and here's the crazy part, you got a guy who's training, 3 to 6 hours a day in CrossFit. These guys don't even lift weights. Yeah. I played with genetic freaks that took their, I remember I was in had a locker next to a guy that naturally had striations on his legs and on his low back. Yeah. And I remember thinking to myself, I'm like, is this guy he's got a Christmas tree with striations, and he eats fucking, chicken McNuggets and drinks Slurpees, right? So but the thing I said, I was like, the one thing that I've seen about CrossFit that is by far the most impressive thing is the female athletes, because I've been around female athletes all my life, and the amount of muscle mass and performance that the female CrossFitter is carrying is higher than any other sport, anything else I've ever seen in the world. I've never seen girls carry that much muscle mass. Now, if a girl's doing bodybuilding and this,
I would say some of those female sprinters in track and field.
They are, but not the upper bodies.
No,
I mean, sure. Like calf, shoulders, and this, and which we know is a dead giveaway for usually performance enhancing. Yeah. And so, but here's the thing: I refuse to believe that every single girl in there was performance enhancing. And I trained, China Cho and these other girls, and I knew they weren't on drugs.
Yeah. Plus, the volume of training I see CrossFit athletes do is way higher than most athletes. Yeah,
but the one thing, and we tested this with China pretty early on, was I realized that if we did that, the lactic acid threshold training that they were doing, the glycolytic type CrossFit work, was creating a very favorable anabolic environment by flooding the body full of lactic acid. Yeah. So these girls were doing it, and then also having a less efficient nervous system. These girls were able to lift a higher percentage of their 1RM for more reps. I mean, we watch girls come in and squat, 5-10 reps with 90% of their 1RM, which you and I could never do. And then on top of it, we know that testosterone is obviously for men is produced not only in the adrenals, but also in the testes for women not having testes, by doing so much high motor, high volume work that they're cooking their adrenals and, getting some form of, testosterone response, high protein diet, which was never real cool for chicks to ever eat. So now you have a situation where girls were doing, lactic acid threshold type training, banging a higher percentage of 1RM for more reps, or eating a high protein diet, and they're cooking their adrenals with all this extra work. And whatever recipe and the volume is so high that these girls are doing is producing results that are more dramatic in terms of physiques than I've ever seen on girls. More so than even the girls that are doing bodybuilding and type stuff that are on the drugs. Mm-hmm. And so the people equate 1-to-1. And so the comment I made to this guy is I was like, I don't really jack dudes. Like you can walk into, you can go to the Texas relays and find high school kids that are, just jacked. Yeah. But in terms of the female CrossFit athlete, that to me is probably the most impressive thing I've ever seen. Mm-hmm. So that was kind of the, I don't even know how we went down that fucking tangent, but so you're saying the BFR, the lactic acid.
Yeah.
Oh, and do you agree on what I said? I wasn't totally off base.
What specifically?
Everything.
Wait, dude, you want me to go back through 30 years of shit you told me?
Well, just fucking rubber stand and be like, John, everything you said is right.
You're always right, John. There you go.
Yeah. That's all we need.
Well, what I wanted to make about the restrictive blood flow therapy type exercise, done the right way, it takes into account research from different groups. So years ago, like kind of warm up was like.
Do you want to write a protocol?
Well, I plan on writing a protocol. I got protocols for testing. Cause
Well, I mean, like this decade. Yeah. like that's the problem.
Dude, it's just because every time I'm sure I got it, something new comes out. It's it's like the never-ending story, right? It's like you just keep writing it.
So I started writing a nutrition training book 5 years ago, and I should have just fucking published it. Yeah. Because every year goes on, I learn more, and I have to go back and rewrite it. And now I'm at the point where I'm like, fuck, I should have released it when I thought I knew everything. Yeah.
So well, I'm afraid to open my mouth because every time I open my mouth, I wind up getting wrong, and then it's like But my intention, let's just leave it at that. My intention is get the new website done, and I want to set things up so it's interactive where I could collect data on people. And then what I want to be able to do is something like, let's say every 1,000 people, or it depends on the numbers and the metrics. I just want to pull a guy randomly and say, all right, we're going to do all your testing, do all your nutrition, all your training, just programming, just to show what it would do like to an average guy.
So you're going to become Willy Wonka.
Yeah, I think so.
Like somebody's going to get a golden ticket, and then you're going to show up and you're going to put them in the Wonka baiter, and the next thing you go up.
So over the years, I probably got 6, maybe more guys that have put 30 pounds of muscle on or more in less than 30 days.
Well, and didn't you train the Night of Champions winner, the last drug-free winner of a professional bodybuilding?
Wasn't
it Night of Champions?
No, it was the Arnold Classic.
Arnold Classic.
Yeah. So basically, that guy is. I didn't train him. I helped him with designing like nutrition and I guess we talked about a lot of theoretical, conceptual stuff. But essentially what we did is we just did testing and then figure out what to do and then testing. And he was doing back then, it was a lot of VO2 max and body fat testing were like the two big things back then. It was a long time ago. But that was a guy, talk about freaks. The guy's walking around, he's all muscle. And people were accusing him of being on steroids. And, I work close to a lot of guys. I got all their blood chemistries and stuff like that. So it would be highly unlikely a guy's taking a drug and I don't know about it because of all the different things we test for. And I couldn't find any evidence he was taking any drugs. But at the same time, in front of me, this guy is probably like more muscular than anyone I've seen. And he's adding muscle. Where traditionally in bodybuilders at that time, would lose muscle to get ready for a show because they were doing 1,000 calories a day. This guy's doing 4,000 calories a day. Well, now fast forward a few years later, and a lot of people saying, you're on drugs. He's like, I'm not on drugs. And they were accusing him. And then one day, he was doing a presentation. He's a very articulate speaker, and he goes, well, I finally figured out how to show everyone I don't take drugs. And everybody was like, what do you mean? How are you going to show that? And he showed a picture of his father and his uncle. They're both jacked. And you know what they do? And everyone's like, what? And these guys have huge calves. They walk. They walk. Well, that's their exercise program. They walk. And that's basically after that, no one accuses them of drugs anymore.
Didn't you tell me the story that he's at wins the show and everybody's all excited, and, high-fiving, great work, and then didn't you tell me the dad walks up and the dad was just as jacked? And
his uncle.
Yeah, his uncle. And all of a sudden the dude had volleyball calves. He walks up and you're like, oh fuck, we didn't do anything.
Yeah. Well, it's just so funny because all these guys are talking about their training programs to get size, and here's a guy that walks and he's bigger. but it just shows you that, genetics do have some impact. We can't control the genetics, unfortunately, at least.
Well, you kind of can. I mean,
like
gene expression.
Yeah, you could definitely influence the genes you have, and that's now tie into some of the other stuff.
We talked about this years ago about gene expression and what happens early on in your life basically sets the tone fairly early. I think the problem is, and the thing that I laugh about, and as I'm sitting here and we're having this conversation, I'm trying to play the Rolodex remember game of almost 2 decades of conversations. Yeah. And there's certain things that I kind of click into the Incledon file. And the one thing I think we talked about was children that were exposed to exercise
before 16,
before puberty.
Yeah.
If they're exposed to some form of exercise, I think it was strength training, gymnastics, a different deal. Wasn't the Russians did 2 study, or they did 2 group, or okay.
Even practically, I could tell you, if I were just to look at my friends over the years, the guys that started working out like 12, 13, 14, in other words, significantly before before 18 or 19, by the time they went through puberty, it was like hulking out overnight. And all the other guys that waited till 18, 19, I think they do definitely add on muscle, but I don't think they ever get to that same level unless they really put it as a serious endeavor to try to get more muscle.
So there is a priming, like a priming the nervous system effect, and I think it was there was a study, and I wish I saved all this shit that I read, but there was a deal where the kids that were exposed to some form of physical training, whether it be like gymnastics, sprinting, running, weightlifting, Olympic weight deal, before puberty, once they hit puberty, gained muscle and strength at a greater rate than those that didn't, and there was effectively a priming the nervous system deal. I mean, my daughter started in gymnastics at 2 years old, and it's pretty amazing. Like when we go there, and we go early, and I make the girls sit and watch all the older girls compete and train, and like they're out there watching, and like the level of physical development that these 10, 12, 13-year-old girls have, and even the guys, is not only is a pretty astounding, but I always think like all these people are like, oh, I want to be in great shape. I'm like, you should go watch these gymnastics girls because these chicks are fucking Jack Street.
Yeah.
I mean, and if you watch
But again,
their
it's
training,
volume too, right? They're doing stuff every day.
well, they are, but also if you watch their training, you know what they do? It's a series of max efforts. So like in gymnastics, there's really nothing you can do slowly. So everything, so like watching these girls, they put their foot in the ground, they have to run as fast as they can to hit their tumbling routine.
Right.
They land, and then you know what they do? They walk back and they rest, they recover. And so what they do is they do 3 hours of max effort followed by max recovery. And like, but they do, and it's, they're rotating, they're on the floor, they're on the beam, they're on the vault. They literally rotate through all the implements. So they're doing some form of, almost like a periodization, in that they're not training the same thing over and over again, and they're doing a series of max efforts, and they're training 7 days a week for 2 or 3 hours. And, just like me, I like to refer to myself as a hack exercise physicist, exercise scientist, sitting back and trying to look at this thing in terms of like a grander sense of what does the training look like, and why are these people getting the results they're getting? Because I guarantee these girls are not eating perfect diets. They're probably not sleeping enough. I mean, they have technology, school, all these other things. But the one thing that they're doing is they're training consistently, and they're doing everything at max intensity.
So we got another question here, and I'll just kind of let Tex frame it up.
Pertinent. So epigenetic evolution and training's connection to accelerated adaptation.
Well, epigenetics, and Tom, I'm sure will talk more about this. I mean, epigenetics is what I think is what not your gene expression, but isn't the epigenetics your?
Well, I guess in the context of the question, what are they looking for? I guess I'm not sure I understand what the question is.
Repeat it again.
So training's connection to accelerated adaptation. So your training as an individual, how will it affect your kids or your kids' kids? I read a pretty interesting thing about it from a genetic standpoint, that we are the product of our grandparents. And did you hear this?
No, but I'm good.
Oh, yeah, so they talked, I mean, you looked about, you were about to disagree with me on this one.
No, I was just thinking of it, if it's something a little different, that's all.
Oh, well, the way the guy talked about it, I can't get my head to stand still, was that we're the product of our grandparents, and that, some of the problems that we're running in today are, gene expression for, what our grandparents might have done, opposed from what it looked like, 20, 50 years ago. So that's it.
Yeah, I was going to say that, I find I find answering anything with genetics, epigenetics, or let's just say anything in the genetic world, tough to answer, because I see a lot of data on what's called post-translational modifications. So essentially, if I could summarize some stuff, years ago we had this Human Genome Project going on, and we thought, hey, we're going to find out all the genes in the human body, and then instantly we're going to cure all these diseases. And now we discover every gene in the human body, and there's not a single disease cured. And the reason is we realize, well, that DNA gets translated into RNA, And in RNA, there's all these post-translational modifications. And essentially what it boils down to is if we were to test every possible scenario, the individual we were testing would die of old age before we come up with an answer, because the microprocessor simply can't, it's not fast enough to look at all the different permutations. And so you kind of need an interface between artificial intelligence and you need an interface between assessments, like a light-based technology to assess you in real time, along with the knowledge of all the genetics and the microbiome and all this other stuff. So, you know, the stuff that we're looking at right now is way more than just genetics alone, you know. And in terms of, though, how our training would affect, let's say, generations to come, certainly it's clear that when I observe families I work with, the families that, you know, both were athletes, the husband and wife were athletes, and you see their kids, there's definitely talent there, right? But what was a direct product of the genes coming together versus a product of the training, that's hard to say because there's so many other variables. And what I'm looking at right now that maybe impacts that even more is more of the microbiome data and the let's say the probiotic type stuff, because I see that there are maybe 100 or more genes that can be influenced by organisms in the digestive tract, which would impact not only how we respond to training, but also impacts what we pass on and how our kids respond to the stuff that we do. So it's a lot more complicated that I could probably answer right now, because I don't think I know enough, basically.
Yeah, I mean, maybe the idea is that obviously you're handing down genetics through the trade. I mean, there's a good observation that a lot of professional athletes have professional athlete children. You know, it was pretty renowned. I mean, you go in, and I always talk to guys and be like, my dad played in the NFL, my uncle played, you look at professional baseball and all of a sudden you see a guy like, Prince Fielder. I mean, his dad. I mean, so it's weird, like, to see guys now and you hear the last name and you're like, oh, that's so-and-so's son. Or Ed McCaffrey's boy, who's, Heisman Trophy. I mean, I remember his dad meeting it and, like, seeing these, and then, you watch, and as an NFL player, there's a lot of kids around because, guys obviously have kids. And I remember, John Runyon's little boy, John Daniel, is, just a little tiny kid. All of a sudden I get a picture from John, and here's his son in a Michigan uniform, and he's out there, 6'4", 275 pounds, 16-inch foot, and, he's growing up to, into the person that we knew he would based off of his dad. The apple doesn't fall far from the tree. So I think there's a reason for it. And I always thought, you can give, genetics is what's given to you, your ability to take and mold and have all those things around you. And really that, nature versus nurture becomes, such a key factor. I mean, I had a guy years ago, this is 2009, his dad came to me and he said, if I pay you $50,000 today, can you guarantee my son's going to get a scholarship? And I was like, for what? And he goes, football. And I'm looking at the dad, and the dad's about 5'7". And I was like, what position? And I was like, do you have, what does mom look like? Oh, my wife's, 5'3", she's a little shorter than me. I was like, do you have anybody lurking in your background that was like 6'5", 6'6", might have been an athlete? And he's like, no. I was like, I can't guarantee that, I can't take that money and bet you that money, because he said, I'll give you this $50,000. If he gets it, you can have it. If he doesn't, I'm like, I'm not taking this bet. But like, for me especially, I mean, all of my brothers we're all about the same size. My mom and dad, my dad's, good sized guy, but my, wasn't an athlete. My mom, and I always ask my dad, I'm like, well, how did we, I'm like 6'6", my brother Rob's even taller, where did that come from? And my dad was pretty funny. He's like, do you remember your Uncle John, who you're named for? And I was like, not really. He goes, he's about 6'7", and he showed me a picture. And they were, Midwest farm guys. And my dad grew up in the Midwest. He's like, dude, there's a whole side of your family that you don't know that were big, strong country farm people that, that you guys look like. And he goes, that type of genetic lurking in the background, just like, the myostatin gene stuff. Like they were able, those of you guys know what myostatin is. there was an anti-myostatin gene. Myostatin is the blocker for muscle growth. And, you know, that's another thing with the BFR. It actually is, we read some pretty extensive stuff about, myostatin blockers with the BFR, but they ended up finding this kid that was born that didn't have the myostatin blocker gene. And the kid was already pretty muscular. They went back and researched his family. And like there are these pictures of his uncles and family, and dude, they all looked like pro bodybuilders, and like the mothers, and like they were like, you know, somewhere in like, I mean, I want to say like Northern European country. And they, you know, or the one guy that's got a VO2 max that's greater than anybody. So I think that there's propensity with genetics, but obviously if, you know, and I think Dan John made a great point to us once where he said it's geography and genetics. You could be the world's best hammer thrower, but if you don't grow up in Finland or around somebody who throws the hammer,
Right.
you're never
How
going
you gonna learn it?
You're never going to learn it. You're never going to express.
Sure.
You know, there's a reason being that all of a sudden, like, all the best throwers or all these different, like, you know, kind of niche type of deals, all of a sudden the kids have parents that, you know, like, you know, my mom was a snowboarder, I learned to snowboard, and now I'm the best snowboarder in the world. Was it genetics or was it opportunity? You know, had you provided your child the opportunity, and, you know, is there a genetic predisposition that allows them to be maybe have an edge over somebody else? So I think at the end of the day, you know, you can only control what you can control. And I know that, you know, giving your kids opportunity to be able to do athletic things at a very young age. And I firmly think another big one is putting them, whether it be in a diet, in a sleep, or whatever it looks like, to avoid sickness. The one thing that I've noticed most about our kids don't get sick. And they go to school and they play and they do things. The other kids that I've seen that are sick more often are at a greater disadvantage because they don't get as much opportunity to do things. So like we have a friend whose little kid's sick all the time. They're not nearly as like vibrant or like, you know, like it just opportunity. So it's kind of like going to school. If you're sick all the time, you don't go and get to learn as much. So, and that's it, you know, sick days. So I think the genetics thing, I think we thought we were going to figure out a lot more than we did. And then we got to the end and we were like, shit, we don't know any more than we used to. So.
But just like opening up a whole new world of confusion.
Yeah, I mean, it seems like every day we go on, we get more and more confused. So the one big thing too, and I want to wrap about, is not only the probiotic, but also the gut biota and the stuff, you know, the bacteria within the gut.
So I started talking about the restrictive blood flow thing only because years ago there was kind of like this concept about warming up where you might do some sort of slow cyclical thing, maybe 10 or 20 minutes, and then move on, and that kind of phased out, and then guys started doing other stuff. In terms of training evolution, if you know, I've gone online and looked at all these different programs and stuff, systems for, there's not a lot that takes into account on the neurology and the cartilage biology, and where sort of the restrictive blood flow training and some of the cartilage biology sort of come together, is that you know, getting back to what we said earlier about fixing stuff you don't even know is damaged yet in your body. When you, let's say, walking on a treadmill, and I would probably prefer people walking in something soft like grass, but just say treadmill, because that'd be more typical, I think, in a gym environment or something. That less, you don't want a hard impact. So you're gonna be like running on tile, let's say, or concrete. But that's sort of a somewhat soft impact for about 5 to 20 minutes. That's kind of the right environment to activate chondrocytes. So those chondrocytes can take in things like glucosamine and chondroitin and start making more cartilage. And so, you know, you hear a lot about glucosamine and chondroitin supplements and cartilage repair, but what you never really hear about is how to optimize the function of the cartilage, the chondrocyte, the cartilage cell, to take that material and make new cartilage. And so when I, you know, like you can't, it wouldn't be, it'd be hard to say my whole day is all going to be focused on exercise, right? I got to live the rest of my life. So one of the things that I've been playing with is using just knee wraps. Basically, I would cinch them as tight as I could, but you could use a Katsu Global, let's say 400, at the top of the thigh, and then maybe up here, maybe like 100 for your arms, and then just walking for 20 minutes on a surface that doesn't aggravate, let's say, arthritis or any cartilage surface in your body.
What about like an assault bike or a Versa climber as you're doing something like that?
So the thing is, I don't know if it's enough of a stimulus. So like you need mechanical, like the chondrocytes have to be compressed, and like there's got to be like a compression expansion, and I don't know if you get enough of that from like a bicycle or cycloergometer or some of these other tools. So I think those tools are great for muscle. I'm talking about if we're talking about like regenerating damaged tissue. Most of the athletes I see, there's some form of arthritis or something going on. Maybe not at the level that holds them back 100%, but it's the stages are there. I'm seeing kids in their 20s and 30s that have arthritis that years ago I wouldn't see till the guy was 40 or 50.
Wow.
Because, well, think about all the organized youth sports now that kids are engaging in maybe prior to 10 years of age. So by the time they're, 15, 16, they maybe would have 10 years of sports.
Sure.
And organized, there's a lot of the same repetitive movement pattern instead of crazy running around stuff.
I was at gymnastics, so I take my girls on, I was just there on Tuesday with them, and I always, these guys know I skip out of work and take the girls to gymnastics because it's one, I like to be there to see it, and two, I want to interact with their coach, and I want to talk, and I want to see how they're doing the training. But I had a dad in there who his daughter's in the same classes as my girls. And so we started rapping a little bit about training and what, and he's like, oh, I can tell you lift weights. And I was like, yeah, I lift some weights. And he's like, what kind of training program would you do for my son who's, I think he's 9 or 10 years old? Mm-hmm. And I was like, well, oddly enough, we're doing a test right now. We're running a little in-house test with my nephew and 2 of his buddies who are pretty good baseball players, but they're not really good runners, and they're in that kind of awkward kind of prepubescent stage where their coordination is not real great, and even though they're pretty good baseball players, they don't run very well. They don't pick their knees up, and so I employed techs 2 days a week to put them through our sprint protocols and just basic warm-ups and movements, and see if we can develop kind of a pre-puberty, neurological efficiency sprint, just basically teaching them mechanics, teaching them arm swing, knee up, toe up, and just, basic mechanics, and see if we can translate it and help them. So I talked to the guy a little bit about it, and he goes, well, what about strength training? I was like, I think doing some form of strength training, but that's going to be completely predicated on who's administering the program. I'm not going to tell you to go up and, go find some trainer for your kid because they don't really have the knowledge in the way. And I was like, if you want to do something for your son, tell him to come to and do this gymnastics. So the girls go to this, it's like a fucking factory, but this Azarian place. And the Azarian guy was an Olympian in the 50s. And they've had Olympians and a bunch of kids, go to the Olympics out of this facility. And I was like, you know what? Bring your son here. And he goes, why? I'm like, have you seen the tumbling? The movement. A big part of athletic development is body awareness. Your ability to move your body through space and in relationship to other implements. Mm-hmm. And I was like, for a strength training program pre-barbell, something to prime your kid and help him be a better athlete, I think this would be really good. And I was like, well, what sport does he play? He goes, oh, he's playing tackle football. And I was like, wow, it's pretty early. And he's like, well, I thought if I can get him in there early, he'll learn how to hit and won't be at a disadvantage when he gets to high school. And I kind of like paused and was like, wow, that's absolutely fucking the worst thing I've ever heard. And the dad kind of took a step back and he's like, well, what do you mean? I was like, dude, I played 10 years in the NFL and I didn't start playing football until I got to high school. And the dad was like, well, what'd you do? I'm like, I did martial arts, I boxed, I played basketball, I did all the sports, and the majority of guys I know that played in the NFL played other sports that fostered their athleticism. Sure. I said, football is not a sport that develops athleticism in the sense that you think it does. Yeah. It's one of those sports that tests great athletes when you mix grit and grime and ability and strength and perseverance and all those, and asks you to kind of mash them together and then go ram your head into somebody. Mm-hmm. But I was like, you have to teach somebody or allow somebody to do something athletic to foster athleticism. Mm-hmm. And what we're doing here, I said, the gymnastics is great. I said, the only hiccup, or really the only missing component of, as a training system for athletic development gymnastics is it's all straight ahead. Everything is moving in a straight ahead deal. If you watch, everything could be done in a hallway. Mm-hmm. Whether it be tumbling this, the only thing that would be some form of multi-plane would be like the pommel horse. Mm-hmm. But even if the uneven bars, and I kind of went through it, and I was like, so if you brought your son here, and he did some form of gymnastics, and then he was also doing something that fostered some form of lateral movement, like played basketball, soccer, or something that, you know, was hand-eye coordination, you know, allowing him to change moves of hips like baseball. I was like, I think that's a great training program pre-barbell for an 8 or 9, maybe even 10-year-old kid. And the dad was like, well, you know, I wanted to get him in football early because I didn't play football until I got to high school. And I felt I was at a disadvantage because the other kids were stronger and hit harder than me. So I thought if I got my son in earlier, and I was like, dude, you can't relive your shortcomings.
Yeah.
But then I went back to the idea that, you know, people fail at the margins of their experience.
Yeah. One of the things that was a real, I think, eye-opener for me, so before I ever worked with, let's say, an NFL caliber athlete, I would have said you got to be, you know, strong and you got to be fast, right? And I don't know if I would have said much more than that. And then when I actually started working with football, like NFL caliber athletes, not even college, but at football, at NFL level, the thing that really surprised me was the agility and the body awareness of the higher level caliber athletes. And those are things I never really heard discussed. Like all the years I took all these advanced training of athlete courses, it's always like, you know, strength and endurance and flexibility. You don't hear about body awareness and agility.
Because those guys never played the sport.
Yeah.
So for me, and really what we talk about with, you know, all of our training programs, and you hear, dude, I mean, strength is the platform on which everything's built. I firmly believe given two athletes, everything identical, the stronger athlete is the better athlete.
Oh yeah, but there's the assumptions that both can move.
Well,
and
yeah,
all that.
but this is the thing. Like I played with dudes that could lift the gym. I played with dudes that bench 600 pounds. We go out on the field and you slam those guys.
Yeah.
Because one, they don't have the quickness, the understanding, the body awareness, their ability to move in space in relationship to objects. And so a huge part of our hierarchy of the power athlete, you know, when we start drawing, like we use Mel Siff, who would another good friend of yours, which I love to talk some Mel Siff stories. But Mel,
a lot of those, man.
I know he drew up his pyramid, you know, of basic hierarchy of an athlete, and you know I call it the power athlete pyramid, which we've gone back and really kind of revamped it in a lot of ways. But one of the key components of this thing is body awareness. Your body's ability to move in space in relationship to you know implement objects. Because I watched it all the time. You know, you get down in your stance, and there's an individual, you know, anywhere from 18 inches to 36 inches away from you, and I have to be able to move my body in relationship to another person. You know, timing, understanding, you know, how the play moves. I mean, all these key factors, and then I have to be able to, you know, have this task-specific tension to be able to move, you know, where I'm not like this, but move well, and then almost be able to coil and hit, which is that task-specific tension that you go from like relaxed and fluid to explosive, and then be able to continue to move. I mean, it's one of those things where I don't think I learned to do that playing football. I actually learned to do it in martial arts. I learned to do it in boxing and fighting, where you know you're able to move and hit and punch and do all these things. And I remember when I went to go play football, it seemed like fighting against a bunch of dudes that didn't know how to fucking fight. And that to me, and all the you know, like learning how to cut off the ring, or more importantly, the boxing, the footwork type stuff that we did was so much more beneficial. And I tried to explain it to his dad. I was like, if your son wants to be a better football player, tell him he has to come here. And I was like, and on top of it, have you seen how many girls are in there? And the guy's like, what do you mean? I'm like, if I was a 10 or 12-year-old boy and I was interested in girls,
I'd go where the girls are.
I would go where the girls are. And not only these are these, I mean, they're, you know, girls that are in phenomenal shape.
Yeah,
Don't
right.
go to the mall.
It's like natural selection's done for you already.
100%. Don't go to the mall and hang out like Luke Summers at the payphone smoking cigarettes, trying to pick up mall rats, right?
Everybody's got to do something.
So we have a question that's kind of on this line, but really not at all. But before we get going, do you want Ashley to pick up pancake, sausage, and bacon and bring it over here? You guys famished, hungry?
No.
Or are you good, Dr. Tom? You good?
It would be weird if we ate during the Talk to Me, Johnnie live.
Who cares?
I just don't want people to see me drooling. You know, that's all.
But so a little backstory on this. No, we're good.
I'll wait for a little,
Yeah,
a little while.
but the backstory is I don't know. I'm sure you guys. I'm not real like I'll talk about my kids. Like I don't post pictures of them, but we had a little boy about 3, almost 4 months ago. I brought the baby out for Dr. Tom to analyze. He looked all symmetrical. But so Luke and I, when I found out my wife was pregnant, sat down and we put together the master plan of what things a father could implement with his son, unbeknownst to him, to not only help him reach maximal potency in not only athletic development, intelligence, but the ability to pull chicks. So we sat down and we're like, okay, how does this whole thing work? And we were like, okay.
Well, what does he have to be able to do by the time he's 18 in order to be like
Set for life.
The fucking man. So we were like, all right, so what type of skill? So we were like, okay, he obviously has to be able to think on his feet and be able to talk, right? So like, the ability to walk over and open up on anybody.
Yeah.
So that salesman ABC.
Yeah.
Intelligence, be able to talk intelligence. So he's got to be good in school. The big one is dexterity, so playing the guitar.
Okay.
And this goes back to when I was in college. We had a backup quarterback who injured his shoulder. They brought him in, had a lot of talent. Ended up never really realizing it. But we're there in the dorms like day one, and all of a sudden we're like hanging out with all these people, and like somebody says something. He's like, oh, you got a guitar? Let me see that. Pulls out. This dude was like Dave Matthews on a guitar. I think he slayed every girl in the place. I was like, fuck, how come somebody didn't tell me about playing the guitar? So Luke and I were like, he's got to learn to play the guitar, but like how to fight, how to box. So like we sat down and created this idea of a Renaissance deal. Mm-hmm. But so it's this kind of master plan for my son though that we were working on. But as I was sitting with this dad, I tried to tell him like, if you want your son to be a better football player, bring him to this gymnastics thing. And on top of it, if he's interested in meeting girls, bring him here. And this dad like looked at me and he was like, I'm just telling you, like when my son is old enough, when he's 2 years old, I even asked the gymnastics coach, I'm like, how early can I bring my baby here? And she's like, 9 months. I'm like, can we do it 8 months? I'll pay for personals. But like that type of stuff, I mean, if you could take an athlete and actually put him into like a system like we talk about with agility, with strength, with speed, and all the different things that we kind of put together, but also foster play, like my daughters are a great example. And this was completely by observation, but there's a family up the street and they have 2 little boys, and when their son is slightly older than my daughters, and before we had our son, the girls were up there and they have Razor scooters, and I have my own Razor and I ride with them, and their little boy was just learning to ride his bike. He has a little brother who's like maybe 18 months, maybe not even 2 years old. And that little kid is tearing it up on the Razor scooter. He's out there shooting, and I asked the mom, Lexi, I was like, dude, the little man's so good. She's like, I know, I didn't even show him how. He just literally saw his brother, picked it up and started doing it. And I was like, the older kid kind of sucks. He can't even ride a bike and he sucks at the Razor. And she's like, yeah, I didn't get him the bike or the Razor until he was like about 3 or 4 years old, until he felt like he was old enough for it. But I was like, but you had them there when the little man showed up and he just jumped on them.
Yeah.
And she was like, yeah. And I was like, do you see an issue with this? And she's like, no. I was like, you provided opportunity. Yeah. And that's why later kids, it's kind of like the first thing we did after we started gymnastics, I got a trampoline and I started buying different implements, and I got balance bikes, other bikes. I got everything and just put them out there and didn't really show them anything. They'd see us ride around on it, or I'd play on things, or my wife would jump on the trampoline and get on it, and then all of a sudden the kids would see it, and it was just because there was opportunity to do these things. Mm-hmm. If there's a piano in the house or there's a guitar, and you give them lessons and it's there and they're into it, then I think it's opportunity. It's kind of like, man, I want to get bigger and stronger. Well, you don't go to the gym and you don't train. What do you think is going to happen through osmosis? Mm-hmm. So a big part of training, and this goes back to my ex-girlfriend. She was a 800 meter runner at Cal, and she was super talented. And I asked her, I'm like, how did you get into it? Her dad held the world record in the 800, and her mom was NCAA champ 800 meter runner. They met at a track meet in Europe, got married, had kids, and what do you think they did every weekend? They went to the track and ran. and both her and her sister were all, NCAA scholarship track runners. And I remember rapping with her dad. I'm like, "What'd you do?" He's like, "Well, before they left the house every day, they had to do 10 hurdles over the couch. They had to do pull-ups and push-ups, and he had a whole training regimen that they had to do after
Nice.
breakfast before they left in the morning, and they did it their whole lives. And these girls were fast. They were in good shape. I mean, they were literally people thought they had such God-given talent.
Yeah.
It just so happened, though, that they were just given the opportunity to go to the track.
Sure.
And then also, anybody that has kids, what do kids do? They are observational creatures. They watch, and then they mimic.
Yeah.
And this was probably my most telling moment as a parent. So when I drive around here, especially, there's traffic, and I find myself doing this all the time. I put my hand on the wheel, I put my head back, and I go, "Fuck." Right? Because people cut you off, and we live here in Southern California where the traffic is shit. And sure enough, I'm driving, and I get cut off, and I look, and all of a sudden I hear my daughter in the back look up, and she goes, "Fuck." And she was about three years old.
I'm sure your wife loved to hear that.
Oh yeah, my wife, I see her looking at me, and she's like, looks at me, and I'm like, I can fucking see it. Right? And so it just means that, and that's what people don't realize is that children learn, and there was pretty extensive study on this, children learn their gait, they learn how to walk, they learn how to do movement patterns. That's why you have kids that walk like their parents and this. I mean, children learn by watching and then mimicking, whether or not you know they don't or not. So, I mean, that's why.
And they learn fast.
Super fast.
By the time you figured it out, they already got it figured out.
So that's why I think the second time around, you all of a sudden have all these different, deals. So I think if for anybody that has kids or wanting to have kids or your wife's pregnant, look at what you want to have available to them and then fucking go get it. If you want to learn to ride a bike, whatever it is, have these things and then have them be interested. I mean, there's a reason that Tiger Woods, became the golfer he did. Why? He went and did it with his dad every day.
Sure.
I mean.
Hey, Luke, what was that question you said before?
Well, I kind of want to just
Expand a little bit on Cash's adventure. We sat around and I'm like, here's what needs to happen, and here's what we have to be able to facilitate. So he needs to be going on a bus trip, right? And the bus breaks down and gets a flat or something. So he needs the ability to get out, change the tire, take the motor apart, with his bare hands, okay? Determine what the issue is, and then call for an SOS. And then, they're in the middle of nowhere, so it's going to be about 40 hours before they get help. So now Cash has to be able to set up camp for everybody. And by the way, this is a co-ed event, and the ratio is 10 guys to 20 girls, so it's 1 to 2, right? So he sets up the camp, he builds this shelter, bare hands, but in order to build it, he clearly has to rip his shirt off, so he's got to be jacked and shredded, right? He starts a fire, right? And then, and then somebody's like, oh, someone brought a guitar? The old 6-string, boom, starts busting out Dave Matthews Band in front of a fire, and then starts doing backflips and pull-ups. And we're like, okay, so now this, yes, exactly.
And then he whittles a bow, uses the guitar string to bow to hunt an animal, which he comes back and skins with a spoon he sharpened on a stone, and then is able to cook an amazing 5-star meal for everybody based off of what he was able to foster himself.
So I'm like, John, how do we prepare for this incident?
We started with the very first one, and my 2016 resolution is I wanted to learn to weld. So I was a really hack welder. I could do enough to tack things in place, but I wanted to MIG and TIG weld. So I ended up basically bringing who I call the vampires, because they sleep all day and work at night. But the vampires are down a couple doors down, and we opened a shop where we work on off-road trucks. And so I wanted to learn how to fabricate and weld, because I figured those were skills that people should know. And motors, transmissions, how to basically build different things. So that's what I do in my spare time. If I'm not here, if I'm not at home or lifting weights, I'm down there basically learning to fabricate and weld and do some different things. And really that came from one of our family friends. I mean, he's really our godfather. I mean, would you say Roger is our unofficial godfather?
I think he's basically everybody's godfather. Dude, the guy you went to our gym, and he's just he makes friends with everybody. He always knows a guy, and it's we'll give you the shirt off his back at the drop of a hat.
So Roger is he's a union pipe fitter welder by trade, and pretty much one of my favorite people on this earth. In that, like, if I called Roger and I was like he's my lifeline, right? So if I'm like, what do we do? Like that door that you guys, I don't know if you guys can see it, but Roger made in his garage. He was like, hey, I'm gonna make. Luke's like, hey Roger, can you make us a door? Roger's like, yeah, no problem. He like hand pounded those rivets, found that steel, like made the most amazing.
It looks like a gladiator door,
dude.
right? Like you could ram that with a tree.
Yeah,
and it's not going to break.
Oh, and like found all this like decomposed wood, like driftwood stuff, like all the I mean, like he showed it to us, and like he brought it over, and I was like, I think I'm gonna fucking cry. And like Callie was in there, and like she teared up. She's like, "That's the nicest thing I ever had." She's like, "I dream of it being in my house," and I was like, "Well, that's never gonna fucking happen because that thing's going with me." Yeah, I'll take that wherever. It'll be in my house somewhere. But like that level, and I remember Roger like fabricates, and I remember him being like, we were doing stuff on my Blazer, and he like went over there, and he was like, going through tools and this and doing it. And he's like, you know what? You need to learn to do this better. You got to learn to weld. And I was like, well, that's my 2016. So that type of stuff where like. That you should be proficient at enough things to be like, oh yeah, hey, I can jump in and do this. And so that was really the goal for my son, is I wanted to be able to offer him, enough diversity and be like, hey, my dad can do all these things, and and then also provide him with mentors, like people like Tom Incledon or Roger or Luke or these guys that have something very unique that they can do, that they can teach. And I think like as a father, and I don't know if people look at it the same way as they did maybe 100 years ago, that my job as a father is to impart what skills I feel my son needs to be successful in life. And in today's internet age, we've kind of got away from a lot of those things. Like people can't change their own tires or, do this. I mean, you should be a Renaissance man enough to be able to do enough things. It's kind of like when we had that argument, you were telling me about that guy that doesn't drive and doesn't do anything. And I was like, fuck him. You should be able to drive a car. You should be able to put in a light bulb. You should be able to do all those things. And I think like for me, especially like looking at my son, he should be able to go do all that stuff. And if he hasn't, it's because I haven't provided him the opportunity to do those backflips. I mean, and I think like as a father, like that was something I really wanted to provide. And then on top of it, having daughters, what type of things, like what type of opportunities or what things do you want to impart with your daughters? One, the biggest one is self-esteem. Two, they need to know that their daddy loves them, and whatever happens in this world, daddy will fucking be there with the fury of 1,000 suns, like an avenging angel, if they call. But because I think women or girls run into problems where they don't feel like somebody's there for them, so like that one, and then provide them with skills, like they start jujitsu, and at 4 years old, and in 10 years, I'm pretty sure they'll be able to rat pack any motherfucker that fucks with them. They should be able to, like hunt, shoot a gun, drive a car. I mean, all these things that, people like, oh, this is my daughter, she doesn't need to do those things. Fuck that. They should be able to, they should be as skilled as a boy in every way. And I think like, as a parent, and I count you as a mentor as much as anybody, for the mere fact that like, we have conversations, you bring me new information, you give it to me, I leave, I come back, we have conversation. And I think like in the same way, a parent has to be a mentor and not only a teacher. And so we sat down and figured out what that blueprint would look like and hopefully implement it. So
what was that question?
Oh, it was honestly about pancakes, but I do have a question earlier that's, I think a softball lobbed it up,
Okay.
and
More in your wheelhouse. So, what are your thoughts on testosterone boosters and fat burners, like kind of the marketed stuff? Does stuff work? And then if someone was going to look into this stuff, what should they be wary of? What's your advice?
On testosterone boosters, I'll share with you right now that the good percentage of stuff in the market that appears to work is contaminated with real steroids. So
what you're saying is I can get real steroids over the counter?
Well, but you don't have control of quality and quantity.
Okay.
That's the issues, right? So if you were to analyze the stuff and then, kind of screen out the stuff that's got actual either Viagra or testosterone in it or some other sort of synthetic version of testosterone, the remaining stuff that's there, it's just not reliable or dependable. And right now, one of the things that I spent quite a bit of time analyzing testosterone products, looking at the marketing and stuff, and one of the things that just shocks me is that how many people, like, you see basically a picture of a guy that's on steroids, swearing he got that way from taking the product that he's in the ad for. And when you talk to people individually, everybody's like, oh, that's bullshit, we know it's not real. Yet somehow these companies are doing 10 million a year. So someone is believing this. And it may not be the people I know, but someone else out there. One of the things that has to happen is people have to stop being so gullible, because all that's really happening is you're teaching unethical individuals, hey, sell shit because we're going to buy it anyway, right? So the way that if I was looking at stuff online, I would look to see, okay, what are the ingredients? Are the ingredients standardized for something? I'd maybe go to PubMed and search out some of those ingredients. I would look to see what's the history of the company. Has any of the founders, owners of the company had FDA sanctions against them or FTC sanctions? And I would look at just, is there any research on the individual ingredients that actually doing what they claim to be done? On the, let's say, formulation aspect of it, if it claims to do things like boost testosterone and decrease estrogen and affect DHT, I'd be very careful of it, because we know from testing people, one guy can have low testosterone and his estrogen is low. So I would not want to use a strategy to suppress estrogen in that guy because his estrogen is already low. I could actually hurt that guy if someone did that. So when I look at products in the market that are testosterone boosters, but they have like an aromatase inhibition component to them, that's not a good strategy for a guy to start with if he doesn't know what his estrogen levels are, because then you run the risk you can increase joint pain or actually reduce libido further. So, and then as far as the fat burner stuff, the stuff that is proven consistently to work over time is green tea extracts. They raise metabolism, and red pepper extracts like capsaicin, they actually increase your ability to convert fat into energy. So what you don't see is they're very inexpensive for the most part. Guys don't take them and instantly get shredded. It takes maybe 1 to 3 months. I would say on the fat burner side, I would first want to make sure someone's diet is appropriate for what their current activity and health needs are. And then as they show their diet is working to help them get in shape, I would use a fat burner. It's sort of like icing on a cake later on. I wouldn't use it for fat burning purposes as an everyday thing, because then all what happens is people just start to violate it and eat beyond it and stuff like that. But things like outside of fat burning, green tea extract, things like capsaicin, they're very powerful anti-inflammatories. They have health benefits beyond fat burning.
So I guess on the same, or go ahead, Doug.
Yeah, I mean, in terms of the testosterone stuff, the only product that I've ever used that I thought that actually have performance data on and is the Renew Male. And I remember when I got my blood work done pre and post, and we started really looking at the blood work. I have a blog post. I actually never hit publish on it because I think people were going to call bullshit on it. So Tom has a product called Renew Male, and where it really started was there's an extract from a plant. What is it?
Eurycoma longifolia.
Yeah, so Eurycoma longifolia.
Yeah.
So Tom buys this stuff in like its purest form, and he has like a brick, like a kilo, and he's like, "Hey, come check this out." And he shows me, and he's like, "You want some?" I'm like, "Is it drugs?"
Yeah.
Like I felt like he was over there. He's like, "No, it's this testosterone booster." But he goes, "It only works in this super high quantity in this purest form." And he goes, "The problem is nobody makes it in the purest form, so therefore, but you give me this pure deal." And so he scoops it off, like gives me a little bit, and then like a deal, and he gives me this like tiny, like I'm talking like the smallest spoon you've ever seen. And he's like, "I want you to put it in some orange juice because it's so bitter, you're gonna like freak out."
Gag on it.
And so he literally gives me this stuff, and I'm like, "Nah, it's this little shit." So I put a scoop in there, and I take it. And instantly I'm like, dude, I feel pretty good. Like, neurologically, I mean, like my training's going good, everything. We go get my blood work done, and my free test count was like through the roof. And I like hit him up. I'm like, what's going on? You're like, dude, I'm telling you, this shit works.
Yeah.
And so we were using it pretty extensively. And then all of a sudden, I'm like telling everybody about it, and then it ran out. And you couldn't remember that? And then I started getting hate mail. People were like emailing me like, I can't get any more, I can renew mail. Where is it?
Well, so when I spent, I think 2 years developing that originally, and the uricoma herb has been around for a long time. That's not like a new thing. It's like ginseng. It's been around for a long time.
Sure.
But it wasn't until, let's say, I don't know, maybe 5 to 10 years ago that they really started understanding how to isolate some of the active components and standardizing it. So prior to that, like, you could have bought this and it could have been like, oh my God, it changed my life, or you could have bought it and nothing at all happened.
Sure.
So there's not really good balance of control there. And then as we started testing into the components and doing dose response testing, I mean, we did thousands and thousands of samples with different herbal extracts to try to figure out the right combination. Finally figured it out, and that took years. And I probably spent a couple $100,000 of my own money, and none of that was published or sold to anyone, because I really just want to figure shit out for myself. And then once we figured it out,
It's because you're selfish.
I am, man. I'm very selfish. And then once we figured it out, then I'm still trying to have more muscle than you, so I have the edge. Right? We're trying to when I get to 330 at my height, then I'll tell you what I'm doing. Okay?
This is true. Thank you. He's like, don't worry, I'll tell you about it after I figured it out. He's like, fuck you.
So I winded up finding a facility to make it, and we really, I want to say I think we just had like 2,500 bottles, right? Was made, so it's not a large number. It's not a lot of material, because we did a soft launch in New York City, and we sold out at about, let's say, 2,000 bottles, because we didn't think we were going to sell 2,500, so we didn't bring everything with us. And the majority of the people buying it were women, which totally caught us off guard, because it's a male product marketed and targeted to men. There's nothing feminine or about it at all. And that was the older label, the white bottle,
Sure.
not the current one. And so
Were they buying it for their husbands?
yeah, and that's the thing I totally didn't anticipate.
That women purchase
I didn't,
the
right. So women buy more stuff than men in general. Not
Even for men.
Yeah, right. And so what would happen? I interviewed some of the women, and they said, "Well, we're buying a product for our husband or our male partner because they got an issue, but they're in denial." So I'm like, "Well, how are you gonna get them to take it?" And they're like, "We just tell them it's vitamins." I said, "Okay," and things are working. And I just thought, wow, I never saw that, and that actually opened up. I hired a female psychiatrist and a female psychologist and a social worker. So I hired these 3 women. So looking at some of the psychological ramifications in the relationship. So imagine a guy can't get an erection, and how does that guy treat his female partner now, and when in a marriage and stuff like that. And so what tends to happen is there's actually quite a bit of research on this, that the man blames the woman, and it creates all kinds of tension now, instead of the guy saying, "There's something wrong with me, I got to figure this out." Right?
Sure.
And so we winded up looking at ways to now target those women that are in that situation, because one, we knew we could help the guy, so it would be a great way to get to him. And then after that sold out, then we went to the next version, and that's the version you're talking about. So each generation of product, we look at the research that came out up to that point in time from other groups, not just our group, and then we try to address and incorporate it. So we have like the core herbal ingredients, and we have other stuff we've been adding to it over the years. And the next batch, when you guys started promoting it, it just sold like crazy.
Yeah.
And then
It's because it worked.
Yeah, well, I inspect the facility. Like, I physically go to where it's made, and I make sure that the environment is a clean room environment.
This isn't
that it's
Al
not
Gore's
contaminated.
basement, is it?
No, it's not in my bathroom or anything.
I was going to
It's a real
say,
place,
well, it's at Al Gore's basement next to the internet.
Oh, that's right. These are real facilities that, everybody's got, like the
Yeah.
face masks and all that, the gloves and all this other stuff, booties for their feet. And, but I also, because we have a lot of athletes that compete under drug testing conditions, I had to make sure that, forget about what's in the product, but there's no cross-contamination.
Sure.
And then when I started realizing the only way I could guarantee no cross-contamination is to make sure no banned substance is in the entire building. Because if it never comes in, there's no way to impact this. and that was the safest bet. And then we would test it. We'd test at the beginning of the run, in the middle of the run, at the end of the run. Well, those things, just raises, it costs more, to get all this stuff implemented. And where I'm at right now, well, by the way, so it's Renew Male, the same product is also Recovery Performance.
Recovery Performance.
And the reason is I had a couple of coaches and trainers saying, look, we don't really feel comfortable with our athletes having a product that says testosterone and growth hormone label, and we don't want any issues. So I said, all right, I'm just going to make a new label, same exact product, a new label, new name, but it doesn't say anything about testosterone. It just says enhanced recovery.
Sure.
So it's a very softer message, if you will. And then that's typically a product that would be like the NFL guys or the NBA guys would take it or something. The next version, we'll probably got another maybe 10 weeks or maybe 12 weeks is when the next one will come out. And what I'm working towards now is I found all these different ingredients that have been proven to work, but they're trademarked or they're patented by other groups. So I'm finalizing a licensing deal, and I want to take all their stuff and put it in our stuff. So not only do we have the stuff we figured out, but I have the stuff other guys have figured out. It's probably going to raise the price point. It's probably going to increase the pills or the pill count or size. But my commitment is I want the best shit I can make because I'm going to take it myself.
And you do take it. I
Yeah.
mean, I've seen you cram 40 pills in your mouth at a time.
Dude, you don't know how far you can go unless you test it, right? You got to test the waters. One of the things I will say though about Renew Male that one of the things I found early on is we always recommended people take it like in the morning or prior to training, because of the research that it directly affects testosterone and things like that at the level of the testes, so like the Leydig cells. But there's other data about other components affecting it at the level of the brain. And so in terms of like with guys with libido and erectile dysfunction, stuff like that, I started having guys take it at night, and across the board, guys would tell me, dude, this works way better when I take it at night. And the distinction I wanted to make is we always assume a direct effect is stronger than an indirect effect, and knowing some observations I've made and some of the data we've collected now, that's another variable. So time of day, right? So one guy could take Renew Male in the morning, and that same guy may take it at night before bed, and it might work better for him at night before bed, or it might work better in the morning. And the reason is there's multiple pathways the product works, so you don't know which pathway would be stronger in that individual until he tests it.
Wow.
So it gets back to, people have to be able to do some sort of objective testing on themselves as far as time of day of the product. And I found in terms of like recovery and muscle soreness, if I just take it every day, I could train real hard. I don't get as sore as when I'm not taking it. But in terms of like frequency of erections and testosterone spikes and things like that,
Jeez, Tom.
taking it at night is better,
Yeah.
way better. Yeah.
Well, what?
So what about females? So at the symposium, Dr. Tom was at our symposium last year and had some samples for us, and that was great. But traditionally when we talk about like test boosters, we're curious about like male. What how does that work with the female population?
Keto test. I mean,
Here's the thing I would say though. First of all, about the Renew Male product, the name was the physiology would be similar in men and women. The biochemistry would be similar. The difference would be the tissue producing the testosterone. The label was because the target market was men, right?
Sure.
But if you can ignore the label and the name and just look at the components and how
could
they
we
work.
have Renew female?
Well, we could. I mean, I have that name brand and stuff like that. In general, I get more guys asking me about testosterone than I have women asking about libido, right?
But I mean,
but this women can take the same product. The thing about women make testosterone in the ovaries, and then it gets converted to estradiol before it's released. They also make testosterone in their adrenal glands. But what Renew Male does, it stimulates luteinizing hormone from the pituitary down. So there's the potential that women will make more testosterone as well from taking that.
and also it's also beneficial to take Renew Male for the guys. You were telling me that you saw some of the best results from the guys that were on some form of hormone replacement therapy.
Yeah.
Like by actually keeping the testes and the LH firing up, and you were saying that like actually that was kind of a hidden benefit that you didn't really see.
So there's some data, like you got to dig deep to find some of this stuff, but some of the ingredients in Renew Male right now, they'll work it'll work with HCG synergistically, meaning, in other words, if you take them together, you get better results than either one alone. And it also counters some of the gonadal suppressive effects for men that are taking testosterone. So it'll prevent some of the testicular atrophy, and it'll prevent some of the change in the brain.
The good old raisin nuts.
Yeah.
And don't ever want those. That's embarrassing.
So we have another question from Leia, actually. Let me pull it up here. But it has to do with labs, I guess, for testing supplementation. So what are your favorite companies for micronutrient testing? Like for the...
I would interpret that as testing your own blood.
Okay.
I would interpret that as testing supplement.
So your favorite lab is you, I'd imagine, right?
So, but we'll keep in mind, so the way that our business model is, I don't own any lab. Years ago, I actually had a lab, I bought all the equipment, did all the testing ourselves, and what I realized is as new technologies come out, there would be no way I could constantly stay up to date on the latest technology because it'd be cost prohibitive. So around 1989, I started working on connecting all these labs from around the world. So we collect the blood and we process it, but then we distribute that blood all over pretty much the United States, but we can send it anywhere.
Well, I mean, when we go get our blood work done, I mean, I've seen you, and you've broken it down. This lab does this amazing. Right. This lab does this, and this. And, I've worked this deal, and like you've gone out and basically created a network to find the best information. You're like, this lab does this great, but they don't do this great. That, you've done kind of the heavy lifting and finding who the best people in the world are. And that's why whenever somebody hits me up, I'm like, dude, honestly, I can like tell you this stuff, or you can go to Tom and you can reap the benefits of world expert.
Yeah. So in terms of the labs, we use, when we do a micronutrient analysis, we do short-term, let's say an acute to middle term, and then a long-term analysis. We use SpectraCell Labs and we use Genova Diagnostics, let's say, to cover those three areas. And we standardize the collection process. And one of the things I'm working on right now is creating a cheat sheet for people to get, if they're going to get blood work done. One of the most frustrating things for me is people contact me, hey, I have my blood work done. I got this deal, and I got my testing done. And I'm not trying to criticize anyone for taking initiative on their own, but there's, like, when it comes to your health, getting a deal is not maybe the best thing, right? Because
we always say that there's a few things that you should pay full price for. One of them is plastic surgery.
That's right. No discount on this plastic surgery.
No discount on plastic surgery. LASIK eye surgery. You never want to get a discount on that one. Free tattoos are never free. And what was it? I think there was another one I had in there.
What about tires?
Used tires? I'm okay with used tires. Like that doesn't
Well,
bother.
I mean, if the treading is, if they're bald.
Yeah. As long as I don't see any belts, I'm okay. But like, just in terms of some stuff, like the other one, and the big one is, and I'll throw that in, is cheap supplements.
Yeah.
There's a reason it's cheap, and I remember, Luke, when we put the Incledon works together, when you did that presentation for us, Luke like went on Amazon and was like trying to create the Incledon works at this like most minimal cost. He's like, "What do you think?" And I'm like that isn't like doing that. Like I'm sure there will be benefit, but what Tom, and so like Luke and I had a really interesting conversation about that, and he's like, "What do you think?" I'm like, "You could try it," but I was like, at the end of the day, like, I'm not going to try that deal with the like the government where I'm going with the least,
So like every consumer out there, I'm cost conscious, right? Because the way I rationalize in my mind, the better price I can get something, then the more different shit I can take, right? If nothing else. So, but what I found consistently over and over again is when I would test stuff, I could go into like a major retailer, and they may have a trademark ingredient, and it's actually a high quality ingredient, but the study was done, let's say, with 1,000 milligrams, and they're selling people 5 or 10 milligrams. So even though it's a quality product, though the dose is so low, it's ineffective. And so then if you were to factor in, okay, I got to take 100 of these or 200 of these pills, now the price point is so high, it would have been cheaper to buy the 1,000 milligram product at a higher price point initially, but it's working, and you don't have to take 1,000 pills a day, right? And those are the details that it's hard to show people side by side. And one of the things that what I'm kind of angling toward is I think a lot of this stuff should be given away for free because it's stuff that, in terms of like the information, I've already figured it out and it's reproducible and it works. And at this point, like I don't want to. People are going to say, "Hey, can you explain this to me?" The problem is well now it's my time.
Sure.
So I got to charge a guy for my time, but it's basic information. So my solution for that is we'll just put it out there for free, and then the strategy would be like, well, hey, okay, Mr. Client or patient, whatever the relationship would be, please read these documents first because it'll save you a lot of time and money later on. So now in the beginning, I've already created tremendous value for people, which some people will get.
Well, you realize nobody's going to read it.
They may not.
No,
They may not.
we run into this all the time.
But then if they don't read it, that's okay because then you could say, look, it was available for free here. You chose not to read it. And if you want me to hold your hand and do this, that's okay. But this is how I get paid for a living. I don't go to your work and say, stop making money to help me, type of thing. And I think most people are sensible and reasonable enough to understand that. But what I was
You
going to
mean
say
like
about,
people in person or like virtual people on the internet?
no, in person. I
Oh
mean,
yeah. People in person are
Yeah.
usually reasonable. When you get to the internet, people.
Yeah, their alter ego.
Oh,
Well,
yeah.
like here's the thing which I love is like you meet somebody and like they seem like a reasonable person, and then over email or the internet they're completely not rational people.
Yeah.
Like the I would have thought that actually the internet being like separation, like not actually seeing somebody, would have created more callous people, but it's worked in the exact opposite. Everybody takes everything an offense on the internet, but yet people don't take things offense in person.
Right. That's true.
Like it's completely different. Like the amount of sensitivity on the internet is much higher, or maybe that's how people really are, and they just don't let you know in person.
Yeah.
Because you'll belittle them.
Yeah, I don't know. But so in terms of the lab testing stuff, I want to just come up with guidelines to help people because like guys will go, they'll see like a sale. So like, okay, so recently, Tyrannos Labs, you guys familiar with that at all? So
We are now.
Yeah, so this woman goes and basically tries to raise money on East Coast, can't raise money, goes to West Coast, raises all this money.
Yep.
Now she's a billionaire overnight, youngest billionaire,
Yep.
right? Well, she's got this distribution model where her lab is using all the Walgreens, right? The mini clinics and stuff like that.
Sure.
And so now people go in, well, they can't, the states have different, regulations. So you go in and say, I want this test done. Well, you have to go back to your doctor and get a script and then come back here. Well, then if I'm at my doctor's office, they can just draw my blood right there. I don't need to come here. So so there was some issues there. Then they started advertising one drop of blood test, and they said they could do all these things, and it was totally false advertisement. They could not do a single test for one drop of blood, or maybe they could do one, but it wasn't a common test. So then that model, the FDA investigates it, says it's false. They change their message, and now it's like all these tests under $10. Well, they took a CBC, which would be a test like maybe you would charge $10 for a whole CBC. And they charge you for the red blood cell, the hemoglobin, hematocrit. Like they take the individual components and they charge you for each one. So you go in, you got a deal where you're paying like $50 for something that's $10. So you didn't get a deal, you got screwed.
Yeah, well, I remember she raised all that money off of the idea that she would be able to efficiently be able to test all your blood off of one drop.
Yeah, which was totally, she never proved it, and it was never validated.
But that's how she raised all that money.
Right. She's got pictures with Hillary Clinton and all these high-profile people.
Well, it's because she was probably giving them money.
Yeah, well, so now she has zero value. Her stock plummeted because the FDA kept coming after her and saying, this is not true, this is not true, this is not true. So they kept changing their message and their model. So essentially then some regular people started going in, getting their blood work done, go to another lab, go back to the doctor. Doctor's like, you got diabetes or you have this problem. Found out that Tyrannos Labs were over 30% higher in terms of the values.
Yeah.
So it didn't correlate or anything. Then it came out, some of the labs couldn't do the test. So you would go into Tyrannos, they would take your blood and send it to a Quest or LabCorp, but it had been sitting for too long, so it violated the test parameters, but they were still giving you the results. So there's all kinds of like fishy things going on. So I don't know how much longer the company's going to be around.
Did she have to get back all of her money?
I don't know, but I mean, well, when you invest in a company, if it's gone, it's gone.
Yeah, but I mean, if somebody, I guess you can sue them if it's fraud.
Right. Well, so the thing is, this gets back to I don't know how they portrayed the fundraising efforts and stuff like that. But my point is that people coming and saying, "Oh, I got this deal." So they were getting a total testosterone test done for like $12, and I'm like, "There's no way." I was like, "My cost, I do all this. I do millions of dollars of business with these labs, and I can't get a test at that price, given the volume of testing we do." So if you're going to go out, like I think we pay somewhere between $40 and $80 for that test. So how is this person gonna get it? One guy on his own going to a lab and getting it 4 times less. It doesn't make sense because there's standard equipment, there's standard ways that you have to measure this stuff with, and the equipment costs 6 or 7 figures alone.
Sure.
So it winds up the guy's tests come back and they show all these problems with his testosterone. So I said, "Well, what time of day did they draw it?" "I was in the afternoon." "Okay, well, the lab tells you right here, results are accurate when collected between 7 and 9 a.m.
Sure.
So why did they even do the test on you in the afternoon when their reference range is for only applicable 7 and 9 a.m.? So he didn't get any guidance even from the lab. Like, hey, he's going there for the test. They just took his money and produced a number. They didn't give him any guidance on what to do.
See, and I think where people fuck up and they really lose sight of this stuff is, especially when they come see you, you're not paying for just the lab fee. You're paying for not only your research, your expertise, understanding all of these little nuances.
When to go relative to your training, your diet.
I mean,
all this other stuff.
you've always told me, like I'll get up and I drive over super early in the morning, come to Arizona, give it. You're like, I don't want you to train the night before. I don't want you to take any supplement, and like there's a whole protocol, and then we get the information, and it's standardized over years.
Yeah.
And like that's where I think not really short-sighted, but it's just an uneducated consumer. It's like all they do is they look and they price shop. They're like, well, this is more expensive. I'm going to go with the cheaper one. And you're like, well, dude, what are you paying for? Yeah. Like I rather if the cost was a little bit higher, but yet I can guarantee that the results are accurate to what I want them to be, then what's the value of that opposed from just randomly just fucking flushing money down the toilet?
So, Dr. Tom, let's go back to the cheat sheet you're talking about, because I think what you're getting to is the conversation we had when I was on a plane a month or so ago, where I'm like, because when I got my blood done and plenty of macronutrient deficiency, when we were talking, you're like, bro, are you anorexic? Are you starving yourself? What's your problem?
Which is funny because you eat more than anybody I've ever known. You should see how many fucking ribs this guy ate yesterday. So I thought you guys were coming to dinner. I cooked like 8-10 pounds of ribs. Luke consumed
most of them.
A slab, but it was one slab. But I've noticed significant difference on the packs that you've sent me. And I'm like, we got to create a cheat sheet for people because there's a high barrier of entry. I want to get our people in touch with you. Like, what's your vision on that? How can we put this cheat sheet together so they can say, all right, Dr. Tom, make me feel like $1 million?
So cheat sheet context is how people could standardize collection of their blood, whether they go to me or somewhere else, right? Because then, what I see a lot of times, people will say, a good example, a guy will come in and he'll say, man, that's more than I was willing to spend right now. Or I found this doctor locally that's cheaper. I said, okay. And then 2 or 3 years later, they'll be worse off than ever. And then they come in and they go, dude, I should have came to you 2 or 3 years ago and followed through, because now I'm really jacked up. And I'm like, and then here's a problem. Now it costs even more money because you got more damage. It's like not changing, not adding oil or changing oil in your car. The damage on the engine gets worse over time.
So Luke, I don't know if you guys know this, but Luke used to work for this company called Navistar. And so when I hired Luke, I hired him away from this selling car parts like Tommy Boy, but he was in the heavy truck division, which is actually really fascinating because Luke's not from like the fitness health kind of deal, like performance deal. I mean, he was literally pricing models, truck parts, in Chicago, and like worked for this company called Navistar. And I remember sitting here and like him talking about the deal, about what he did, and he made a point about preventative maintenance. Yeah. So what happens is these big trucking companies, like FedEx, for example.
Yeah, UPS, right?
UPS. What they do is they, like you see the little step vans, like the little UPS trucks. They have a couple different motors. They put like a 4BT, which is a Cummins straight cylinder, which will run for 1 trillion miles. But they know that if they put that motor in there, they know stop and go the hardest conditions. So then to basically extend the life of the vehicle, they have a preventative maintenance. And let's say they do the maintenance at 5, they do it at 3. And they buy everything and they do the maintenance, and they're religious on the maintenance. And they know that the life of that vehicle will far out extend to the point where they pre-buy all of that maintenance, all those filters, all that oil, everything.
Yeah, it's life cycle cost of ownership, and it's like a unit down costs you so much money relative to just like, okay, paying a premium on terms of an increased frequency.
So we're thinking the same way here.
I took it like and just on the same with my diesel truck. The reason I drive diesels is not only are they more efficient than gas motors, but they actually because they're built for heavy trucking, they're actually much more durable, other than like an LS motor, which will run forever. But doing the preventative maintenance early, and then also the interesting thing is I just on a side note for those of you guys that are car geeks, I spoke to this dude on the phone who's a big a diesel guy, and so I called him on the phone and I was talking to him about the 6.5 diesel in my Blazer, and he said he did a test where he bought 2 identical trucks, both Duramaxes like I drive. He bought the same year, identical everything, and one truck he used exclusively as a work truck. They multiple people drove it. They towed 20,000-pound trailers. They didn't change the oil. They did everything. He goes, he abused the truck like you would never believe. He goes, the other truck was his daily driver. He kept it nice. He babied it. He changed the oil. He didn't drive it hard. He never towed. He never redlined it. And he babied it. And he goes, what do you think happened to the trucks? And I was like, I don't know. He said the one that he babied, he had so many problems with, he ended up selling it. He goes, the one that multiple drivers had, everything went that they abused and they worked hard. He goes, has 400,000 miles and everybody wants to buy it, nobody gets rid of it. He goes, honestly, we've never had a single problem other than change the oil, change the filters, change the tires.
But they were consistent with it.
But he goes, but they were consistent.
Yeah.
And he goes, for these type of vehicles, when you look at these heavy trucks, he goes, you don't have to baby them the same way. So that's just a side note, but I always thought that was really fascinating. So Luke talked to me about this preventative maintenance thing, and I've really applied it to my own car where like I as long as you are doing preventative maintenance, you can go out and drive, stop and go, foot on the accelerator, everything you can, which is the analogy. If you're going to do that, like live a hard life, like, battle, play football, lift weights, train, like live the life as you should, you have to do preventative maintenance. Your car's not going to make it to the end. But if you do preventative maintenance, you can do it. So it's almost like, how do you want to do it? So the analogy I think for you is if I'm going to live the life I want to live, which is I want to travel, I want to train, I want to play with my kids, and I want to be active and do all these things, I have to do the preventative maintenance, which is the testing, the supplements, all eating, the sleep. I mean, everything that we have to do.
Yeah. So for years I struggled with from a business perspective. The more you can standardize what you do, the faster you can scale and grow, right? But now from a human, human compassion and trying to help people on the health side. Not every person comes in and maybe has a little bit something different. So I can't create a single supplement that'll satisfy everyone's needs. I can't do a single test that'll help everyone. So you need something that's highly fluid and dynamic that can be changed. But over here, in terms of scaling, you need something that never changes, right? So you can massively reproduce. So what I've been playing with for a long time now is basically coming up with like 3 packages. And the idea behind it is, to your point about being preventative, Luke, earlier, that what I would do is essentially tell people, here's what it would look like for a year, and if you pay for the year in advance, then we can mass produce certain things.
So buying a warranty.
Yeah, but we would save them basically 2 months worth of expenses. So that's the factor. So you figure, 10 out of 12, do some of the math, but there would definitely be some cost savings for people, depending on where they're at. So I tested that with different groups. Now the interesting thing, I'm not trying to stereotype or label anyone, right? None of the athletes got it, none. The guys that got it the fastest were the CEOs and entrepreneurs, because they, and this is how they rationalize it. If I was going to invest, $1 million into this stock or into this new project because I'm expecting a return on that, I have value as a business. Me and my health has a value as a business. so I'm going to invest money into my own health because that's going to then help me. That's pretty nice. Is that what your neighbors?
No, so these guys down at the very end, they build riding scooters.
Okay.
They are like I can get behind a lot of things, but spending like $20,000 to have a riding scooter that does like 50 miles an hour. I mean, it's
not your thing.
Oh no, dude! I see them all the time, and they got like a machine shop down there. They CNC their own heads. They got a turn lathe, and like they come on Saturday morning. And usually, I thought we were going to beat them, but hopefully, they won't race around, or we'll have to go out there and just like spear take down them off.
So I guess the guys who are running, and I want to just jump in because it kind of fits with what you were saying, John, about like, hey, if you're redlining, the preventative maintenance type deal. We had a guy submit a question about special operations and special forces, and what are your thoughts on those guys are like run hard and a lot on the line? What are your thoughts on HGH and test supplementation for those guys? He was curious. He's got a bunch of guys. Is it like pack them up, or do you find the guys that need it and just targeted approach, or just I don't know.
Problem. Those guys are drug tested. So
well, if they're on a prescription, then it's allowed, right?
Yeah, I mean,
it's if they're taking something on their own, not under a doctor's supervision.
Gotcha.
Yeah. So what I would say, my experience with, let's say, military personnel that are serving overseas is these guys always have some sort of bad bacteria or organism in their bodies because they don't get, no matter what drugs are put on, the drugs aren't enough. So in terms of making impact, one of the things I would do is I would totally fortify their systems with massive probiotics until I could get, tested at some point, get a thorough stool test to see what's there. Unfortunately, the military does not do good stool testing. So a lot of those guys, they're not going to get access in the military. They have to go outside the military.
Well, the other thing too,
to answer their question about the testosterone and growth hormone, the thing about those tools is they can be used effectively, but they raise metabolism. So if someone goes into it with, let's say, low zinc or low boron or some other, it doesn't matter, vitamin, mineral, something that's low, then when they go and they raise their metabolism, they may feel good for 30 to 90 days, but after that 30 to 90 day window, they're going to feel worse because the consequence of whatever they were low in before is now reaching the pinnacle, where it's a bigger threat than maybe the low hormones were. So, what I would say in those situations, they need to make sure that they're adjusting the nutrient intake to allow for the higher metabolism, the higher functioning metabolism. I think they're good tools. The thing I would say about most docs, when I look at the testosterone protocols they use, it's just shit they got taught in a weekend course. It's not dialed for the individual.
Well, that and I was going to say, for most of these guys, they don't have the opportunity to test and retest.
Right.
Anytime
something when it's not working.
Well, yeah. So, I mean, if you think about this, anytime you manipulate one hormone, your body isn't just a one-to-one. Right. So your body's always fighting for this thing called homeostasis. So when testosterone goes up, what happens? Estrogen goes up to balance testosterone. So all of a sudden you give a guy a testosterone shot, and what do you know the therapeutic dose before it starts rebounding, and then now you run into more and more problems.
I just noticed this.
What's this, testosterone?
I just saw I thought the TV was off. I thought the screen was off, so I'm trying. Plus, you got people here, so I'm trying to look at the people as I'm talking. So I got my back to the TV.
Fucking guys on these scooters.
Yeah, just talk to the cameras now.
Yeah. So.
Do these guys hear?
So. These guys. But that's the problem. So whenever somebody asks me like, "Hey, what do you think about this?" and I'm like, "Have you got your blood work done?" Like, do you know? Okay, so if you're not low in testosterone, and then all of a sudden you give yourself I go to the doc, he gives you, or you get a testosterone shot, it goes up. Now all of a sudden you have a host of other problems that you have to mitigate or actually test. Like you got to control DHT, or you got to control estrogen, and you start having to play with these things. And the only way that because these things happen in real time, is to have consistent testing. So let's say a guy, everything looks okay, right? He takes a test, he's on test. He goes overseas, he's over there for 6 months. He works at night, so he's not sleeping during the day. His diet isn't very good. He gets some form of bacterial overgrowth in his system. He's not getting his regular deal. All of a sudden now cortisol's high, testosterone gets blocked, estrogen's high, and now all of a sudden the dose and the way that they're attacking it is completely wrong for that situation, not this situation where the doctors are. And it's not as if he's in some mud hut with a doctor pulling blood, being like, "Yo, man, we got to adjust this thing. This shit's all fucked up." So the problem becomes like, you're only as good as the information is telling you. And if you don't have the ability to collect consistent information, then it's a fucking shot in the dark.
Yeah. So I would say like the short answer would be,
It works.
It works, and I would say yes, everybody should do something, right? But now the more detailed answer would be, okay, there may be better tools in growth hormone. So for example, some people that take growth hormone develop antibodies to growth hormones. When they go off the growth hormone, their levels for the rest of their life may be less than optimal. And there's ways now with restrictive blood flow therapy, you could jack up your endogenous growth hormone IGF-1 levels, so it may question whether GH is even necessary. Or if if we have guys, and let's say we have a defined growth hormone deficiency, then we usually use peptides, or we actually use some supplements. The reason is growth hormone as a medication, the price is too variable.
Yeah.
And it's not, I need something that I can have a reproducible product and quantity and all that over time.
And especially when you're trying to buy a bunch of black market Chinese stuff.
Yeah.
I mean, dude, the amount of growth hormone, I mean, because it's pretty cost prohibitive if you get through a pharmacy.
Yeah.
But I mean, just seeing some stuff, I had one client who was asking me about it, and I was like, let's take a step back.
Yeah.
You are buying, a product over the internet from some lab in China that's shipping it over, and I was like, here's what I know. It comes in a powdered form in a bottle, and it has to be stored at a certain degree. You can't, I mean, you might pay X amount of dollars, it might show up, but it might have been sitting in the back of some truck where it was 150 degrees, and all of a sudden any type of biological agent that's in it is destroyed from the heat or the cold or different things. I'm like, that stuff's fairly, delicate in that way. And now you're going to, reconstitute it, and you're all of a sudden this stuff doesn't work, and you spent some god awful place. So what are you going to do? You're going to call some lab in China? Yeah. I was like, it's too cost prohibitive, and the variables are too many to really recommend it. And then if you go, like I know when my dad went, they recommended it. Like when I looked at the dosage, it was like half an IU.
Yeah, it's so little.
It's so low that I'm like, this is fucking worthless.
Yeah, yeah, it's kind of like what I see is I see like anti-aging clinics that are essentially they're prescription mills.
Yeah.
So some doc that can never make money on his own with his business model then gets a weekend course, gets involved with some group. They teach him, hey, just do this and make money. And then he's prescribing his testosterone and growth hormone, where everyone that walks through the door gets exactly the same thing. And then what happens is people get a lot of problems later on because it may not be the best tool. I think probiotics and vitamin mineral supplements, and like say higher level vitamin mineral supplements may be better for guys that say in the military.
Yeah.
Just in terms of long term with less symptoms or side effects later on.
Yeah, I mean, and another thing too, a lot of the special forces guys, I mean, those guys are, because they're working such interesting hours, they use certain things like Ambien, Adderall, and they're kind of like burning the candle at both ends. They're taking a pill to sleep, they're taking a pill when they're up, they're drinking energy drinks. And I think like just if you could, like mitigate some of those things and just kind of change it. But the only way is with accurate testing and, so on that question, I would, I remember I did a gig for Naval Special Warfare and, talked pretty candidly with these guys. And actually the only question they wanted to ask me was about steroids. So I was talking about training and this and supplements and, sleep and all these other things. And I was getting questions and they all kind of looked around and I was like, what? And they were like, wanted to ask me about steroids. I'm like, what do you want to know? And they were like, well, do they work? I'm like, yeah, fuck yeah, they work. Yeah. Like anybody that says they don't work, like the U.S. government tried to say, oh, steroids don't work, and fucking nobody bought that one.
Yeah.
But I was like, here's the thing, like let me explain to you how they work, and then you make a decision on whether or not you're smart enough to not fuck yourself up.
Yeah.
So I explained to them how steroids work and like how it all kind of works, and I talked about hypothalamus axis and suppression and the whole deal. And then I was like, are you smart enough to be able to know how to kind of mitigate and kind of traverse through this? Mm-hmm. And like every one of them was like, no. And I'm like, well, until you are, don't fucking do it.
Yeah.
And if you ever get to the point,
not only that, the medical. So I believe in positive energy and saying things that support communication and things growing. But I at the same time, no, I don't want to drive someone to an area where they're not going to get competent help, right?
Yeah.
So my experience in terms of a lot of the medical professionals I've met in the military, as far as the guys writing the scripts, there wasn't like that burning drive or need to get more educated in order to get a better result with the client or the patient they were helping.
Sure.
They were simply writing a script, to satisfy the task, right? So as a result, you get a doctor that doesn't really understand, the HPT axis or the physiology involved behind these things to know what to monitor. So a guy then in the military maybe gets a script, gets the medication, and then doesn't get the follow-up support to help make sure to get benefits without side effects.
Well, I mean, look,
and that's the danger there in that model is how you get.
look what that doc did to my dad.
Yeah.
I was talking about earlier. My dad had a deal where he went to my dad's 78 years old. He goes to the doc. They say you're low on T. What do? They give him testosterone cream, and he puts it on. Says he feels okay, and then all of a sudden he has that the TIA, and they think he strokes out. They don't know what's wrong. The whole deal. We get him tested, and Tom's like, for a guy taking testosterone, your body's not making anything, but your estrogen's through the roof.
Yeah.
So the doctor gave him testosterone, never brought him back to test him. Testosterone's low because he was getting pure. All the testosterone was converting to estrogen. Estrogen goes through the roof, causes blood clotting, and almost strokes him out. And the doctor almost kills him by giving him this medication. And his blood sugar was too high. All the factors for them not to do it. He does it, and instantly, and that doctor prescribing him that almost killed him, and would have never been like, "What are you talking about? This is fine."
Yeah, so that's one of the things. That's a good point to bring up. That in a percentage of, I don't have an exact percentage, so I'm going to guess somewhere around 15%. We find that some guys have a gene in their liver that taking any structure like testosterone. So I'm not saying testosterone per se. I'm saying based on the structure of the molecule, it'll have a negative effect on their liver, and a consequence will be that their blood will be more likely to clot, or would lead to a stroke or something else. So most of the time in a standard medical consult, when someone goes to the doctor to get testosterone, the legal requirements are that you do total testosterone and a PSA, total PSA.
Sure.
That's it. And so in terms of the standard of care, it's minimal. The standard of care doesn't say, look at all these other things to
Sure.
make sure it's safe later on. So what happens is
So with PSA, all they're looking for is prostate and total testosterone.
that's it. And well, that's the standard to see if you meet the minimum guidelines for testosterone, right?
Wow.
So let's just say if your total comes back high, they're not going to prescribe you testosterone, even though we know, okay, there's weak testosterone and there's free testosterone, and the free is probably more important than the total. But the standard of care doesn't require you to measure free testosterone at the beginning. So this is where, like, if someone came into our practice, we would measure all these things at the beginning. And the reason is, I don't know what matters for that person. There's no way to look at a guy and say this matters or this
But
matters.
also, if somebody comes in and they're complaining, I'll take another conversation we had. Didn't you work with a high amount of NFL players that all complained of like low testosterone, and not a single one of them had low testosterone?
Right, yeah, that's exactly right.
And then also, how many people have you brought in that were like came in for some testosterone supplementation? You get their blood work, and you're like, if we just fix this, you'll be fine. You fix it, and they are fine, and they don't ever have to go on any supplementation.
Yeah, so what happens is based on the symptoms people are experiencing, they then rationalize in their mind because they read something on the internet, oh, it's got to be my testosterone. So I had tested 10 NFL quarterbacks that all claimed first they didn't. What they said is we want to raise our testosterone levels because they know testosterone's anabolic.
Sure.
They didn't claim to have any deficiency symptoms or anything like that. But I asked a logical question for all these guys. Well, why testosterone? Why not like something else? And how do you know testosterone's even low? They never had any hormone work done. So when we measured all their hormones, what came up was testosterone for most of these guys was not an issue. What was an issue was growth hormone. And the interesting thing is 5 to 10 years before any of that data I collected, another doctor from Dallas told me that what he was seeing in his practice is all these NFL athletes, it wasn't even just quarterbacks, but other positions, that he was finding growth hormone deficiency, and he thinks it's secondary to all the head trauma and the concussions.
Yeah, because of your pituitary gland.
Yeah, so this is maybe 15, 20 years ago we're talking now,
Sure.
that he was finding that, but there was no data at all. No one published anything at that point.
Well,
and so when he told me that...
What happened when you suggested this, with this? Didn't you suggest this to the NFL?
Yeah, so in 2002, right around 2002 or 3, first on the stuff with the quarterbacks, what I found is almost all of them had zero growth hormone. And you could say, well, at rest, you should have low growth hormone during the day if you're a guy. But you then would look at IGF-1, circulating IGF-1 levels to see, like, in general, is there enough? And all these guys are they may have been normal, but the bottom of normal, or they would have been below normal. So there was no one there that you would say, oh, it looks like they make growth hormone, because the long-term markers were all so low. So going off the work of the previous doctor, I started giving these guys alpha GPC or alpha glycerol phosphorylcholine, because at the same time I was a scientific advisor to this other company, and they brought GPC to the United States. Mm-hmm. So I had data on thousands of people with head injuries and car accidents and things like that, crashing a motorcycle with no helmet, some brain trauma. And this group out of Italy showed they could repair damaged brain tissue with just this one substance. So I started giving that to these athletes, and then when I retested them over time, I could see without a doubt growth hormone levels were now coming back and IGF-1 levels were going up. But I would say that it's secondary to repairing damaged brain tissue. Wow. Now, when I took that data and I shared that with representatives, I was on the NFLPA committee, 2002, 3, and I shared it with them. I said, okay, we'll take it, we'll look at it. I never heard anything back.
Well, yeah, you know why? Because the last thing they ever want to do is
admit there's a problem.
Well, yeah, they admit there's a problem. I mean, it's like the fact that you still have owners claiming, like, there's no correlation between the head trauma and these dudes killing themselves.
Yeah. Well,
like,
there's one of the things I've seen firsthand is the number of, let's say, head injuries, and I'm not talking about just NFL, I'm talking about in all areas of life, whether it's military personnel would say explosions and stuff, people that were driving a car and a crash and their head hit something because they didn't have their seatbelt on, or soccer players, which you almost never really hear about. The soccer guys' head, they're hitting the ball with their head. You don't really hear too much about that. MMA fighters, boxers. What I would see a correlation is the pattern is there was a lot more of dysfunctional interpersonal communication skills in those situations.
Sure.
To the point where I'd be over at someone's like family dinner, and I would say that the dad was typically the athlete, and he's got kids and his wife and there's other people there, and in front of all these people, he's down playing a game on his cell phone, and he can't have a communication with the other people present. And as far as I know, I never had any head injury or anything. But what I realized is how often would I reach for my cell phone at a table with people. So it made me aware of that, and I thought, there's something somewhat addictive about the pattern and the habit of just using a cell phone. But I think when there's this type of damage, it reinforces certain things even further. And what happens then is that impacts the quality relationships with the people and the family, which then is, it's kind of like a feed-forward cycle, right? So now the relationship between a husband and a wife is weakened, or let's say there's more tension, and then you have an individual that maybe doesn't have the social problem-solving skills, how to talk to his wife to work it out, feels all alone. Now you can see how depression, suicide, all these other things come in. It's kind of like opening your brain up to all the bad stuff without having an outlet for the good stuff type of thing.
No, it's I mean, there's like in, I can talk actually personally about this because, for my previous job, something that I always really look for as the barometer is people that have known me over the course of my life. Do you see any changes? And I remember one time, you said to me, you repeated your story. I'm like, I did that for effect because it was a funny story. But then I asked,
I just want to make sure you knew you did.
Oh yeah, I know.
Because if you said, no, I did it, I would have looked at Luke, we got some problems here.
Well, no, but the story was good, and I got up there to reiterate the story because first time, so part of my humor style is called beating a dead horse. So if I tell the story and I don't get the laugh I want, I'll keep retelling that story until you fucking laugh.
That's like, you just work on a delivery.
Yeah, I'm like, you got to give a good one. But I mean, a big thing that I talk about is changes. You got to have people around you that are honest enough to be like, dude, you're fucked up.
Well, that reminds me, remember when we first met outside that comedy club?
Yeah.
The reason why I was at that comedy club is because it's kind of like it's like a small place, but a lot
Yeah,
of
it's
big
Comedy
names,
Magic Club.
Yeah, a lot of big names would go to there,
it's
test their
big.
material, and if they didn't see the laughs, they would rewrite their lines and stuff before they did like the HBO or big
Sure.
Showtime delivery thing. And anyway, so when you saying that, it made me think about that.
Oh yeah, no, I mean, but I think that's because I've noticed this even in my NFL friends, guys, and I'm thinking to myself, I'm like, this guy's fucked up because I remember how they once were.
Yeah.
And the big thing, especially when you retire, so like playing football is probably the greatest life on the planet, right? You get paid a lot of money to wholesale go kick ass.
Yeah.
You get to eat, you get to train, and
Wait, as I say, as long as you don't get hurt.
well,
Imagine if you get to your whole NFL
it'd be
career
so nice.
and have not a single injury.
I mean, that would be nice, but you do this great job. But and all of a sudden, it's so strange. Like it's like, okay, so you spent 23 years going to school, you're a doctor, all these things. What if all of a sudden you got up tomorrow and you couldn't be a doctor anymore, and they were like, we don't want you anymore, we're taking away your practice, everything's gone, and then you were forced to go find something else, and this is all you've done your whole life.
Yeah.
And really, that's what happened. So I played football my entire life.
I don't have a plan B.
Yeah, there is no plan B. And a lot of guys don't make plan B. So all of a sudden, here I am in my early 30s, something I've done since I was 14 years old for almost 20 years of my life. And all of a sudden, I get up one day and I don't get to do what I basically trained my entire life to do anymore. And they say to you, we don't want you anymore, and you can't do this job anymore. The way you fed your family, lived, your identity, everything about you has been wrapped up in this. And you know what? It's over. Go fuck yourself. Get out. And then all of a sudden you sit down. I remember the day where, when I went to, New England, and I get hurt in their last preseason game, and then they basically release me. They've been bringing me back, and they do the deal, and basically my knee's fucked up, and I got to get out of there. And I remember I went home, and I was gonna have to get surgery, and I was like, what do I do? And I remember thinking, for the first time in my life, there was really no plan. There was nothing, like nobody looking for me. Not here I am at 33 years old, and for the first time in 20 years of my life, there is not something driving me towards something for every moment of my life. And I remember being like, now what do you do? And having to sit down and have that real conversation with yourself and realize, I played 10 years. My knee's fucked up, I gotta go get surgery, and then I gotta try to figure out what I'm gonna do for the next 50 years of my life that doesn't involve football. And I think a lot of guys either can't figure it out, or maybe psychologically have taken too many hits to the head and can't plug in to figure it out.
Or think that far ahead.
Or think that far ahead. Maybe they don't have the wife, that they thought they had, or the support structure around them, or they got a bunch of hanger-on or people that they're paying. Now all of a sudden the money's gone, so they're gone, and now all of a sudden you feel all alone. And I think that feeling of depression, when people are like, oh, it's the concussions. I'm like, no. People need to feel useful. That's the one thing that I've noticed, and people ask me, oh, you don't seem fucked up. I'm like, I took the same hits. Yeah. Maybe because it's useful, because there's people expecting me to be somewhere everywhere. There's things that we do like this. I mean, if I'm not on the ball, dude, I got these guys fucking blowing me up, and I got, every day has to be useful. I have to get up every day and be on, because I got three kids and a wife that are all depending on me to not only just provide, but also for emotional support, leadership, all these other things. And I got a company of people and, a studio audience, our virtual friends here, but also all of these touch points that require me to be on every single day. And I think the problem that I've noticed with a lot of my NFL friends is there is a feeling of not being useful anymore. And, one of my closest friends, I'm like, what do you do? You're on disability, you get this money, you did, what is your daily fight? What is your struggle? What wakes you up in the morning that this is what you're going to conquer? You need that little bit of nervous energy. Today I got to get up and do this because I got to do this. You got to feel useful. Yeah. And I think the problem is that the guys that have the most problems are the guys that are, I guess you could say, feel the most useless. Take a Junior Seau, for example, makes all of this money, this. I mean, what does he do? He goes to the gym, he works out, he kind of lives the same life without having to get the game-day satisfaction. And I think, to me, that's fucking depressing.
Sure.
And so when people ask me, oh, you don't seem to have, these guys have been around some of my NFL buddies, and they're like, these guys seem fucked up. I'm like, it's because they're not useful. you have to like a useful life.
Yeah, well, what I would sort of add to that is one of the things I've noticed about patients coming in, we've changed our question sort of intake process. Like, you know, like you go to a doctor's office and they go, why are you here today kind of thing. What I've learned over, unfortunately, a very long time, couldn't figure this out really quick, is, the nervous system, so you might say the brain, is processing something like 700 billion to 700 trillion bits of data per second. And when someone can remember 20 things, like a 20-digit number, we say that guy's a genius, right? But even at a genius level, between what they know and what's going on is an incredible gap.
Sure.
And practically what that tells us is that most of what's going on in our bodies we don't know about. So when you go to someone, how do you feel? That little bit is not even close to understanding all the other complex stuff happening. So I got to be able to help someone, and I got to be able to help them not only address what, say, hey, I'm here because my knee hurts, right, or my hormones are low, or whatever the issue might be. I got to also be able to figure out what's going on that they don't even know about. And one of the things that kind of came out of asking lots of questions and looking at things over time is that I would ask someone, you know, what's their purpose in life?
Sure.
And 100% of the time, when someone cannot answer that, then that person has a huge number of symptoms that do not respond to any therapy. And this gets back into something you mentioned earlier about pain and the emotional aspect.
Sure.
There's a great Scientific American has done probably some of the best publications about pain that I've read anywhere, because we always treat pain locally. Like you say, oh, my elbow hurts, we're gonna do surgery at the elbow, right? But for the body to process that pain, there's all kinds of wires going in and out, and you could simply boil it down to inputs and outputs.
Sure.
And there's a bucket processing everything. And what I found is that when people aren't clear about their purpose in life, or you might say a use, then they're kind of more sensitive to all the negative, bad shit that's going on in their body, because there's nothing else emotionally pulling them over here. The other thing I learned is when I ask women their purpose, a lot of women would define their purpose as to raise my children or something like that. And the problem with that is that, as a parent, you're supposed to provide like a positive environment for your child, whatever, or children, whatever it involves.
Well, theoretically, it depends on how you were raised.
But what I would say though is the purpose for individuals is not just to raise children; it's much bigger than that. And when you kind of define who you are by doing something for someone else, you lose your identity in the process.
But that's a mom. Like, my mom has always told me the greatest job she ever had in this world was raising her kids.
Well, and you can see because of love and all those things.
I still am waiting on all that stuff. No, but I joke. No, but it's one of those things where I think as parents, like, you have to, like, if you live solely for your children and you don't have any other hobbies, and then all of a sudden they leave, what do you do? Like,
you set a stage for failure, basically, at the end.
My dad's 78 years old and he still works 5-6 days a week. And I asked him, or somebody asked him, I would never ask him this, but because I know the answer, but somebody asked me, ever going to retire? And he's like, why?
Yeah.
What am I going to do? He's like, what am I going to hang at home with my mother, or with your mother, and like hang out with my wife all day? He's like, part of the reason we've been married for 50 years is I get up and I go to work every day and I come home, and like, he goes, that's part of like, being useful and having to go here, and you're in the struggle and the fight. He said every one of his friends who retired ends up dying fairly after that.
Yeah.
And he goes, I figure if I can work forever, I'll live forever. And he goes, and on top of it, it's really what I love to do. He goes, I love the struggle and the fight of being an attorney, and I practiced for 50 years, and this is what I do in my life. And he goes, I don't take as many cases as I used to, but he's like, at the end of the day, the knowledge base that my dad has created over, and my brother, who's also a lawyer, said, he's like, Dad is so knowledgeable about so many things because he's seen everything.
Yeah.
And he goes, guys have to search for cases and this, and he goes, guys are looking for, statutes and examples of different cases.
Knows it.
Well, he already knows it because he fought all
there.
those cases.
He was there.
He's like, yeah, I had this, and like my brother's like, Dad is one of the best resources because I call and ask him questions all the time, and he, and there's a reason why he has so much work is because they're like, dude, we know he's going to do a great job because he has so much experience, which is frustrating too in our society that we assume people get to the same age and we're like, no, just get out of the way, you're no longer useful. And I think that's part of the thing. How do you get to a position, especially where somebody creates a knowledge base? I mean, medicine's a classic example. You have some of these old-time doctors who know more than any researcher out there just for the practical application that they've been involved in.
Yeah. That's one of the things that with all this technology that's coming out, one of sort of like the hidden gems I've discovered is finding doctors that figured out how to diagnose someone with no testing, with no equipment at all. Like, all right, how'd you know that guy had diabetes? And when I was at University of Miami Medical School, I met a doctor there, and he was a very accomplished internal medicine specialist, dealing primarily with people with diabetes. And he took time off. He took like a sabbatical, which is unheard of at that level because you're so proficient and everybody's flying in front of the world. He took time off to go to some jungle somewhere in South America to study under some almost like a witch doctor, if you will. And that's not technically accurate, but basically studied from a guy that didn't have access to any medical resources because they
like a local healer or something.
Yeah. Well, he said he met this guy, and this guy figured out a way to look at people and see what they had. And he's like, oh, that doesn't work. And they tested, and the guy was right, like the majority of the time. And so he went there, and I don't know how much time, but like 6 months to a year. And what he was able to figure out is ridging in the nails, certain types of like purplish blood vessels in the fingertips, and some stuff with the eyes and the ears and the face. These are like visual things. That's what let's just say the healer had figured out. And so here's this guy now, and so now he comes back and he starts doing a lot of stuff. And the interesting thing is it was really popular. And one of the things that kind of resonated for me is that I don't have a philosophy like all drugs are bad or all supplements are bad or all food is good type of thing. I look at it like what's the best tool to help this person in front of me right now. But in general, most people would resonate more with nature than they would with, let's say, something artificial, just in general.
Sure.
So when you then have a way of helping people that's more naturally based, that it's just like the conversations and the energy experience is just more positive overall. And so I just found that very interesting in terms of using that information to help people and so forth. Do we want to talk about any of the muscle stuff?
Yeah. I just have one question. Have you ever had any IQ testing done?
Never.
You've never had any IQ testing done?
Nah. Here's what I'll tell you. If I want to remember it, I can remember that shit. I never have any trouble. I can see stuff. If I don't want to remember it, there's nothing you could do to get it in me.
Well, you're kind of like, you're similar to my dad in that my dad has a photographic memory. Like I remember I was in college and I called him.
You know, my wife will totally deny that I have that, right?
Well, selective. But I remember I was in college and I was tired after practice. I'd just come home and go to bed. And I used to wake up early in the morning and I would study before class. Yeah. And the way I got up, because I was a fucking dipshit college kid, is my dad would call me because my dad doesn't sleep much. He's always slept like 4 hours a night, and it'd be like 3 a.m. and my phone would ring, and my roommate would be like, "Fuck you." And I'd be like, "Hello." My dad'd be like, "I'm just calling to see how and he would literally be up, and he's like, "What are you doing?" And he'd talk to me. I'd be like, "Okay, I'm up." And I remember I was working on a deal for a class on fear, and I had taken this class with a guy named Ken Jowett, who was one of Reagan's advisors to Russia. And so I always made the point to go to his office hours, because if I ever needed it, I felt like if I was ever going to get a recommendation, Ken Jowett would be the guy. And I went to him and I was like, "Hey doc, I got this paper that I'm writing on fear. What is something that I could point to in terms of fear, with the deal?" And he was like, "McCarthyism." So we sat down and we talked about, Joe McCarthy and like McCarthyism and the Red Scare. And I basically wrote this deal. And I remember I was talking to my dad. He was so excited about it. Like, here's something like, I always think, like I asked him once, he's like, the fact that you took the initiative to search this guy out, take his class, kept in contact, and like here you are talking about something outside, and like that just, I think that was what my dad was most excited about me going to Berkeley. So my dad, as I were talking one morning, he goes, I read a book, and he gave me the name of the book, and he's like, I'm around page like 51, there was this chapter, and he kind of read it to me, and I was like, oh, that's pretty good, you got the book? I'm like, when'd you read that? He's like, 1974. And this is like 1996, so here we are like 22 years later. Like here's a story that my dad, like in that type of like recall that he has. And my nephew's the same way. My nephew could read it too, not because he could read, but because he memorized all the letters and could fool you into thinking he was reading. Like, and he's that level of smart. So I just, and most people that you meet that are smart like yourself usually lack emotional intelligence. And the only reason I asked is you have a strange emotional intelligence that I'm always amazed by, that the breath of Tom Incledon is both a deep pool of emotional intelligence. Because you think about like, being a healer, like it's pretty interesting. Like I always think that there's doctors that like want to live in the lab, like our good friend Matt Lalonde, who is organic chemist, extremely gifted, and he wants to live in the lab. And then there's people on the other side that have to have a bedside manner and then to have enough sympathy and empathy to deal with people. I mean, and I can only imagine the people and the situations you've been in where you've had to listen to these harrowing life stories. I mean, like the stuff with my family member. I mean, on the phone listening to her and like having to hear this and then seeing her pass away. Not even 4 weeks later. I mean, that's both difficult and hard, and also feel like helpless in a little way.
Well, one of the things you said some stuff made me think about a couple things. I've met a lot of really, really bright people over the years, and one observation I made in terms of, let's say, guys in the healthcare space is they got so focused on helping, let's say, their patients that they let all their own health issues, they ignored them. So you got these like brilliant guys that probably could have fixed themselves, but wind up dying prematurely, in their 40s, when they could have probably lived to their 80s, because they were so focused on helping everyone else. And I got a lot of buddies that were anti-aging experts that were great guys and they knew what they were doing, dying in their 40s and of prostate cancer, something that could have been treated.
Sure.
And it was because they were so gung ho. And I realized, like, when I was traveling around the country working with those other docs, that's kind of the path I was going to be on, right? So busy helping everyone else that now I'm not doing anything to help myself, type of thing, which would be a disservice, because now. And this leads to Mel Siff. Sure. So Mel and I were pretty good friends. We were going to write a book together. So he came out with he came out with Super Train, which is like the blackish cover book.
No, I have it right in there.
So before that, remember, it was like a blue teal cover. So between those two, so he had written a book, the Facts and Fallacies
of Fitness
and Nutrition type thing.
Yeah, no, it's a great book.
And so we were going to do like let's say a second edition or whatever. I don't know what edition it would be, but the next version of that. And it was going to come out right after that black cover came out. And so I was spending time with him and Lisa in Colorado. And Mel's a sharp guy, but what I realized is he had created this, he was working in isolation. And while he was working in isolation, he had, I was in his basement, and he had like a little gym in his basement that he had stuff built. Like he literally would get engineers to build shit for him. And really cool, like equipment that was both isotonic and isokinetic. Wow. Like stuff that would be like, wow, whoever thought that through. Well, he had one part of his basement, there were hundreds of boxes, maybe more than that. I mean, imagine rows and rows of like wooden shelves that imagine like comic book boxes, but instead of comic books, it's just papers from all the studies. So just rows and rows. So it was a huge amount of information. This is all studies Mel had done himself. So Mel, when are you going to publish that? He goes, I'll get around to it. I go, Mel, no, you and I got to create a system now. Give me one box, and I'll get my team, and they'll scan it in. And then first, we'll make sure we have electronic record of everything. Then we'll look at how we're going to get this stuff published. And he's like, okay, we'll get to it. Never happened. Mel passes away, and now all this stuff is gone forever. So none of the future generations of bright people are going to be able to do that. So they're going to have to do that work again from zero because it's just gone.
Well, I mean, we use super training. I mean, super training is kind of like a Bible in a lot of ways. Like you can't read it front to back. But if you ever have to research anything, and when we start talking about things, there's different pieces in there.
It's a good resource.
Well, it's a great resource, and there's gems in there. There's quotes that I've highlighted that have completely taken us in different directions. You know, and like I'm sad I don't get to meet him because there's so many questions I would have had.
So the thing with you know, Mel was not supportive of bodybuilding, and Mel was not supportive of training to fatigue or to failure, right?
Yep.
And when I met with him, and I started saying, you know, Mel, the only problem I would say is you're preventing yourself now from seeing other ways to enhance the stuff you already have. So I took him through some simple bodybuilding workouts. You know, he was a big time into Olympic lifting, right? Took him through some bodybuilding stuff, and I go, Mel, don't you think that would help these areas here? And he's like, yeah. And I was like, you know, one of the dangers of being a smart guy by yourself is you're seeing things maybe out of context, and there's not someone to challenge you and force you to come up with the next level. Like, if we were all independent and didn't communicate, we could probably figure out all kinds of great ways to train. But now if we all get together and work as a team, I guarantee that way to train will be far better than what we all developed individually, because we're able to look at things from different perspectives. And
where you see overlap, like we, you know, Tex and I do this all the time. Like we find different things, like the Charlie Francis, who was another one who passed away too early.
Yeah.
You know, a lot of the model that Charlie used, that I had used, is very similar to what we in philosophy. The idea of either you're running as fast as you can, or you're doing some form of tempo recovery run, and like training in that no man's land. But what's interesting is that no man's land he talks about is actually the exact percentage where we know the majority of strength training takes place. So there's this strange core, there's this like strange, like almost like dysfunction between strength training and speed. You know, the idea that, you know, Charlie's deal was either you're running faster than, you know, 92%, or you're running slower than 75, and that this like 91 to 76% is really what he calls the no man's land, where, you know, it's almost adverse to developing speed. But we know that the majority of strength training, I mean, if you look at like, you know, super training and Verkhoshansky's work, and they kind of break up the majority of reps and percentages, the majority of work is done between the 76 and that, like, you know, 92% or 91%, and with anything over, you know, 92, 95 makes up, you know, just a small fraction. And you know, to me that was super interesting, and you see this correlation between it, and you're like, wow, so wait a minute, is speed really a neurological expression of it? And that, you know, strength is more the physiological, and you kind of, you know, go in it. So I mean, we started developing it. So we went and bought all Charlie's. He, on his website, he has a bunch of his like talks and GPP stuff, and you know, and I think I randomly got this email because I was a part of his forums. That it went all on like 50% off, and so I was like, text him, and we bought everything. Yeah, nice. And like we watched all of this information. And it was great because then, you know, anytime, like we have that other really good running book, and then, you know, recently, I mean, unbelievable, you know, picked up Triphasic, which is pretty interesting because, you know, we know that, you know, I'm big on isometric contractions, developing stability. We know eccentric, concentric, compensatory acceleration, all of the things that I found within my own training that we've utilized. And, you know, that Triphasic, you know, doing heavy eccentric movements is, you know, you start seeing other people have overlapping ideas, and then you see and you think, oh, that's really cool, but what's the practical application for it? You know, if I'm prescribing a weight training, and Tex and I had this conversation the other day, you will get stronger doing heavy eccentrics, but how do you do heavy eccentrics without partners? How do you do heavy eccentrics in a safe environment? I mean, if I wanted to do, if I squat 600 pounds and I want to do a, you know, 625 pound eccentric squat, what am I going to squat it to? Am I going to squat it to pins for one rep, and then I got to like strip it all up, put it back up, and like how many reps can you get? What's the efficacy and the safety? So we always balance this idea between, you know, the 3P model, which is it prudent, is it purposeful, and is it practical? Like, can you do it? Yes, I can do it. Is it, you know, like how does it all play? Like can I do it?
Speaking
is it
of practical,
safe?
I have to go to the bathroom.
Oh, sure, no problem.
So, John, while we're doing this and kind of on the training question or subject, we got I think, easy one you can answer in one sentence, but why not go for it?
This is Dr. Johnnie, and the reason I keep placing my phone is I'm amazed.
So I know CrossFit Football has more Metcons program than Field Strong. What's up with that? What's the philosophy? What's the methodology? And I know this is kind of like but go for it.
I don't think I can.
Okay, so CrossFit Football, first off, is one of our programs. Field Strong is another one of the programs.
CrossFit Football is a strength conditioning program that I designed for the CrossFit audience. CrossFit is a metabolically demanding, glycolytic heavy training program. When we originally got brought into the CrossFit community, there was this idea that there's a randomization of different energy systems that are attacked in different ways. And actually, CrossFit Football was one of the really first programs that brought a periodized strength conditioning program to a CrossFit market, with actually a templated strength program with short metabolic conditioning type circuits. The idea was that if I can get you stronger, if I can get you in shape, and we had to have something that was almost like a gateway in a lot of ways for a lot of CrossFitters to be able to come over and start doing more strength training, because like we talked about earlier, strength is the platform on which it's all built on. The reason that Field Strong doesn't have as much conditioning, metcons.
Let's also say like on a frequent basis, because talk about like the cyclicality. We have the metabolic circuit, which is like
there's metcons every single day in Field Strong if you know how to attack it. We do a lot of supersets. We do other things. I just don't call them metcon. And for the most part, I don't really program a ton of heavy compound type movements, because the goal of Field Strong is secular. Because you got to remember, I cycle the program. It's based off of multi-year. The problem is with CrossFit Football is you have a lot of ADD, what I call cafeteria CrossFitters, who just show up and do one workout, and they pull and they try to create what we call the secret squirrel program. CrossFit, which is like showing up to a bar, getting one drink, opposed from like, you're getting on the bus, we're not stopping, get the fuck on, we're gonna have a good time. So it allows me to see a program in real time and develop things over time. Right now in the Field Strong program, we are doing a lot of speed and strength, and we are doing plyometrics, and we are sprinting. And we're doing max effort, we're doing recovery runs, tempo, we're getting a little bit of metabolic conditioning, but my goal is I don't really give a fuck if you're in shape right about now. My goal is to get you as fast and explosive and as strong as you can at this juncture within the training. I'm just more interested in speed. I want you to be so fast. I want people to be explosive and fast. And that's what the goal is. So at different times it's the training cycles, but also you got to remember the 2 previous cycles building up to this were getting us ready to sprint. So do you know how many, when CrossFit Football, I put in some max effort sprints one day. Do you know how many emails I got about people getting hurt? Anyway, seminars we've taught where people show up, I've been doing the program, and they get hurt sprinting. Because the only way you get ready to sprint is by sprinting. And also, we talked about efficacy of the program. I can't program certain things that I know are going to hurt people. And I know most people in the CrossFit community on CrossFit Football are not proficient runners and don't know how to run, and that's just because they've never been shown.
And running and sprinting are 2 different beasts in itself, right?
And the model at which the CrossFit community is using running is a terrible model. It's just not a good one. So it becomes also, CrossFit Football is something where it's like one strength movement, a little bit of short condition, you can get it done in 45 minutes to an hour. Field Strong is a actual collegiate strength, or what you would find as a professional athlete, collegiate strength conditioning athlete if you were at our university. So one is like, let's go to 24-hour fitness, lift some weights and do a little bit of conditioning. The other one is you are at Power Athlete University, and here are your strength coaches, and we're trying to get you ready for your sport. So it's like the equivalent of, I guess, of like fast food versus getting a 5-star meal. So, and I've never asked, or I've never had anybody complain about the sauce. I like the sauce a little bit better. The ketchup's a little bit better at McDonald's than it is over at Morton's. So, I mean, to me, if somebody's asking this question, they either have, and they've done both programs, either they are not paying attention or they don't understand the deep meaning of training.
Well, I think it's a deficiency in the deep meaning side of things. Just kind of, I don't know how you fucking interpret context from Instagram.
Is that there's a difference between training and exercise. training institutes a goal, and there is a real goal. Everything that I write for the Field Strong program has a singular goal, that for this cycle, this is what I want you to get out of. And that's going to compound and build and build and build. And my goal is to create the strongest, most efficient, best moving, most explosive, strong athlete that's able to sprint through a wall and drag the whole fucking bus behind him.
And well, I guess because I'll speak for the common man, because not all of us were 10-year NFL vets, played 100 career games, yada, 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 all the cool shit you've done. But there's no shame in exercise either. Like, you should be exercising, but don't pretend that there's someone who's training for a specific competitive endeavor attacks their training with a different ferocity and mindset than somebody just trying to lug along and get through it to move the dirt. Both of which are commendable, but two very different approaches to training.
I see. CrossFit football is very interesting in that, for all the reasons I love it, all the reasons I hate it, and all the reasons we still have it, CrossFit football has a strange place in my heart, in that it was really, when CrossFit approached me about putting together a strength conditioning program that was digestible for the CrossFit community, it's the one that I was able to write that was most beneficial to these guys based off of the efficiencies that I saw. So I create this program, we put it out, and strangely, I attracted some of my favorite people in the world because of it. I met Luke, I met Tex, I got Callie. I mean, everybody that works for me came through Harry, came through the CrossFit football meat grinder. And when I asked you the other day, I was like, if you had the option of power athlete or CrossFit football from day one, what would you have done?
Field Strong, without a doubt.
The program eclipses anything we can do, but yet we run into people all the time that are like, I don't really want to do something that's detailed. I mean, we program warm-ups, I got plyos, I got jumps, I got narratives, we have videos, we have everything down to the point where when people ask me questions, I'm like opposed from like you calling me on the phone or me showing up at your house. It should be pretty self-explanatory, but I think with CrossFit football, we put it out there almost like a sea monkey experiment, just to kind of put it out there and see if the deal. And the thing we realized is that putting a periodized strength program with progression, with a short amount of conditioning each day, that I know that it tested my theory that to get stronger, you have to be in shape. And the only reason is you got to be able to survive the training. The higher the GPP, the more efficient you are. But the problem is that your GPP has to be high enough to keep driving strength gains. But if you go this way in GPP, it adversely affects strength. So we had to find a marriage of the two, and it took us years to figure that out. That a better conditioned athlete will get faster than a deconditioned athlete. But at which point does conditioning become detrimental to strength and speed? Like we talked about earlier, watching those gymnastics girls train, right? What do? They literally, every movement is max effort followed by recovery. Now they do conditioning, and I watch the girls do the conditioning in their circuits. Like they do pull-ups and push-ups, and they do body weight circuits at conditioning at the end, but never at the expense of their technique work, which is always done at max velocity, which is similar to like the Charlie Francis stuff, right? They're not using the actual movement training, they're not using their actual technical implements as conditioning tools. Like they're not over there doing their ring routine for conditioning. They're over there doing pull-ups. And are there pull-ups in their routine? Yes. Are they doing tumbling? They were doing running. They're doing vaulting. They're doing different things. I mean, it's weird. It's like they have their skill work and they have their conditioning work, but they don't adversely hurt their skill work with conditioning. Mm-hmm. It's kind of like an Olympic lifter Olympic lifts. And yet for their conditioning, what do? They run, they ball slam, they do other things, but they're never touching a barbell in a snatch, clean, and jerk for conditioning because they know that that's going to degrade their movement patterns later on. That's why like Coach Bergner's favorite conditioning workout was Cindy for his lifters. Air squats, push-ups, and pull-ups. How many rounds do you get at Cindy? Those kids would Olympic lift and do something like Cindy because it didn't reinforce negative movement patterns for their sport. So.
Well, I think we nailed that one. So, Dr. Tom, I'm going to go on to one that's easy for, I think, a slam dunk. I don't know. Someone asked about blood type and diet. Can blood type really dictate the approach for weight loss or weight gain, shit like that? So.
Only in a genetically isolated population. So if you were to, let's say, find a group on an island that didn't, mix with other people, and they had certain genes, then you could probably do something for that group.
Yeah, that eating for your blood type.
Yeah, but for everyone else, because there's been too much genetic intermingling, the data, I mean, when the guy was a Diadamo, when he wrote that book, he cherry-picked the studies to support his position.
Sounds like the China study.
Yeah, so he didn't look at all the research, and in some of the studies he cited, those same groups later on said, okay, using newer methods, blood type is not sufficient by itself, right? So in general, you'd say no, but here's what I would say. When you look at some of the recommendations in the book, I've seen lots of people have come into me and say, oh, I did this diet and I got better. Well, they went from following a shitty diet to now they have an organized strategy. So of course they got results, but it was because of an organized strategy now, not because of a blood type change per se. And then when I followed up and looked at their marketing tactics, I went into GNC and some different Whole Food stores and looked at all the Eat Right for your blood type products. It was like almost exactly the same thing as far as the composition, but it would be, A, B, O, and we look at the label, it's exactly the same stuff. So it just wasn't diversified enough to even support their position. So I would say that for most people, it's not really the best way to go.
What else you got, Luke?
Why don't we just go into show and tell? Get into Dr. Tom's bag of goodies, unless you got something else.
I just wanted to talk about the probiotic stuff.
Okay. So recently there's been a number of review papers that have come out talking about how probiotics, well specifically the gut microbiome, could impact genes, and those genes impact either inflammation or they impact skeletal muscle mass indirectly.
You can talk. I'm going to use the restroom
Yeah.
real fast.
So,
You need me on this.
one of the primary organisms that's being researched right now is Lactobacillus rhamnosus GG. And so I went up and I dug up all the research on this organism. And what I was surprised is that a lot of the studies were done using 3 to 6 trillion organisms. So I then went and took a look at our own probiotic that we have, which was, I licensed a formula from another group that actually has research on what we use. And I looked at everything else in the market, and there isn't a single formula on the market that's at 1 trillion, let alone 3 to 6 trillion. And then I looked at what was available by prescription, and even under medical prescription, the highest dose I could find was 900 billion. And what I thought was interesting is the group that did the research that showed 3 trillion works, they came out to the marketplace with something that was like 100 billion. So there's a huge gap between what the research shows worked and what's currently available in the marketplace. So I looked online and what I realized is we got to come out with a probiotic that actually is at that same level. Right now I probably spend about $1,000 a month on myself just for probiotics. I take a lot of stuff that's a combination of prescription and stuff that we could just source from material suppliers. And what I'll say is the reason why that matters is the organisms turn off genes that control inflammation, that affect the breakdown of cartilage, that affects breakdown in the nervous system. And there's data showing that these organisms can control blood pressure and other risk factors for cardiovascular disease. And they can control risk factors for arthritis and cancers. So there's a lot of benefits to taking them. On the skeletal muscle mass side, one of the observations we made years ago is that when someone has a joint injury, as that joint becomes more arthritic over time, there's a loss of muscle mass around that joint. So I was always curious as what changes take place in the body that prevent the body from maximizing muscle hypertrophy or muscle size around an injured joint. And what it seems like now is some of the inflammatory substances produced by the cartilage that's damaged may be countered by certain probiotics, and that would be like the Lactobacillus rhamnosus. So I don't know, should I bring out some stuff to maybe talk about?
Yeah, so I guess while you guys are getting this set up, I'll just kind of talk to the crew. Dr. Tom, when he came for our symposium, brought a bag of just weird technology that none of us had really ever seen, and talked about how to build like a world-class clinic with under 20 G. So I think he's bringing this stuff out. He's going to teach us what the hell.
Toys don't, but he finds other uses for them.
Hey,
The prostate
that's how you know,
stimulator.
yeah, that's how you know I'm really intelligent. Finds other uses.
I always wonder, I love that, I don't think you're that smart. I just think you just have, you're just a big carrying, you're like a big onion, lots of layers.
So for everybody watching, we're not super equipped for like a handheld cameraman, but I'm going to do my best to kind of get this sorted out. So here we go.
So I mentioned earlier that one of the things we would do is we would buy up like every gadget we could find in different
You
groups.
used this on me.
Yeah.
I'm still bruising from this.
So no, that doesn't bruise you.
Yeah, you did.
Let me see.
You were jacking me in my lat with this.
Yeah, dude, that was intentional.
This actually comes with different heads.
That's not for the machine. That was for me.
Yeah, he's like, you son of a bitch. Bennett, you son of a
Well,
bitch.
I just wanted to see if I could make you cry. That's all.
Just don't breathe on me.
Yeah. So where's do we have an outlet nearby or something? Actually, we need 2 outlets.
All right, let me.
Gentlemen, may I impose upon you?
Yeah, no problem. Let me see if I can.
So I'll kind of while we think about the electrical scenario. So the story behind some of these gadgets.
How long of a cord you got?
This is one here, and that should work. And then here's another one. So
Is this going to bring down the power grid in
in
Newport?
that's right, Newport blackout. Dr. Tom Incledon, thank you.
Well, we already got an all points bulletin. I didn't know you were allowed to leave your home state.
That's
but,
right. Yeah. Well, as long as they don't recognize me, they get by. So anyway, I started learning stuff about vibrational stimulus on the nervous system. And this is a device, we picked this up off Amazon for like $120. And I got it because I wanted people, when clients come in, we have like maybe 10 different vibrational tools. And I want them to see the difference between like a $100 item and a $3,000 item. So that they could see for themselves, okay, hey, this really does work better than this other one. Because there's real world price comparisons. Like literally, you could buy 30 of these for one of these, right?
Sure.
So in my mind, this guy's got to be like 30 times better, or at least it's got to provide the solution you need right now to justify the difference in the expense. But as I started playing around with this, some of the things that came out, so dealing with pain. When someone's in pain, let's just say they have, let's say it's from the hip down. So a hip issue, a knee issue, an ankle, a foot, toe issue. We know there's more neurons in the face, or I should say more neurons going from the face to the brain, than let's say from the hip to the brain, from the knee to the brain, or let's say the foot and ankle. So if someone's in pain, you could literally take a tissue and you could utilize principles that everybody learns this in maybe basic anatomy classes. They call it a sensory homunculus. And so if you look at it, you could Google like the images for sensory homunculus, and what you would see is how does the brain perceive the size of different parts of the body? And you would see that the brain gives a lot more attention to the face. Wow. So the areas of your body that have more neurons, it's going to represent as a larger area, if you will, in the brain. And the significance of that is, let's say I have someone in pain, I need to get them to move, but I don't want them in pain because that interferes with their movement pattern. So what I would do is I could have them take a tissue and they could stimulate just lightly, the tissue gets their forehead, the sides of their face, underneath, and the neural stimulation in their face sends signals to the brain that relatively reduces the signals of the pain from their lower body. Wow. And so now, so it would work great someone that has some post-surgical pain. So they need movement, but at the same time, if they're cringing and twisting, it's not the quality of movement that we would want. So I could have them stimulate their face with a tissue, and now they could wiggle their toes and start moving their ankle or move their hip or something. A second thing to that would be then we can use things like, and it doesn't really matter where the pain would be in the body, but you could take advantage of just compression. So you could take, we use a knee wrap a lot, and the reason why we use the knee wraps is because we could kind of make them as loose or as tight as we want, and there's enough length that I could pretty much do what I want with it. I don't run out of space, if you will.
Sure.
So I would put compression on someone's, let's say, left hip, and I would figure out how to apply the stimulus to get, let's say, range of motion to shoulder to elbow. And they're very effective. It just takes a lot of trial and error and practice to figure out the right combination of cocktail. And then once I have, let's say, those things figured out, so let's say in your case, your knee's maybe not bugging you a whole lot right now, but let's say it was and you couldn't, just for the sake of argument, you couldn't move it, then what I would do is I would say, okay, first, let's look at getting rid of some of the perception of pain with a tissue. You get a box of Kleenex and just start doing that. And you say, okay, now my knee's not hurting as much, I can move it. Then I'd say, all right, that's where I'd load. Now we need to have you be more functional. We need a load on this, but I don't want to damage it further. So now I would look at doing something with a compression. I would try the same side hip as the knee that's bothering you, and I would try the opposite side, and then you would tell me which one of the two sides I wrapped helped you more. Mm-hmm. And in terms of the strategy for wrapping, if you were standing and I was looking at you, and if it looks like your legs are externally rotated, I would start my wrap from the outside and rotate in. Sure. Because I'm going to try to use a wrap to kind of get you internally rotated. Sure. If you were internally rotated, I would do the opposite, right? Sure. So now I got this as a constant compression, and on either side it helps reduce your perception of pain. Then I would have you do some movement, and it might be just body weight squats, or it might be a single leg squat or something like that. And I would have you stay where it's pain-free. So it might be very shallow range of motion. And then when you get to a point that there's pain, I'd have you stop a little bit above that and do an isometric hold. Oh. And then what you would find then is you would just, let's say, do like a very shallow quarter squat. And now you hold for 30 seconds, come back up, and you do a few more, hold again for 30 seconds. And what you'd find is now they're able to squat deeper and deeper and deeper, and the goal is pain-free. So if you have pain, you don't go to that point and push through it. Sure. Instead, we figure out how to get you out of pain. And then as you're moving, now what happens is once you have more activity in that joint, it's probably going to ache because you haven't used it for a while, now you're using it. Well, that's when I would bring in some of the vibrational stimuli. And what I find with we don't use this for massage. We use this as just a vibrational stimulus. So it's basically on the surface of the skin. So what I would do, I just put it right up to the highest setting. Mm-hmm. But let's say if I would put this like on your calf or something like that on the outside. So I would start with, say, the same leg that your knee pain is on, and I'm kind of stimulating very, very lightly. I'm not putting a lot of pressure. And I would say, okay, how does that feel to you? And you might say, I feel no change. And I would say, okay, let's go to the opposite leg. Let's try stimulating that. You might say, wow, my knee pain, I don't feel it as much. So now basically what I've allowed is for you to move pain-free. So that's how I would use this tool. Now this guy here, this was designed, the company that designed this did it originally for lymphatic drainage and maybe for like breaking down myofascial adhesions, things like that. I can't say one way or another that it guarantees that it does all that. I do know that this is one of our most popular tools, especially in the bigger guys with a lot of muscle. I get a lot of bigger guys, and maybe I've got an old back injury, and nothing seems to really get deep enough. And we use this very lightly. And so we turn this on, and you just kind of run it. I'm not pushing down on it hard.
What are you talking about? When you did me, you were wrenching it.
Dude, well, I was trying to dig in deep because I was trying to get to your subscapularis, which is it's deep in there. If your anatomy wasn't that way, if you let's put your subscapularis on the outside, then I would go very lightly. You know what I mean? So normally though, I would have it very, very light because I'm trying to see the vibrational aspects first, and I would have to do the same thing. And a lot of guys, particularly with back issues, what they like is I could do that on their glute, I could do that on different parts of their body, and they feel like it gets in deep. And my interpretation of that right now is, pain, you have signals from the area that's actually damaged. Those are nociceptors going to the brain. But you have all these other signals, the emotional context, the environment, the thalamus, the cerebellum, the cortex, there's other areas of the body that sort of modulate and control how much pain signal gets through. And where this type of tool comes in, this is like affecting the pain modulating sides of the
So almost what this is doing is it's like disrupting like the pain impulses.
Yeah, exactly. Yeah, it's kind of like saying, it's kind of like disrupting the pain from getting to the brain.
Sure.
And then what happens then, and the reason why you want that is you want to basically then teach your nervous system, here's what it feels like to not have pain. And now here's how you move. And one of the easiest things to do is to watch their gait, because people can't hide things when they're walking. Sure. And this is where we do stuff we call like a dual tasking. It's like I did with you, where you're walking and you're supposed to be just walking. I'm asking you questions,
Sure.
count backwards, do all kinds of mathematics. Or if it was an accountant guy with good math skills, like a financial guy, then I might ask him questions that involve letters instead of numbers. But I basically challenge their brain in a way to see how does that disrupt what they're doing. The significance of this stuff is that, for $100 you could buy a tool, and I almost never see any athlete anticipate what I'm going to do if I have pain, right? They get into the situation, they have pain, and usually what I see is they tough through it, because that's what I was taught when I was an athlete, tough through it. And so what I would tell people is toughing through it. If you're competing, you got to man up and do what you're hired to do, or what you're there to compete for. But if you're in a situation where now you could be preventative and plan ahead, your goal is never to have pain ever.
Sure.
Because the longer you have pain, the better you get at being sensitive to pain.
Really?
Yeah. So you don't want, it's shown study after study. So let's just say for a simple
See, I'm
example,
like the exact opposite. Like, I get to the point where like the pain is just kind of subsides.
So I don't think that's the case. I think what may be happening is that it's affecting you in other ways.
Yeah.
But your benchmark is, does my knee hurt? So maybe your knee doesn't hurt as much as it did before, but the other ways it's being expressed in your body are just not in ways you're observing or measuring.
Well, I'm just waiting if like there's like a chamber you can just put me in and regenerate me back to like
Dude, like
4 years old.
Super Soldier.
God,
Like
come up with
Terminator
that.
meets Super Soldier.
Oh, like could you just put me like I always think like Captain America, like can't you put me in like some like chamber, and all of a sudden I came out and you're like, John, everything's healed. I'll be like, well, let's go back and break it some more.
So first, when you see it happen to me, and you
See, you selfish son of a bitch. It's always about you.
But hey, how can I tell you it works if I don't even know? There's got to be that point where you figure it out, and you go, I got this idea.
I kind of hope at some point, like Tom calls me and he's like, I got us 2 plane tickets. Don't ask any questions. And like I'll hang up the phone and I'll do this. I'll be like, yes. And all of a sudden I'm like, I'm like, people like Kate's gonna be like, where are you going? I'm like, I don't know. Inky just says I gotta be ready in 10 minutes. And the funny part is, Kate would be like, have fun. Let me know how it goes. Make sure you call or at least text me that the kid, and say goodnight to the kids.
Yeah. I'd be like, you text me, pack your bags. Where are we going? Undisclosed.
Yeah, exactly. I'll be like,
do I pack for cold or pack for hot? What do I pack for? Undisclosed.
Yeah, Kate would be like, I by far am married to the most wonderful person in the world, and she deals with me. But she'd be like, sounds good. Have a good time.
Anyway, so the main point I wanted to bring up about these tools is that I'm amazed at how many athletes are in pain, and not a single coach has showed them very simple, inexpensive ways to get out of pain. A tissue, for example.
Well, painkillers, I can take a pill.
Yeah, so the problem with the painkiller, though, is that over time, your body upregulates and adapts to it, and that's why painkillers don't work forever. And people tend to take higher dosages and issues.
Something I always thought about too, and I've asked a couple different doctors this, and you and I probably discussed it, is do you think that the use of painkillers could be linked to some of the neurological problems you're seeing for these NFL players?
Yeah, there's actually, so absolutely yes. There's actually, just Google ototoxic drugs. So OTO, then TOXIC. It's already established that certain drugs affect the vestibular cochlear function. So basically like the inner ear, if you will. And it doesn't necessarily impact hearing, but what that impacts is balance. and keep in mind the priority for the nervous system, it's vision. It's kind of like inner ear stuff, and then proprioception. But what does everybody focus on? Proprioception, how do I feel?
Yeah.
The two things that are more important, they don't give any credence or attention to. So the drugs could affect sort of that inner ear stuff, and then that affects your nervous system interpretation of signals coming in. So like everything from someone making fun of you and you being offended versus laughing, right?
Yeah.
Or your ability, like when you feel pain, how do you respond? And one of the things what you want to try to avoid is things like a startle reflex, or things where the pain is so much that it sends a signal to your nervous system that alters your function. And unfortunately for me, the way I was trained, my coaches, well, this is back in the day where books like Red Gold and all this stuff was coming out.
Sure.
It's like pain is your friend, keep pushing through it and
Of course.
everything. So we would train
Pain is
so hard.
weakness leaving the body.
Yeah. I had a coach from Japan. The guys,
Did you guys know that Tom was training in Olympic lifting for the Olympics?
dude, lifetimes ago.
Yeah, but he was. We actually have some vintage Incledon
Oh,
plates
please.
over here.
Oh, that's right. Yeah.
Yeah, do you want to so Tom is just a side note. Tom is a hoarder of athletic equipment. His garage doesn't park any cars. It's just merely a bunch of
right.
stuff he's been hoarding. And I somehow pried his original Olympic weightlifting set out of his cold dying hands.
Yeah. Those are the Alicos? and
Yeah,
stuff?
well, yeah, and the Alicos. And actually, somebody dropped one and it cracked in half.
Dude,
so I duct taped it.
Those plates could be older than me and you.
Well-
I mean, they're older plates. Like I got them from someone else.
It's the ones on the bart. No,
not that one. That's newer than what I had.
No, the very, very dark ones at the very bottom right there, the one with the duct tape around it. Those are the inky plates.
Yeah.
Hold on, bust this thing out. Yep, there they are. That's so somebody dropped it and I had to duct tape it back together.
No, just I trust you.
So Tom bequeathed his plates.
Look at how many cracks are in that plate. It's
Dude, we love these plates.
well, so I'm trying to remember. So I don't even remember who I got them from because I had them. God, at least I must have had them at least 10 years, right? Maybe longer. It could have been 15 years. I don't even know. Before I gave them to you, and they were given to me. Actually, I think they were given me by an older coach. So those plates could be.
You told me that you used those plates when you were training for Olympic lifting.
Yeah, so I would have had them in the 80s, right? And so,
Yeah.
and when did I give them to you?
About 4 years ago. so
I have no sense of time, as you were saying.
no.
I'll try not to be that old. I'm trying to be younger. I'm a younger man.
I'll tell you how long ago it was. Bo Colombo and I drove to Arizona because we got your stones and we got those plates. And you were like, it was funny because you almost had like an anxiety attack on me.
Dude, separation anxiety.
No, I mean,
I grew up with those plates.
I know. I was like, and you were like, I was like, Tom, don't worry. I'm gonna take them. They'll be fine. You can visit them anytime. We'll send you pictures. And you were like, just take them.
Yeah.
I don't want to see them anymore.
Dude, that's like giving away the dog I raised. You know what I'm saying? I got emotions here.
Dude, and then I had them in there, and I told people, I was like, you can only squat with them, you can't drop them because they're so old.
Yeah.
And then Ben fucking does a snatch, and he fucking lets it rain, and the thing cracks in half. And then he's like, hey, I broke the plate, sorry about that. And I was like, this motherfucker. I literally took the plates, I wrapped them up, and that's when we opened this place. And I was like, no longer will you guys be able to break my plates.
Well, John, you've talked about, just a lot of the equipment that we have here, right? It's like older stuff and like kind of vintage, and you got to think about the character that it holds and just the history it has. If you're a sentimental guy like that, or just have an appreciation for like the process, it's cool shit when you think about it.
Well, and I've told this story like 4 or 5 times, but actually the safety squat bar that we have over there, we have 2. The one that we have, I found at a local gym, and I actually joined the gym because they had the bar, and I was like, oh my god, this is this is the original safety squat bar.
right.
And so when I went in there, and all of a sudden they sold the gym, and we went back in there and like, oh, we're selling the gym, we're going to open a new gym. So I found the owners, and I was like, hey, what are you doing with the equipment? And they're like, oh, this guy came in and bought everything. And I was like, there was this safety squat bar, like, what are you doing with it? And I said to the guy, I'm like, I'll buy it from you, I want that. And the guy, we went in, and he's like, oh, I got that bar, it's out in the trash. And I went out there, and I dug it out of the trash and put it in my truck and came back in. The guy's like, what do you want that old thing? You can go get a new one. And I was like, I like old stuff. Little did he know that you can't buy those bars anymore, and that's the original one. Yeah. And I was so excited to have that. But all the stuff we have has got all some form of sentimental value. Dude, Sornex just kicked us all those center mass belts, which we're super stoked on, or all the heavy dumbbells. Everything that we have has some form of value to us, our Versa climbers that came from our major league buddy. But it's almost like there's history within those things,
Sure.
that PR and that bar. So I know that's why we're stoked to have those, and that's why we keep them there. But yeah, no dropping them. That fucker was it broke like a potato chip.
Yeah, I had
this thing is great.
Yeah, it's a good tool, but
It's the weight of it. I think it's because it's so heavy. The head is so heavy that it's just you don't have to press it hard. It just kind of sits.
Yeah, well, so think about this. Let's say if you were like a physical therapist or manual therapist of some kind, doesn't matter, athletic trainer, massage therapist, if you got to work on 10, 20 bodies a day,
Sure.
if you're putting all the pressure yourself, that's going to take its toll on you. What I like about this tool, I can let it relax.
Yeah.
You know,
It's just heavy.
and the weight on its own gets into people.
Yeah. No, it's nice.
So anyway, and I got a bunch of other sort of like stuff in the same area, if you will.
Cool.
One of the things I started doing with this is for a lot of I see a lot of guys where their IT bands get so tight that their patella starts to move lateral.
Sure.
And I don't think foam rolling is going to fix that.
No,
And
I'm one
yeah.
that the only thing that ever did it for me was myofascial release.
Yeah. Well, I see a lot of in baseball right now. What's common for a lot of the baseball players is orthopedic surgeons are doing a lateral release.
Oh,
So they're going in surgically, and I don't think that's a good strategy long term, because when I look at the data on surgical procedures followed up 20 years from now, a lot of times it's better not to get any surgery. But yeah, initially surgery seems to be better, but 20 years later, surgery seems to have been the wrong decision to make. And what's funny is a long time ago, Mel Siff was the first guy to tell me. People were posting, tore the meniscus and doctor wants to clean it out, and Mel would be like, no surgery. He goes, what did people do for thousands of years when they tore their meniscus? There were no surgeons then. They couldn't do surgery.
unless it flaps over and gets stuck in the joint
Well,
to where.
yeah, there's always those situations, but Mel was a big proponent of figuring out what to do right now to help it heal without the surgery, because it'll kind of grow back in place and things like that.
Doing like Prolo injections. I mean, if I could go back in time, instead of going in and having the surgeries, they very easily could have gone in there and just injected it and done some Prolo, or even done PRP or stem cell or something else. I mean, yeah, it's just I think people do the best they can at the time at which they can.
Oh, for
and it
sure.
seems
Yeah.
like here we are all these years later thinking, fuck, like what if
Yeah.
I hadn't had this?
Yeah, I mean, it's not something you can go back and change for yourself.
Sure.
But it's something that now, given the experience and history you have, you could advise the next generation, hey, consider this option.
I'm still kind of bummed about all Mel Siff's research.
Dude, he had a lot of stuff.
Did his wife just throw it all away?
Shortly after that, I lost touch with Lisa, and not really sure what happened. I don't have any knowledge of that.
Wow, I should have bequeathed that to you.
Well, we were working on writing that book, and I was like, Mel, man, there's just a lot of really cool stuff that I think we can incorporate. Like, we could literally we could generate graphs and charts from a data he had that was never published before,
Yeah.
But it was just, it wasn't the right time, I guess. Now, one of the other things I want to talk about is in terms of things to do to reduce the post-inflammatory response to exercise, because that could then delay your adaptive response, right?
Oh, okay.
So right now there's a lot of data looking at different wavelengths of light administered to the muscles and the joints before training, because it reduces some of the post-training damage. So the idea would be you could recover faster. And we have like 7 different laser systems or light therapy systems. They all have, I've seen them work real well in different situations. I've seen them not do anything at all. I wouldn't expect most people to go out and spend the kind of money I spent on that stuff. But one of the things I found is I'm working right now. I got a $7,000 system that I think I'd be able to duplicate and maybe sell somewhere under $500. So now it's starting to get things in a price point that more and more athletes or coaches can afford, because it's not a big dent in your cash flow of your business and stuff. So I'm working on that now, but the limitation is it's going to be a small area, but it's portable. So now you can take it with you.
Wow.
But the idea is you don't want to prevent all inflammation, because you need some inflammation to respond,
Sure.
to the
Brings
stimulus.
healing. Yep.
Yeah, and some of the data from antioxidants, I don't know if you've looked at any of that. So it was thought if I take all these antioxidants before training, I'll reduce the oxidative stress of training and respond faster. But what happened is it reduced the chemical insult to the cell, so the genes that respond to inflammation aren't getting activated.
So inflammation is kind of a key component for like protein synthesis.
Well, it's inflammation is a component in terms of responding to the training, you know, because then what that does, it turns on the genes that produce the antioxidant enzymes and things like that. So essentially, imagine, if you will, as your training volume goes up, it's more and more stress. And I don't mean physical, I mean like biochemical stress, right? Well, you need a way to deal with the biochemicals. So like you today deals with it here. But what happens when that goes up? You of the future need to be able to deal with biochemical stress at that level. Well, that's the genes responding to the stimulus that's opposed to them biochemically. That's important because that sets the stage for healing at the mechanical and physical level much later on. And so, so antioxidants maybe taken right before training may not be the best tool, or maybe you may have to take a whole bunch of a lot of different things. But the light therapy appears to be a good tool for that.
Cool.
Now, I got a bunch of other stuff here, but one of the things I want to talk about, the muscle mass thing.
Okay.
So what I see is all these guys come in and they're basically banged up, or they're overtrained, or both. You know, I say overtrained because maybe they're not aware of any pain in their joints, and they don't appear to have any physical dysfunction in their movement, but they're not getting stronger and faster, right? And it's not just like a CrossFit athlete. I mean, baseball, football, all kinds of athletes.
Sure.
Part of it is they lack an objective benchmark to know, you know, how am I assessing myself day to day, or week to week, to know if I'm going in the right direction. So without having that benchmark, you know, they're doing stuff without knowing if they're improving or not. And they might say they're improving because they set a record for the workout. The problem with that is that's maybe too specific. So like even when you're overtrained, you could still set a PR and a new
Sure.
movement, right?
Sure.
But that doesn't qualitatively reflect your overall state of fitness and conditioning. So there's got to be that one marker. And so classically, guys might use like a vertical jump, right? Or they might use some other, maybe some sort of like how many explosive push-ups when they're coming off the ground they can do within a defined period of time, or they might do a sprint. But the idea is something that's fairly explosive. You could maybe even apply a metric, you know, how many times you go to a certain height or whatever. But the danger is there's a high skill component to some of these high explosive movements. So that skill can be affected by other things as well. So my experience would be find a simpler skill movement that you could use throughout the training, so you can evaluate what's going on. In terms of though helping guys to improve their fitness, but not emphasize their overtrained state, we've been utilizing recently a lot more what I would say, I would almost call like a functional isometric, for lack of a better description. But one of the things we'd work on is having a guy find a body or joint angle position that maximizes the intensity of the contraction. And this gets back to almost where we started with body awareness.
Sure.
One of the things I noticed is years ago, there were like old time strongmen, like you got some pictures in your bathroom and stuff. Some of those guys were not as big as some of the athletes today, but they were far stronger for their body weight and their body mass.
Sure.
And one of the reasons is they understood how to move muscles around their body with exquisite detail. Like there's a really, and we'd say neurologically, they had excellent brain mapping. So to be able to move your muscles and have these muscles contract and have your chest jump and things like that, that means that their brain is connected in a way that they have voluntary control over this stuff. So imagine, if you will, like we just take like latissimus dorsi, so your lats. Most guys go to a gym and they're going to do a pull down or pull up or some variation of the two. But now when you study the angle of pull, the attachment, you look at the way the muscle fibers run, there's rotary components, there's rotational components to maximizing the contraction of that muscle. Well, you'll never be able to duplicate that with a pull up or a pull down, right? But if you would go single limb and figure out, okay, how do I rotate, side lateral flex, and then twist some more to maximize that contraction, you now start thinking, all right, how do I load that parameter?
Mm-hmm.
And what happens is you have much greater stimulation of muscle fibers than you did ever before, because before you're limited to the fibers that are recruited from that simple, both hands are positioned and we have at the same time. Well, as we work with people to figure that out, we then figure out two different extremes, so maybe three. One would be the muscle fully lengthened with a load, and then they're holding that for time. So like almost like a plank. So you might say like a latissimus dorsi, you would basically pull up some anatomy charts, look at how the fibers run, and work with your own body to figure out how do I position myself to be fully lengthened, let's say.
Sure.
Hold this for time, let's say 30 seconds, and now I'm gonna do, let's say, do like a single cable here. I do like say 10 reps or 30 seconds of reps. Now hold for 30 seconds. And that would be contrasted with a maximal contraction of the latissimus dorsi. With the same thing, 30-second hold, then 10 reps, 30-second hold. The significance of that is you can now train your whole body 7 times a week. So you can provide a stimulus in a way that doesn't wear down your cartilage, and you could dramatically enhance capillary formation, you could dramatically enhance muscle protein synthesis, and assuming you're picking your movement patterns correctly, and you're loading correctly, you won't have excessive muscle soreness over time. So we've literally taken, I've taken all the guys in my company, and we trained the same muscles 3 times a day, every day for 7 days. And everybody's bench went up. And so, and keep in mind, we weren't doing any benches, by the way.
Wow.
Yeah, so we were focusing primarily, you'd almost say like isolated, like single joint isolated movements. Mostly because I was trying not to have crossover where I might be training muscles more than I wanted to. The other thing is the patterns that we trained is, a common thing for people with head injury and with weightlifters is the changes in the brain over time. It basically results in upper body internal rotation and lower body external rotation. And you could just look at someone standing at rest, and they're internally rotated here,
Sure.
and then the feet turn out.
Yeah, you can
right?
see the top of the hands is out-footed.
So, in order to counter some of those adaptive changes in the brain, there's certain drills you have to do with the eyes and basically the head movement. But then the compensation would be on a training side is think of the posterior surface muscles only. So basically, all your back, your rear delts, your triceps, your glutes, your hamstrings, your calves. And you would bias the training. So let's say something like, 3 or 4 to 1 or 2. So we're just training, imagine if we just divided you, it's like frontal plane, cut you in half, front and back. So we train all the back side of you 3 to 4 times for every time we train the front side of you.
Yeah, that's kind of our rep range. We like to try to do 3 times. What is it, like a 3 to 1 pull the ratio of the.
Yeah. So the basis of what I was saying is because of neurological change in the brain, which would indirectly affect performance, right? Sure. You guys figured out the same thing, but you're looking at more from the performance aspect.
Well, also we found with being able to put on muscle mass, the more. I mean, it's almost like if I train this more, then this grows faster than if I just train this, because this doesn't grow.
Yeah.
It's almost like this works this, but this doesn't go back,
Mm-hmm. Yeah. So one of the things I plan on doing when I get back, besides all the crazy stem cell shit I was texting you about, is really focus on.
You mean when you get back from Italy?
No, when I get back from here.
Oh. Because are you going to Italy to?
So the game plan was first I got to meet with Purita in Florida. He's teaching me the protocols they have, right? For basically, his protocol is to naturally increase your own stem cells.
Is he using the lights?
Basically, from what I understand right now, I don't know the whole system yet, but because remember, he's just telling me this by phone, I haven't seen it.
Sure.
So you inject like a high dose vitamin A injection that gets what they call very small embryonic like stem cell counts up really high. So now you got all these small stem cells around your body. What I like about this is that there's no invasive stuff really. It's a vitamin A shot, right? So now all the stuff's turned on. And at a certain period of time later, I don't know, I think it's like a day later.
Is he still staking people?
I don't know if he's doing that as much anymore because I think this other stuff works better.
Wow.
Yeah, I mean, when I see him and we go over those details, I'll find out.
Tell him I want to stake him.
Okay, this guy he's a nice older guy.
I'm gonna fucking stake
you're
him.
gonna beat up a guy that's like as old as your father.
I thought he was fucking Van Helsing. I seriously, I felt like he was. So long story short, Tom sends me to go see this doctor, and he goes, yeah, he's gonna basically take out some bone marrow, spin it down, inject it back into your knee. So I'm going through the console, and the guy's like, yeah, I'm gonna aspirate your hip, and he kind of like brushes over it. I'm like, all right. So I jump up on the table, he injects me, and all of a sudden he like, I feel this kind of like poking, and I feel like this like movement. I look back, and the guy's got like a stake on my butt, like top of my butt where my hip is, and he's standing up on a stool, and he's got a hammer.
Yeah.
And I'm like, whoa, whoa, whoa! And he goes, and to aspirate the hip, they have to be able to crack the hip bone.
They have to get to the periosteum.
Yeah. So he's literally staking me like Van Helsing. And I was like, this motherfucker, like, this bro, so let's aspirate the hip. And I'm like, oh. And so, like, the dude stakes me.
Yeah. So I had the same thing done before you.
I know you did. And I called him. I was like, motherfucker, I hit you with a hammer. And Tom's like, that's not a big deal. I'm like, fuck you, it's a big deal.
All right, so when I had this done, you got to keep in mind that no one told me anything, right? So I go in, and he's like, yeah, we're going to do this bone marrow aspirate. It's like, all right. So it turns out there's this very attractive young lady in the waiting room. And so I'm basically now face down. He's got my shorts down. He's got like, the sterile drape and all that stuff. And I hear this woman's voice behind me, and I had all male doctors and professionals in the room at the time I was getting done. So I hear this voice, I look over, it's like, wow, she's pretty hot. So Purita is like, boom, and it's not going through.
Yeah.
Now he's stepping up on his little step stool.
Yeah.
Boom again, it's not going through. Boom again. And he's trying to be nonchalant, but look, he's like sweating like crazy. And I was like, maybe I should have told you. I said, but my bone density is really high. I've been tested several times, and it comes back with error readings that they haven't seen density that way before. But,
not since the Neanderthal period.
That's right. So Cro-Magnon.
Yeah, I was going to say the Neanderthals.
so winds up. Joe's like, oh, we're great. Now you tell me. So he's pounding on it. And so he's kind of like, so what are you doing? I said, well, after you get that staking me, I'm taking that hot chick out behind me out dancing. And so everybody's like, what the hell? So literally that's what might have happened.
Yeah, he took her out dancing on me now.
So I'm just going to say my experience was very different than your experience.
Well, here's the thing. You didn't, you didn't tell me anything. You're like, oh yeah, you're just going to go in there.
Because dude, it was so much happening so fast. And first of all, the steak didn't hurt me at all. I didn't feel anything. What hurt me the most was him digging around with the trocanter.
Yeah.
Let me backtrack. That didn't hurt at the time. It was afterwards. I was like, man, I felt like someone explored my whole body without my knowledge. And then he got all these fat cells, and after he spun them down and put them in my joints, dude, I was dancing that night. I had a great time. About a day and a half later, though, the locals wore off. So now I was walking, and it felt like someone lit a fire in my joint. I've never felt anything, to this day, I've never had anything that and so I said to Joe, I was like, Joe, man, is it normal for people to feel like they're on fire? And he was like, no, you shouldn't feel that bad. He's like, so take some painkillers. I'm like, Joe, that's not my thing. I can't. Yeah. I don't like the way that makes me feel mentally. So I'd rather just suffer with the pain. But so after that, I didn't remember anything about the staking. I was thinking about the pain in my joints from the fat.
Yeah, fuck
so
you.
When
I'll
you went,
get even with you.
So when you went, I was thinking more about the pain afterwards, not the pain.
You know what? The pain when you put some polyglycan in the joint. Yeah. That was probably one of the other than when Dr. Dewin ripped my soul out with that PRP you sent me to. But that was pretty painful. But that was pushing it through that.
So we sense what we've done now. By the way, we pre-filter it.
Yeah.
So we filter everything, and so think of it. It kind of goes to like another step.
Sure.
Pre-filter it. So you got a sterile syringe with this pre-filtered material, and now when it gets injected into you, dude, it's like like literally now the same thing, because I felt that same, like they were injecting my hip, but I felt it in my knee. I was like, we got to figure this out, because I can see an athlete putting up with this. I cannot see an elderly woman, putting up with this. So, and I got to figure out, I got a lot of different types of clients. I got to make sure, we're not killing them. We got to help them. So one of the things I tell you when I was hanging upside down in inversion, did I tell you what I taught Aldrin? Mm-hmm. So I came up with this thing.
With the you sleep upside down like a vampire?
No, so, so we got an inversion. We have an inversion table on the gym side that we use for a lot of different like back stuff, and also for test people with blood pressure, dysfunctional issues. So I had my guys bring the inversion table to the other side, and I heard from another doctor they were using traction to regenerate cartilage in the knee and the hip. But the way they were doing it is they just had people like in a crutch. And so I talked to all of them. I said, "What do you think about? Let's have us try. I'm going to hang upside down, and give me like 5 or 10 minutes so I can really see if we can get some lengthening in the joint. And then I want you to see what it's like when you go in." And he was still using the filter at the time, so we've been a high pressure thing. So hang upside down and keep in mind I worked up to it. I didn't just go 10 minutes instantly.
Sure.
Every day I was getting progressively longer hang upside down. So after about 3 or 4 days, I could go 5 or 10 minutes, no issues, no blood pressure, no blood flow like running to my head or anything. So now he does the injection, and it was a little awkward for him to try because remember now everything's upside down, so he's got to
Sure.
palpate and allow for it, in his mind where everything's different. But he was able to inject, and I felt nothing at all.
Oh, wow.
And what I realized is that because of all the erosion of cartilage, the joint space gets more and more narrow.
Sure.
So when he gets in there with a needle, it's more likely that needle is going to hit the surface of the cartilage or the bone, the subchondral bone, which is highly inflamed. So having a traction gapped it enough. So literally you could go with your eyes closed and go straight in and not hit anything.
Nice.
So I did that with myself, did that with a few other guys, and then we started looking at, maybe getting rid of that filter somehow by pre-filtering the solution and going in. Sure. and it worked out really well.
Nice.
Yeah. So, Luke, do we have any questions we want to answer? Do we want to try to wrap things up? What are you guys thinking?
Well, no, question queue is all full or emptied out, so we're good on that. But when we got to the test in HGH for Special Forces, we were kind of in the middle of talking about, Dr. Tom, the good, better, best services and the blood testing matrix that you're trying to push out, because I know that's one thing when we talk to our guys on the site, it's like, I got to get you in touch with Dr. Tom. But then it's like I said, the barrier is high. There's a lot of complexity, and we're trying to make the service that you got, John and I, make it a little more accessible to kind of the everyday guy, and then also palatable price point wise. But understanding that, like, hey, there's no such thing as like, yeah. So,
the thing about healthcare right now is there is no upper limit, right? I don't care if a guy's a billionaire, we could still bankrupt him. Like, there's no upper limit because there's more tests available, but the plus side of that is that not everybody needs every test, right? So where the economy of scale comes down is I've been looking at just common things that maybe 80% of the population would benefit from. It's not going to necessarily solve everyone's health concerns or fitness concerns, but the vast majority would help. And I came up with like 3 packages, if you will. A basic one, just vitamin mineral testing of all the different markers and stuff. And then another one a little more advanced includes some hormones, and another one is kind of like, this is for guys that really want to figure out all the details. So maybe a pro athlete or an executive or just someone that really wants to be at their best. So then they could just kind of pick what they think would help them the most. I'm setting all that stuff up now, so literally they could just go on, click a link and get it. Down the road, as we get some of this stuff built out, I intend to have things scalable so that literally someone can go online, say I want this test done, and it would tell them, all right, here's a lab closest to you to go, and here's the conditions to standardize it. And then the idea is that they would get there's no human support. They just do it on their own. And the thing is it's when the labor and the human beings get involved where
Things get expensive.
But when you can automate the other stuff. So what that would mean then is I have like a video, here's how to do it right on your own. Then people would just click on it, order it, and go to a local lab, most likely a Quest type lab or LabCorp type lab.
Sure.
And as long as they go at the right time and do the right things, the data should be fairly accurate and reliable, but also be the cheapest way to do it. Mistake a lot of guys do is they try to do everything through insurance, and at some point it just shuts off on them. What I would normally tell people is find out everything you can on your own without anyone knowing, right? No insurance company, whatever. Then once you know your facts, then decide, okay, I need this, I'm okay with insurance knowing this, because once it gets out there, what people don't realize is all the way these different databases are connected. So I have people come in and they come in maybe 1 year and they have a health concern. So now we're running all these tests. Now, a few years later, they're applying for a renewal on their life insurance. And somewhere in this database that's out there, that insurance company has access to this other insurance company's records, and they don't know the details that maybe I would know, but they know they got tested for something in this category. So it's not a HIPAA violation. And so now, as a result, guy's premium goes up. And when you factor this stuff out, it probably would have been cheaper if he paid for stuff on his own and never told anyone. So this is the ripple effect people don't anticipate. So it's what people should do is figure out their own budget, what they're willing to invest in themselves, and then after that, if they hit us up, we can figure out a way to help them maximize the budget. Cool. And I'll as I get some stuff dialed in, what I'll do is I'll send you guys links, and then people can just go to the page and have everything explained out.
Cool. Awesome.
So yeah, John, I mean, we just got finished with the intro, so do you want to start Talk to Me Johnny live now? I mean, we're only 3.5 hours into it.
I gotta think, I'm looking at my clock, it's almost noon. We've been in the gun, 4 hours maybe?
Well, all I know is I'm glad I ate 2.5 racks of ribs last night, because I haven't eaten since, and I know you guys got to be fucking starving.
I drank a lot of coffee, so
I'm starving right now.
Honestly, thank you guys very much for being a part of Talk to Me Johnny Live. Episode 2 with Dr. Tom Incledon. Tom, where can people get a hold of you?
So right now, go to humanhealthspecialist.com and you can sign up for our free newsletter. I got some really, really amazing things coming out in the near future. I'll make sure John and everybody here knows about it. And I got a lot of really cool stuff that I'm excited about. It's just not ready yet, and I want to say go here, and it doesn't.
Well, yeah, have Tom, human performance specialist. He's in Scottsdale, Arizona.
Well, human HPS is the company name, but the website I gave was Human Health Specialist.
Oh, Human Health Specialist. HPS is the company.
Yeah.
He's in Scottsdale, Arizona. You can get him if you get any contact information. We can provide it you're on the site. And other than that, thank you very much. And see you later.
And I look forward to meeting everyone.